A very good morning, everyone. Hope yesterday you had a great session. Today, I welcome you all to the 5th International Conference on Food and Nutrition, organized by Universal Society of Food and Nutrition, USFN, and associated with Padma Shri Institute of Management and Sciences, Vasant Kanya Mahavidyalaya, admitted to the privileges of Banaras Hindu University, Varanasi, and University Malaysia, Kelantan. I'm sure you had a great session yesterday with us and hope to see the same enthusiasm from all our presenters and attendees today. I would like to welcome all our honorable dignitaries and eminent speakers. First keynote speaker, Dr. Anuradha Maniam, Principal of Padma Shri Institute of Management and Sciences. Dr. Nandan Joshi, Head Medical Affairs, Nutrition, India and Emerging Markets, Dr. Reddy's Laboratories, India. Dr. Madhavi Marathe, Senior Manager, Healthcare Nutrition Science, India. Dr. Geeta Chauhan, Principal Scientist, Division of Livestock Products Technology, ICAR, India, Indian Veterinary Research Institute, India. Ms. Gillian Fish, Founder and CEO, 6am Agency, Australia. And session chairs, Professor Mrs. Vijaya Kadar, former Dean, Acharya Nagarjuna Ranga Agriculture University, India. Dr. Raghunathan M.R., Visiting Professor, Padma Shri Institute of Management and Sciences, former Principal Scientist, Indian Council of Agriculture Research, ICAR, India. Dr. Suhana Zakaria, Senior Lecturer, University, Malaysia, Kelantan Zelly Campus, Malaysia. Ms. Divya Puri, Assistant Professor, Department of Nutrition and Dietetics, Manav Rachna, International Institute of Research and Studies, India. Dr. Anurag Singh, Associate Professor, Department of Food Technology, Harcourt Butler Technical University, India. Dr. Kshetrimayam Vedamani Devi, Assistant Professor, Home Science, Dhanvanchari University, India. Dr. Anshu Shukla, Associate Professor, Department of Home Science, Vasant Kanya Mahavidyalaya, Kamcha, India. I welcome you all again for the International Conference on Food and Nutrition. I hope you all will have a great day with us today. Now, I would like to welcome our keynote speakers of today. I would like to welcome our keynote speaker, Dr. Anuradha Maniam, Principal of Padma Shri Institute of Management and Sciences, India. Ma'am, please. Ma'am, sorry to interrupt you. You're on mute. Kindly unmute.
Yeah. Good morning, everyone. Hope you had excellent sessions yesterday, and today you are going to have the same. Let me speak about herbal industry, past, present, and future. This herbal supplements in the past and present and future really having a very great role in maintaining health and also in various other segments. Today, let us know about herbal industry, a glimpse of it, herbal supplements, challenges, and opportunities in the same. World herbal industry marks up to 80 billion US dollars with an annual growth rate of 7%. By 2050, as per WHO, their estimation is it will reach up to 6 trillion. Herbs serve 80% of world's population for their primary healthcare needs even today. 25% of our prescription drugs are sourced from plants and plant resources, either synthetic or semi-synthetic products. Whatever data I'm giving, it is data, it is pre-pandemic period which is estimated. Post-pandemic, it is much more. When it comes to Indian herbal industry market, it is estimated as 4,205 crores, and export of Ayurvedic drugs and allied health products is estimated up to 440 crores. And by 2020, it is estimated to reach 7,000. As I told you, it is growing exponentially. By 2025, it is expected to reach 4 billion to 18 billion. And again, I'm insisting that it is pre-pandemic data, what I'm presenting. Post-pandemic data, it is exponentially grown. Some of the products have reached 3,000% also, especially curcumin and other immune boosters. India is bestowed with large number of herbs, and it is the largest ethnic society and rich in biodiversity. 45,000 species of wild plants are sourced from India, out of which 9,500 species are ethnobotanically very, very important. When it comes to the status of the herbs, we have 20 agroecological zones and one of the 17 mega biodiversity hotspots. 7% of the world biodiversity is present in India. 17,000 flowering plants, 9,000 species used in Indian systems of medicine and folk medicine. 1,172 species are traded, of which 242 with a consumption more than 100 metric tons. 40 species are in high demand, sourced through cultivation, remaining all through wild sources. That indicates that the opportunity which is present in the herbal segment. And we have reputed universities and institutions in India, starting from Central Institute for Medicinal and Aromatic Plants, NBRI, NTRI, BSI, AYUSH, and NMBP. India is repository of more than 7,500 medicinal plants. Apart from that, there are many, many unknown medicinal plants and related species. Herbal markets are being segmented and used in an array of industries and sectors. It is being used in Ayush formulations, and it is used in proprietary and ethical OTC medicines, which constitutes both nutraceuticals, herbal medicines, and standardized herbal extracts, and also pure herbs. And herbal cosmetics is having huge, huge potential. These are also supplements which are used for the skin health and hair health and other cosmetic uses. Herbal teas, and there is no end, so sky is the limit for this. Functional foods and nutraceuticals, another big herbal segment. Apart from this, you have herbal extracts, phytochemicals, and pure chemicals and standardized resins, gums, colors and pigments, flavors and fragrances, aromatic oils and aromatherapy, culinary herbs and species, and veterinary herbal products, which is a very, very important segment. They use to increase cows' milk production and also to treat many diseases, because herbs are integral part of the diet of livestock and also diet of human being, which was taking care before these other modern systems of medicine have been emerged. As a glimpse, I want to show how herbal industry is being, how it works. See, you have herbal industry where you can have different value chain. This is an unorganized segment. At the same time, it starts from the forest and also ends in the highest consumer, like a very light consumer who has its utility in the form of pills, capsules, syrups, creams, and other things. It has been either sourced wild or it has been sourced from the cultivated market. And it can be sold as raw herbs, raw purified herbs, which are traded, segregated, and graded by the value addition, by the value adders. And these warehouse people, they grade it based upon the color, based upon the texture, based upon its active principle. When it comes to higher segments like industry, they look for the active principle whichever is present in the herbal industry. One particular herb itself is being adulterated and it is being pushed into the market when there is a high demand. But this gradation part will take care of this. They use all pharmacognostical and other techniques and they grade it and value add it. You have pure herbs and herbal powder traders. That is also a very big segment where you get a just pure herb, starting from people who just powder it and market it in the form of a pure herb for the OTC product for the consumer who wants to use it at home. And there are herbal traders, powder traders, who do it in tons and tons together. From India alone, you have largest exports of amla, largest exports of Gymnema sylvestris, which is otherwise called as Madhunasini, Vithania somnifera, and there are many more which are used in this particular industry. Coming to crude extract manufacturers, it is first level of extraction, where extraction is being done either by water, which is called as an aqueous extract, otherwise it is called as alcohol extract or solvent extraction. And this extraction, there are various methods and procedures, starting from aqueous extraction to, which is a distillation extraction, to latest carbon dioxide extraction, which is called as supercritical fluid extraction. Till there, you have an array of segments. I told you, at the every level, there are a primitive person, and also there are advanced scientists and workers who are working in this particular segment. This crude extract, as it is, get into many industries, which I have listed on either side of this PowerPoint, and otherwise it gets into partial purification or enrichment of standardized extract. For example, if you take only curcumin alone, you get curcumin crude extract, where it is being standardized to 5%, 10%, 20%, 30%. It goes up to 99% purity also, where they do this purified extracts. And this partial purification and complete purification is another big segment where a lot of high-end industries are working on. And this completely purified ones get into therapeutics, and partial purified ones get into herbal standardized extraction formulations, like in Ayurvedic and other herbal extraction formulators. And finally, it reaches consumers. It has been used in health foods, flavors, aquaceuticals, cosmeceuticals, fishery products, perfumery, and many more. And a demand from health sector, I don't want to spend more time on this. It is very clear where the demand is being there in every place, like starting from, it is only talking about health sector. I'm not talking about other segments. As I told you, it goes into, even it gets into textile industry, and it gets into many other industries like winery, beverages. Every industry has got a place for this herbals. This is also the trade, what is happening. You see, this is majority of it is coming from the forest. So forests are getting dwindled. You have an opportunity here. Why these plants are not being cultivated, why these herbs are not being cultivated, either it is used in the form of supplements or it is used in the form of whatever, so it is. Why it is not being cultivated? Because lack of cultivation procedures, lack of tissue culture procedures, lack of identification methods, lack of planting stocks. There are many. If you take only from the raw material point of view, you have so many challenges and so many opportunities. Coming to challenges, as I told you, the secondary metabolite is an important segment. Plants produce both primary and secondary metabolites. Primary metabolites are used for their primary function, whereas secondary metabolites are used for its only defense or pollination or some other purposes. When it happens that secondary metabolites are used only for these purposes, plants will not produce in high quantities. It produces in very, very low quantities, and they depend upon the season, nutrition, and methods, and it's the disease what the plant gets, because this is the concern of the plant. It will not spend its energy for producing the secondary metabolites unnecessarily. When it needs it, it produces. But we need the secondary metabolites in large quantities. The variations in secondary metabolites, because of its cultivation methods, the season, environment, micro and macro climatic regions, is the biggest challenge. And the second thing is quality concern. When there is a demand, lot of adulteration is going on in this particular thing. There is a concern, because when you see the powder, like normal powder only, you cannot make a difference whether it is a curcumin powder or it is been adulterated with some other thing. Even if you take a raw herb, roots look alike. For example, Jeevanti, Leptidemia reticulata, roots are being adulterated with so many things, including your pepper is being adulterated with papaya seeds. It has been adulterated because they look alike. Until unless you have very good testing methods and quality approaches, it is very difficult. And non-availability of raw material is the biggest concern. During the pandemic period, there is a shortage of turmeric, shortage of Vithania, shortage of Amrutaballi, that is Tinospora cordifolia, because these are all immune boosters. So these made them to do unscientific collections. They have collected prematurely, where the active principle will not be to that extent what we have expected. Are they, especially gums and resins, they collect very, very unscientifically. When they do this, finally you are going to lose the tree which is producing the very precious gum, and adulteration is another problem. Coming to their taxonomic identification, when you talk about Jeevanti, Jeevanti is there for many plants when you take Ayurvedic text. But as per the nomenclature, botanical nomenclature, only Rhaphidinia reticulata is Jeevanti. So you need to really get a good taxonomic identifications before using it in your herbal industry or herbal supplement. Redundant data. Data is being redundant. Somebody will just publish one paper for the sake of publishing. They would not have done lot of clinical trials or lot of experimental models. They say that this may have this kind of side effect. Immediately it will percolate and it really hampers the industry, hampers the herbal segment. So it happened with many, many herbs. That is the reason why you need to have a very, very responsible publication. When you are giving publication or presenting in a conference like this, you need to have a responsible publication and present only proven data. Lack of tissue culture methods, problems with the planting material, lack of alternatives for low volume and high value products. And see, we talk so much, and there is no national level germplasm banks or international level germplasm banks for the tissue culture produced plants or the rare species which are becoming extinct with a blink of your eye. Every day, there are so many plants which are becoming extinct, and there is no germplasm bank where you can retrieve, even with the modern techniques, even with so much of cryopreservation techniques, we are not focusing on this national level germplasm banks. And then slow growth and prolonged juvenile period. When it comes to tree species, it is very difficult because the growth is very slow and the juvenile period is very long. Seasonal dependency is another problem, and presence of active principles in the unsustainable methods. It is present in the root. You take out the root. Finally, the plant is gone. That's what is happening when the active principle is present in the roots or in the bark. So you need to have scientific methods, and you need to really follow sustainable methods. And one more biggest problem here is regulatory affairs. You have very, very feeble regulatory affairs when it comes to herbal industry. It doesn't fall into pharma, it doesn't fall into food, and it is in between. So there is very feeble regulatory affairs when it comes to herbal industry. There, the irresponsibility of people are also coming into picture. But recently, when it comes to India, there are some regulatory affairs, regulatory mechanisms which have been put into place by Ayush. And IPR is the biggest issue. We talk about geographical indicators. There are many geographical indicators which are pertaining to only that particular country, only particular area, which has not been protected. You need to really take a GI tag of your own medicinal plant. And apart from that, there will be many other things, like when people can take, neem is being patented somewhere by somebody else, and turmeric is being patented by somebody else, and later we fought for it and we could able to retrieve, but the retribution will not give you authorization. You don't hold that patent right. It is only they also cannot have it and you also cannot have it. That will become in such a situation. So try to have a proper IPR division in your departments, in your institutions, so that you can protect this rare germplasm either by GI or by the other methods. Government policies also should be and policies, there is two ways for this. One is policies being made, and another one is policies being implemented. And there is a lot of gap. The policy makers are different. They are not the end users. And while implementation, that is a different segment. And then that implemented policy should reach the consumer. That is also, there is a lot of gap. People are not aware of these government policies which are there for this herbal supplement industry. False information to conservation activists. There are many times they say that people are just cutting the plants, cutting the trees. Sometimes the information will be true and sometimes the information is false. Because of this, the conservation activists will become very active and finally it will not reach the people. When you are having conservation activity, and again there is a gap. The conservation activists are not linked to the people actually conserve. Activation is different, creating awareness is different, and people who really take interest to conserve that herbal plant is a different segment. There is a lot of gap in between all these things which need to be bridged. Ayush is doing a lot of trials and a lot of schemes and a lot of things in this particular segment, but still it need to be addressed globally. International conventions are required for this, and every country need to participate, and all the stakeholders should be members of this. False publications. As I told you, publication is being made for the sake of publication, for the sake of presentation, for the sake of having some impact factor or something. In that, a lot of data is being purged. And this purging of data really creating problem in the herbal supplement segment. What is the problem it is creating? Somebody says that even one publication which says that this particular plant may have long-term effect on kidney function, then it is immediately being banned for the utility as a supplement without doing proper trials, without doing a proper thing, and you cannot claim anything on this particular herbal supplement. This need to be channelized and this need to be worked out properly. And about the side effects and activities and extinction of the data is becoming extinct, and people, it is available, if you type one herbal supplement name in Google, you get hundreds and thousands of papers which need to be believed and which is just for the sake of marketing they are doing it, or it is a real data no one knows. As you open YouTube, you get hundreds of things that it says that this supplement will promote your hair growth, this will promote your skin texture, this is an anti-aging, and this increases your complexion. So many things are there, but whether they are true or false, where is the authentic data bank which is available when it comes to herbal segments? You have pharmacopoeias, you have many other books and many other important authentic data, but it is being mixed up with so much of data which is being published every minute and every second. When it comes to challenges in cultivation of medicinal aromatic plants, which are basically herbs, and these are having lot of challenges. One is lack of cultivation practices is one thing, and then coming to problems with availability of planting material. Why we don't have good cultivation practices? First thing is, though cultivation practice is available, it is available only for 30 to 40 plants. It is not as good as the cultivation practices which are available for rice, wheat, potato, tomato. Like this, you don't have cultivation practices for many herbs. And it is even farmer want to cultivate, planting material is a problem. Even the planting material is there, the link between the farmer and link between the herbal industry, the end user, is not being established properly. If a farmer is selling a tomato, he can sell it anywhere, but he is selling ashwagandha, where to sell, how to process it. This information is not going deep into the segment, and that is where this is the biggest challenge. Coming to seed-specific problems, there are problems with the dormancy, embryo abortions, and variability. Ashwagandha, which you source it from West Bengal and other parts of North India, is different from which is sourced from South India. Brahmi, which is sourced from Orissa, is different from which is sourced from South India. Because of this, seeds are also will have a lot of variations. You will not know whether the seed is giving quality material or not. Maybe morphologically, you can have some markers, but it comes to secondary metabolite, you need to really get connected to the testing laboratories. The people who are really giving a quality certificate for the herb which is produced in that particular area. This is another problem existing. Lack of tissue culture methods. When planting material is not available, you can use biotechnological methods and cultivate a lot of herbs, grow a lot of herbs. But the problem is there is no standardized protocol for many herbs which are not worked out by the people. And it is difficult to root plants. There are plants which are very difficult to root. One such plant is Leptidemia reticulata. It is very difficult to root. And because when it is difficult to root, vegetative propagation is tough. And even it may be tough in tissue culture methods also. Coming to sex-linked expression of secondary metabolites is another problem. When it is been sex-linked expression of secondary metabolites, when you grow a plant, if it becomes to be a female plant or a male plant, which is not producing the particular secondary metabolite which you are looking for, then again it is going to be a problem. Then non-availability of post-harvest methodology. You don't have a proper post-harvest technology which is being worked out for many plants. I don't say that none of the plants are having, but many plants it is lacking. Many herbs it is lacking. Now, I want to discuss about another 2 to 3 minutes time is there. I just want to tell about what are the opportunities. We discussed about the opportunities and challenges. There are a lot of opportunities in this herbal ingredient. For example, you can identify an alternative herb for expensive ingredient. One such example is, for example, saffron. Saffron is the one of the costliest herbal ingredient, which is having nutraceutical benefit, herbal benefit, medicinal benefit, and also culinary benefit. It gives a wonderful color, a flavor, everything. Saffron is been having crocin and picrocrocin. It is grown in very high altitudes of and low temperatures. It needs minus 4 degrees centigrade for 45 days to flower. The stigma of the flower is being used. For this, if you have an alternative, there is an alternative. For example, Nyctanthus is an alternative. That your Nyctanthus pedicel, which is orange in color, is having crocin and picrocrocin. It has been patented by us, and it is having this particular compound, which can be used as an alternative. And replacing synthetic food colors with natural colors. You have so many natural colors. All synthetic food colors are carcinogenic. Try natural colors, whether it may be from algae color to your food, because first you eat with your nose, smell the food, and then you see the food. If the food is tasty, but it is not colorful, people, it is not attractive, you will not enjoy the food. In such a scenario, all these things are interconnected. Your sensories are interconnected. In such a thing, don't use synthetic colors. They are all carcinogenic. Go for natural colors. Standardization of natural colors is one of the opportunity. And it is a supplement, and also it will work as a nutraceutical, and it also adds color. It is having multitudinous benefits. One such thing I can tell you, from Shankapushpi, you can get purple color. From Nyctanthus, you can get orange color. From beetroot root, you can get purple color. From algae, you have all colors like rainbow colors. You can get from algae, phycocyanins, flavonoids, polyphenols. There are so many things which are giving anthocyanins, colors from the herbs. And these are all from the sustainable things, like they are either taken from flowers, are taken from the pedicels, are taken from the petals. When you are having this wide arena of natural colors available, entire food industry can make a revolutionary change by using these anthocyanins, flavonoids, and other pigments. Coming to natural sweetness, you use natural sweetness for diabetic people, the aspartame and others. They're all having long-term effects. Go to natural sweeteners, like one such example is stevia. Rhodaniana steviosides are 600 times more sweeter than sugar. You can use a pinch of it, and it is stable at high temperatures and low temperatures. So you can use it in sweets, and you can use it in puddings. This is such a wonderful alternative and an opportunity. Coming to natural preservatives, people use natural preservatives, and this synthetic preservatives, again, they are dangerous to your health. You can go ahead with natural preservatives like rosmarinic acid, apple seed extract, grape seed extract. You have so many natural preservatives which you can use. Coming to plant-based protein supplements, which is having a very, very, very lucrative market. Everybody's turning into vegans. You have even a meatless meat, which tastes and texture is like meat, but it is not from animal source. It is from the plant source. Again, this is a very huge market, and which is a protein supplements, is a wonderful herbal supplement which is needed by all age groups. Then fortified and enhanced secondary metabolites only on biofortification and enhancement of secondary metabolites. I have 4 patents, which one of which is the US patent granted. And these area is such a big area. you need not less than 2-3 hours to just give insights of which will address the challenges what I told in the earlier slide. Processing technologies which preserve nutrients. You need to have good processing technology which will not only preserve nutrients and also herbal supplements and herbal actives, so that you can preserve them. Otherwise, if they are not stable, you will lose that wonderful herbal active principle which is present in the plant when we use unwarranted, unscientific methods of processing. With this, I think I have taken my 20 minutes time exactly. I thank all the organizers and I thank USFN BioLeaks and Padma Shri Institute of Management and Sciences for providing me this opportunity. My email ID and my telephone number has been presented. You can take take a note of this and send me queries if you have any doubts. Queries and doubts are always welcome. Thank you, one and all.
Thank you. Thank you, ma'am. Thank you so much for your informative session. If any of the participants have any doubts, kindly drop a message in the chat box. There is a question from my side, ma'am.
Yeah, please.
I guess you're on mute.
No, I'm not on mute. Joshia Roshini, I could able to hear you.
Yes, ma'am.
Yeah.
The question is like, as you mentioned, there are some challenges in the herbal industry. So what are the easiest methods like to reduce the challenges? Is there any solutions as of now?
Yeah, see, there are people working for it. I told you, the challenges are different way. The connect between the herbal scientists, food scientists, cosmetic industry is not established to the level it is supposed to get established. Challenges are from various levels, starting from the raw material procurement to extraction procedures to and its utility and usage. So you have challenges from the every segment. There is a challenge. You can pinpoint that particular challenge and you have a solution for that. It need to be worked out.
As you said, nowadays everyone are using the synthetic preservatives, food coloring aids and all.
Yeah.
So as you mentioned in the presentation, like we could use the herbals as the alternatives.
Yeah.
So I guess there is a lack in that standardization of herbals. So is that the reason like we are not going for the natural commodities?
No, it is not lack in the standardization. Cost may little go higher and awareness is another problem. I will tell you, you can use ascorbic acid, citric acid, and these are all from natural sources. You can use it. Apart from that, you have rosmarinic acid, apple seed extract, grape seed extract. There are some preservatives which are there, but the cost may little go up whenever it comes to synthetic counterparts. Apart from that, I will take another example. See, all this badam milk is being used. They use yellow color for the badam milk. And it has been people's mindset that badam milk should be in the light yellow in color. Many companies have started using curcumin in the badam milk. They are using a pinch of curcumin because you cannot use large quantities. Curcumin, even if you use very less also, it gives that yellow color. It replaced. Now that industry is completely using curcumin only. In a similar way, when industry starts using these preservatives, definitely people will get accustomed to that. And when all organic products are so expensive, but still people are buying it, right? In a similar way, you can say that this particular product is being used only natural ingredients like natural preservatives, natural colors, everything natural. That is why the cost is double the normal cost. There are people who are willing to buy. You need to penetrate into the market in such a way so that you have a solution for this particular thing also. It is not because of lack of standardized methods. You have very good standardized herbal extracts, herbal preservatives available in the market.
Okay, ma'am. Thank you. Thank you so much for clearing out the doubts also. Thank you. Next, we would like to move on to our next keynote speaker. Our next keynote speaker is Dr. Nandan Joshi from Head Medical Affairs, Nutrition, India and Emerging Markets, Dr. Reddy's Laboratories, India.
Yeah, thank you, Joshua. Can you see me and hear me fine?
Yes, sir.
Okay, thank you so much. I think some light is coming. Okay, I hope you have to bear with it. Okay, so I'll share my screen. Just give me a moment.
Yes, sir.
Okay, I hope you can see it now, right?
Yes, sir.
Sure. So first of all, I would like to thank the organizers for inviting me, and thanks to the participants for turning up in the morning in such a good number. So the topic I've been asked to talk about is the relationship between the nutrition and immunity, or rather immune system, and how are they connected. I'll take next 15 minutes or so to take you through this topic. And if you have any questions, you can drop it in the chat box, or we can take it at the end of the session. First of all, the disclaimer: the views and opinions I'm presenting are my personal views, and they're not representative of my organization, current or the past. And I think we'll share the presentation at some point, but make sure that it will contain copyrighted material as well, like graphs and pictures. So just a disclaimer. So before we go into the relationship between nutrition and immunity, it's very important to understand what is immunity, because I think a lot of time we have a very narrow view of what immunity is, which largely the common belief is protection against infection. And that's what I think during the COVID, I think we all overdid it a little bit. You must be seeing hundreds of launches every month, almost from pillows to the food item to bed sheets to everything. I saw n number of products talking about immunity, which is largely talking about how can you protect yourself against infection. But that's not all. Actually, immune system itself is the sixth organ, and is a sixth sense organ beyond the five sense organs we are known of. Okay, so what are the other functions of immune system? The first is, of course, defend against pathogen. But the very important thing is it's constantly removing any cells which are not behaving properly, which is what we call early tumor cells. So immunity keeps a watch on any cells which is not behaving the pattern and likely to turn into a tumor cell. They keep removing it. Removal of any foreign compounds which is harmful. So that is another very, very important aspect that immunity plays. Control autoreactive response. So a lot of time, it's very important to distinguish between what is your own tissue and what is the foreign material. A lot of time our own tissues present as antigen, and that's what we see. When that goes wrong, you will hear things about autoimmune disorder like rheumatoid arthritis. There are many more which are autoimmune disorders where your own antigens are not recognized by your own immune system, and they create antibodies against it. And tolerating, or controlling or tolerating the beneficial foreign compounds and not getting that allergic reaction. If you fail to do that, you're likely to develop allergy even to the beneficial compounds that you are ingesting or inhaling. So all of this is all interconnected, and even beyond that, I think immune system probably is one area which is still quite evolving, and I'm sure in the days to come we might discover, and I'll talk about some of those in terms of what else immune system is really responsible for. When we say that, I think just to elaborate further, this concept called as yang. Yang yin is a Chinese concept, which means there is some black in a white and there's some white in a black. So it's basically a balance between good and evil good and bad. So that's or two sides of a coin. That's what we call it. So similarly, immune system has a similar role to play. It has to accept the healthy cells of the body. It has to tolerate the foreign material which is beneficial, and it has to fight against the foreign intruder which are harmful to your body. So you have to maintain the balance between all three things. And if the balance, when this balance goes off, that is when we say that, okay, this immune system is now challenged or compromised or affected. Okay. Now, as we all know, everything begins with gut. Just to let you know, I mean, so I'm a medical doctor by education. And during my MBBS days, which is 25 years back, there was no gut in the immune system. I mean, what we learned about spleen, we learned about bone marrow, but there was no chapter on gut. So you can imagine this gut has evolved in last 20 years, or the knowledge around the gut has evolved in last 20 years or so. It's a very complex neuroendocrine immune organ, which is largely, in simple way, your small intestine. And now it is discovered that the body is almost 70% of immune cells reside in small intestine. It is connected by almost 100 million neurons. So you can imagine the kind of connection it has with other organs and brain. Surface, so this is the biggest thing, right? Compared to any other immune organ, this is the organ which has highest surface. So highest possibility of multiple interaction, because as the surface area increases, in every square centimeter, or rather every square millimeter, there will be some kind of interaction going on. And what we call now, I think this is a common term which everybody knows of, which is called as gut microbiome or gut microbiota, and it is considered as there are 100 trillion bacteria reside in gut, and so 100 trillion number is more than the number of cells in our body. So there are more number of bacteria in our gut than the number of cells in our body. So if you understand this, it becomes very important to understand that this is where the interaction is happening. You know, the gut. So if you think the food is passing through this gut, so you can imagine when the food is passing through this gut, where 70% immune cells reside, 100 million neurons taking the signal from what these foods are telling us, and 100 trillion bacteria to interact with these food items. So naturally, dietary intervention or whatever diet we are having, it becomes a tool for immune regulation. So diet and immune system, once you understand this, you understand that there is no doubt that they are highly interconnected. And probably compared to bone marrow, compared to spleen, compared to thymus or any other immune organ, you know, there are other immune organs are not even exposed to external stimulus. This is probably the only immune organ now which is exposed to external stimulus. And so this this tells you two things. Either if you eat wrong, you know, there are a lot of things that can go wrong with your immune system, but you have also an opportunity to eat right and make sure that the immune regulation is going in the right direction. So there's a very nice term that is called as immune fitness. Just like the overall fitness for which we go to the gym, similarly, the immune fitness is equally important. Okay. Now, there are three types of microbes: symbionts, which are called as the beneficial microbes, the pathobionts, which are harmful, and there's something called as commensal, which are basically they are neither good nor bad, so they are okay, but they have also a lot of function to play. So overall, you need to have a right balance between all three, and that's how the fitness is maintained. The moment if the balance tilts, the number of, let's say, if number of pathobionts increase in the gut, what happens is then the immune balance goes for a toss, and therefore you see the dysregulation. Now the dysregulation can be manifested in different ways, starting from inflammation. It could also lead to infection because of the poor immunity. It can lead to allergy, and now it is also shown that in a long run, this kind of dysbiosis for a very long period of time is also responsible for certain chronic disorders like IBD, IBS, obesity, even, and diabetes. So I'll come to that point as well. And what are some of the things you observe when this goes for a toss? So especially in children, because see, the children gut microflora is developing. It is not stable as adults gut microflora. So you will see that children are the ones who will first see any kind of impact of gut dysbiosis. And that starts with infection. As we know that children, I think currently, I mean, I was just reading the data yesterday, the most recent data. The frequency of falling sick often has gone up post-COVID era. And at least there are 4 episodes per year now on an average. So you can imagine, so there are children who might be having 7 to 8 episodes in a year as well of upper respiratory tract infection. Similarly, if you see allergies, so these are some of the symptoms, atopic dermatitis, etc. You'll see the allergic manifestation. In long run, you will also see diabetes and obesity being developed. And how this is interconnected, as you know that diabetes, I mean, there are, now there is a hypothesis that a diabetic, the certain kind of microflora development is one of the reason behind causing diabetes, and that is linked with the dysbiosis. So it's okay. One aspect we all know of is the insulin sensitivity goes for a toss. There are and also antibodies produced against, so that happens in type 1 diabetes. Then you will, you know that the ability of body to respond to the insulin goes down. But that is one factor that now coming into the picture is this particular type of gut microflora, which is commonly seen in diabetic patients with certain profile, is considered as responsible for. It's one of the reasons for developing diabetes. Necrotizing enterocolitis, I will not comment to it. Can you please go on mute, everybody? It's very, very commonly seen in babies. And even in the long run, cancer and cachexia is also linked to immune system. I'll not go there. There's a lot of things to discuss. But if we, okay, so what causes gut dysbiosis in an early stage of life? Because that's the stage where you will see most commonly the gut dysbiosis. So they say there are 2 common reasons for it. One is the mode of delivery of a baby. So the baby who are born vaginally, they have a very, very proper gut flora with a very nice balance between commensal bacteria and pathobionts. The babies who are born by C-section, they are likely to take bacteria from the skin of a mother because their route of delivery is through the skin, and they acquire most of the hospital pathogens very quickly. So you will see more staphylococcus in the babies who are born through C-section. So that is the beginning of dysbiosis. And then comes the first food, which is breastfeeding. Breastfeeding versus cow milk versus formula feeding. There are numerous studies now which are published shows that there is a different gut microflora, and the most ideal gut microflora with a proper bifidobacterium, lactobacillus abundans is only found with breastfeeding babies. Just to connect this to the long-term studies, so human milk oligosaccharide or HMOs is what is found in the human milk is responsible for this immunomodulation. And they have shown that in the long-term studies that the babies, the HMOs which is derived from the human milk help reduce diabetes in the later period of life. So it's all interconnected, and it's a big topic, but I'll try to see whatever I can cover right now. Anyway, so since we're talking about breast milk, few more things to add. It is being said that there are more than 100 components in breast milk, and I think they're still being discovered. Just from an immunity perspective, omega-3 fatty acid, prebiotic, probiotic, nucleotides, immunoglobulins, these are the most common and most abundantly found factors in a human milk. And it has shown that babies who are exclusively breastfed for first 6 months, they had reduced risk of allergy and lesser incidence of upper respiratory tract infection during the childhood. And that is all attributed now to these components, which are known as immunomodulators, which are known to modulate the immunity among children. So this is the first food. So as you can imagine, since this is a natural food created by the nature is intended to put the immunomodulators in the first food. So I think that's, and a lot of infant formulas which are made these days, they are taking inspiration from mother's milk. So if you're familiar with the infant formula industry or the products, you would understand that now they are adding probiotics, they are adding prebiotics into the infant formula. The reason being that we have to go closer to the mother's milk as much as possible, even though it's impossible, but still, how can we mimic that? So that is the whole theory, and the benefits of these components are beyond immunity. But since our topic today is on immunity, I'm connecting these nutrients and their benefits to the immunity. So how diet and immunity is connected, it starts right from your first feed, right from the breastfeeding, and it continues throughout the life. So let's, I think the biggest thing you would see post the first year of life, I think all of you must be reading the data, NFHS. I think we have done much better job now in terms of improving the protein energy malnutrition among the children from 1 year to 5-year age. But we still see a lot of protein energy malnutrition in those children. Although our rates of stunting and wasting has improved, there is still much work that needs to be done. And the studies have shown that the protein energy malnutrition has a direct impact on the function of immune system. And it leads to lymphoid atrophy, decreased secretion of anti-inflammatory cytokines, decreased concentration of helper T lymphocytes, antibodies, and impaired, and also the impaired phagocytosis. So it's affecting both innate as well as adaptive immunity. So there is a direct link between, if you're deficient in protein and energy, you're likely to acquire more infections. And it has already been seen that the children who are wasted, they have a higher risk of acquiring these infections. So let's look at what are the nutrients or ingredients which are shown to have the immunomodulatory effect. Those with a very well established evidence are protein. I think protein is probably the most widely studied, and that's where I talked about protein energy malnutrition. And protein supplementation has shown to improve the overall nutrition status among children and the immunity. Immunity measured in terms of both cellular immunity as well as risk of infections. Okay. Vitamin and mineral are after protein are the most studied, especially vitamin D, vitamin E, zinc, selenium, vitamin C. So yeah, Zincovid, you heard about Zincovid during the COVID a lot. You heard about multiple vitamin mineral supplement. I think we all overdid a little bit there, but yes, all the vitamin and mineral everyday consumption within the RDA limit is extremely important. Omega-3 fatty acids, which came after, I think, probably a discovery of last 50 years or so. A lot of research has been done on DHA, EPA, and its impact on the immunity. Then comes prebiotics like oligosaccharides. The prebiotic is basically the food for good bacteria in your gut, and the probiotics, which is the live bacteria, which confer specific benefits. There's good and well-established science around that. And I think last 10 years or so, we are seeing some new emerging trends, whether it's agnesia, garlic, T catechins, EGBG, I think so many components are now coming in, beta glucans, curcumin. Curcumin, although we know that haldi is a age-old science, but a lot of studies are being done on curcumin and specific effects. Now, having said that, there are a lot of limitations also in terms of how much they can really impact your immunity when you take it as a part of diet or as a supplement. The first thing is, there's a really good data on deficiency. So what happens if there's a vitamin D deficiency or vitamin C deficiency or zinc deficiency, how it impacts immunity. There's a lot of data on that. But if I supplement these vitamins and minerals, how much benefit it gives. So yes, there is a data on how it impacts the cell line, improvement in T lymphocytes, or improvement in phagocytic action, which is all in vitro studies. But very few human studies are there which actually talk about supplementation of these nutrients at certain level and its impact. It's all dose dependent, heavily dose dependent. So if you look at if you're giving health food drink to your children, it cannot have more than 1 RDA in the product formulation. But if you need to see the impact of vitamin and mineral, you have to give it at a dosage which is 2 or 3 times higher than the RDA. And only at that level you will see the benefit. And it lasts only as long as the supplementation lasts. So this is another challenge with most of these, especially with probiotics. The moment you take away probiotics from the supplementation, you see that the benefits disappear. And most of the evidence is on children, and very limited studies on adult. And I think which is probably also has to do because the gut-mediated immunity is likely to be influenced in children because children gut microflora is changing and there is an opportunity to make an intervention there. Adult microflora is 60 to 70% standardized based on the overall dietary patterns. It's well established. And to changing that also has been observed as a tricky situation. It's not that easy. Plus, the benefit of changing the gut microflora in adults and its impact on immunity has been, the evidence is quite limited on that. Although the gut microflora in Crohn's disease or, in IBD, IBS, you have seen more benefits compared to the direct correlation with the immunity. So these are some of the limitations we have to keep in mind. Having said that, a lot of these ingredients are important. There are so many, I cannot cover everything. I'll talk about 2 or 3 key components. Prebiotics. So inulin, if you look at inulin, good evidence in Crohn's disease, colitis, obesity, which talk about overall enhancement of both innate and adaptive immune response, modification of microbiota and increase in bifidobacteria. So it acts largely through increasing the good bacteria. So basically there is a fight between good and bad bacteria that goes on in the gut. If you are able to increase the count of the good bacteria, which is, for example, bifidobacteria, it helps definitely tilt the balance, improve the balance in the overall gut microflora. FOS, which is fructooligosaccharides, which is probably similar to inulin. It also, in addition, has role in decreasing the colon pH, reduction in overall lipid accumulation. It also helps in secretion of anti-inflammatory substances, etc. So it has certain role to play in chronic conditions. GOS, similarly, GOS is obtained largely from lactose, which is a galacto-oligosaccharide, which helps in improvement growth performance. So in children, there are now formulations available with GOS in it. And same goes for some of the other soluble fiber like guar gum and pectin. So good evidence on prebiotics overall. If you look at probiotics, again, very, very interesting area. You will see that in children, there are a lot of studies, especially related to respiratory tract infections with strains like, LGG. Then there's the B lactase, which has shown significant reduction in the risk of GI infections and diarrhea, which is also being used. And some of these are now commercialized. Treatment of acute diarrhea, there are a lot of benefits which are being observed using Saccharomyces boulardii. That is there. Then antibiotic associated diarrhea, there has been improvement. So, and then there are very interesting studies done even in India on necrotizing enterocolitis, which is basically the gangrene of a small intestine among babies who are born premature. And it has shown that the probiotic supplementation help reduce, that kind of necrotizing enterocolitis. So again, a lot of data on probiotics. At Dr. Reddy's, we are also experimenting with a lot of new things. I think we'll be launching this hopefully in another couple of weeks. Is another interesting immunity supplement with a specific compound known as beta-1316 glucan. Now, there are a lot of beta glucans available. Beta-1316 is specific because it is long. It is derived from yeast and it's a naturally occurring polysaccharide. It is extracted from baker's yeast, which is Saccharomyces cerevisiae. And this is something we have worked with, another research centers and seen a lot of benefits associated with beta-1316 glucan, which is this is one of the thousands available in the market, and they have a very, very, very interesting. Very interesting mechanism of action where when they are consumed, they broke down into very, very small particles and they are actually consumed by the phagocytic action, especially monocytes, macrophages, dendritic cells. And they break this Wellmune, or Wellmune is a brand name, but they break this beta glucan into further small fragments. And they basically they go and act, code the pathogens so that they are easily recognized by the neutrophils. and then the neutrophil can easily target them and create action on them. This whole cycle takes about 4 weeks. So this is also this is the immune programming. This is a classic example of immune programming, where a food consumed by you, a particular ingredient consumed by, is digested by immune cells, taken or digested in the digested and carried by the immune cells throughout the body, and they are released. And when they are released, they go and tag the pathogens so that the neutrophils and phagocytes can easily attack them. So this is a very, very interesting one. We are working on this, and hopefully we'll have the product out very soon, this month itself. So this is just one example, and there are thousands of such ingredients which are now available. So yeah, so essentially, you can modulate the immune mechanism, but I think we are still in a very, very early stages of those research. It will take at least few more years and a lot of studies to reach to a conclusion, in terms of how it exactly affects and at what dosage. And you need more human studies, you need more Indian studies as well, in order to arrive at certain conclusions. Just a minute, slides. Okay, so that's a quick presentation from my end. It's a very vast area. I tried to cover a few key aspects of it. I hope this was helpful to all of you.
My name is Dr. Raghunath. I'd already asked this question on the chat box. My question was, since you said in adults there is a stability of the microbiomes attained, how do they respond to administration of pro or prebiotics? Like, what I mean is, does it come back to the original base status after some time once you stop administering them, or is it really beneficial in the long run?
Yeah, so very good question. Actually, compared in adults, there are more studies on probiotics, very less studies on prebiotics in adult. Probably I'll not be even able to comment on prebiotics in adult. There are more studies on prebiotic in children. Yes, so in adult, the studies on probiotics, the benefit, whatever condition you are taking it for, whether there are specific probiotics which are now has shown very good results in Crohn's disease, in IBS, IBD. Once you stop taking those probiotics, maybe after a week or two, you start the benefit disappearing. Again, you see that the symptoms return. So there is no long-term programming or long-term benefit observed with probiotic in adults. Yeah, and even in children, probiotics alone, it has observed that there is no long-term impact. You have to take it with either prebiotic. So prebiotic have shown some long-term impact in children in allergy, where 6 months of supplementation in the first year of life have shown that there is a prevention of further allergic march, what they call it, the progression of different allergies, has been prevented by 6 months of supplementation early in life. And that is observed also with a combination of pre and probiotic together, but not just with probiotics. So that is now quite evident. Yeah.
And if you could hazard a guess, why do you think that happens, that we always tend to come back to the original flora other than the administered microflora?
No, there's not hazard. I would say basically I think the way it acts is, it can change the flora to a certain extent during when you are taking it every day. The moment you stop, does the symptom worsen? Yeah, that's interesting one. We have not, at least in the IBS, I have not seen worsening of the symptoms in terms of after removing. Probably, but it does come back. That's what we have seen. The symptoms are back. Yes, so I don't think it worsens. At least I don't have the evidence to confirm say it worsens. So definitely, but so the idea is you have to take it for a long-term period. That's the whole point. Yeah.
Thank you.
Thank you, sir. And thank you so much, sir. And there is a question from my side too.
Sure.
As like nowadays everyone are going for vitamin supplements. Does it show any effect on the gut microbiota?
No, not so much on the gut microbiota. So vitamins and minerals do have a direct impact on the immune cells, both on innate and adaptive immunity. It's quite evident now. A lot of studies are there, but not so much on the gut microflora. No.
Okay, and is that okay to take vitamin supplements as a capsules on a daily basis?
Ideally, see, if you're not, so there are two answers to that. Whatever you can get from good food is considered as good. I mean, I think also we'll talk about that. But if you look at especially urban diet, okay, and our diet, I have personally observed, and we are not getting enough, and certainly not getting everything. And if you are a vegetarian, then you are definitely not getting certain vitamins and minerals. So I take it every day, up to one RDA, not beyond that. So I think it's important, and I think especially children, young children need to get it to certain stage, and then I would say 40 plus, you should definitely take it, because again, once that's the beginning of early aging, and that's where you will see that the bioavailability also gets affected, and your absorption starts slowing down slowly. So that's a very good time when you should uh, again think about taking it every day. There is no harm in it as long as you are taking it in the limits. And,
Thank you, sir. And there is a question from a chat box.
okay, sorry.
Does consumption of prebiotics overcome gut dysbiosis?
Yeah, that's a very
Sorry.
good question. Yes, so so consumption of prebiotic actually is more beneficial compared to a probiotic. The reason I always say is because prebiotic are not strain specific. So when you talk about probiotic, you're talking about only one strain, right? When you take prebiotic, it helps all the strains, all the commensals and healthy bacteria to take that prebiotic and ingest. So the chances of you developing a healthy microflora or regrowing a healthy microflora are higher with prebiotics. If you're taking probiotic, it definitely helps, but with a specific strain, if you're targeting for a certain condition, then it's more beneficial to take probiotic. But gut dysbiosis, largely, yes, you can overcome with prebiotic, and more so in early life as compared to it does lead to flatulence and distension. There is no doubt about it. So you have to just keep an observation key how much prebiotic you are taking. How to choose the right probiotic? Yeah, that's a very good question. So again, I think probably if you're looking at, so there are now general strains which are available, which are meant for certain conditions. You can take it as a regular probiotic, but largely I would say you consult your doctor. That's the right thing to do if you're looking out for a specific condition to take probiotic. Yeah. Okay. So yeah, thank you, Joshua.
Thank you, sir.
Yes.
Thank you so much for your informative session. Like, I guess most of the doubts are also cleared. Thank you, sir.
Thank you.
Next, I would like to move on with our next keynote speaker. I would like to welcome our keynote speaker, Ms. Gillian Fish, founder and CEO, 6am Agency, Australia. Ma'am, please.
जाइए दिखाए जाइए अभी लूटपाट नहीं करता है।
So sorry for the interruption, participants. We would like to move on to our next speaker, Dr. Geeta Chauhan, Principal Scientist, Division of Livestock Product Technology, ICAR, Indian Veterinary Research Institute, India. Ma'am, could we have you please?
Is it visible, Joseph?
Yes, ma'am, it's visible.
Okay.
Ma'am, sorry to interrupt you.
Am I audible?
Yes, ma'am.
Okay. A very good morning to all of the participants present over here, the senior members present over here, and also the keynote speakers from various countries. I will be discussing something about, since yesterday we are listening about the various aspects of foods and nutrition and the various interesting topics starting from the various dietary components related to fats and all, and how we are going to streamline our dietary intakes, which is in turn is affecting our health and all. So I will be discussing something about the eating disorders that are definitely not visible, but are the, I will say, the silent or the hidden culprits which are affecting our society, especially our children and the women mainly. Also males are affected, but mainly in the women in the puberty stage and also after the puberty stage. So to introduce what we call is eating disorders are the behavioral conditions characterized by severe and persistent disturbance in eating behaviors and associated distressing thoughts and emotions. These can be very serious conditions affecting physical, psychological, and social function. And this is the definition given by American Psychiatric Association. So we can say that EDs are defined as deviations in eating patterns that lead to disease or disability, especially cachexia or obesity. So there are two extremes. There can be thinness, or another can be the gain in weight or the fatness, we can say. This can be classified on the basis of their visible results. It may be extreme thinness or fatness. And in other terms, or in other words, we can put them all together as this is the unhealthy emotional relationships with the food. And in the coming slides, we'll be discussing it's not only the emotional relationship with the food, and also our emotional relationships with ourselves, only how we perceive ourselves, how we deal ourselves, and how we see ourselves. So these are the topic today of the serious concern, and these are the serious conditions which if persist for long time, they negatively affect our health, emotions, and also the ability to function in important areas of life by causing the serious nutritional deficiencies. So to discuss about something about how many kind of eating disorders are here, let us have a glance on it. The first is anorexia nervosa. Anorexia nervosa is the restriction of food intake relative to requirements, leading to significantly low body weight in the context of age, sex, developmental trajectory, and physical health. And in this dietary behavior is driven by an intense fear or gaining weight or becoming fat. So we have a self-perception, always thinking that we are having overweight, we are dealing with the obesity, or we are having unhealthy self-image, and by which our food habits are being driven or being set. So this is a kind of disturbance in the way one experiences and appraises their body weight or shape. Anorexia nervosa is characterized by self-starvation and weight loss. So as we are assuming that we are on the higher weight side, so we will be like to control that. So for that, we'll be going for the lesser intake or for the starvation, and which will lead to the lesser nutrient intake, to the lesser food intake as per the requirements of the body or as per the recommended diet allowances, and which will definitely be causing the weight loss and other nutritional deficiency disorders. So there are basically two types of anorexia nervosa is considered. The one is the restricting type. So to control the weight or to control the weight, we have the two ways. Either we can go for the restriction, or another we can go for the whatever we have taken, we just bring it out. We are just subtracting something from the body. So the restrictive type includes in which the weight loss is attained through dieting, fasting, and or excessive exercise with an absence of binge, purge, or behavior. So here we are just controlling the intake. And the binge eating or purging type anorexia nervosa means the individual has engaged in recurrent episodes of binge eating and purging behavior, such as self-induced vomiting, misuse of laxatives, and diuretics. So whatever we have taken, we just want to bring it out from the body. So that becomes the psychological problem in that sense. So how the severity is determined, how we can say that now this is really the eating disorder and this really needs some kind of treatment or some kind of counseling, or we should go for some kind of medical help. So it is defined that the body mass index, of course, is depend on the weight for age, which will be weight for height, which will be lesser because of the lesser food intake or the lesser nutrients intake. And it is said that if the BMI is less than 15, it may be said that it is the most extreme cases of this disorder. And this is generally very common in pubertal and post-pubertal females with anorexia, often experience amenorrhea, and this is because of the extreme weight loss. So it's not only the one symptom, but another nutritional deficiencies also come together. So what are the basic symptoms? How we can say that this may be a scene of anorexia nervosa? There may be extremely restricted eating or intensive and excessive exercise. There may be extreme thinness and a relentless pursuit of thinness and unwillingness to maintain a normal or healthy weight, intense fear of gaining weight, distorted body or self-image that is heavily influenced by perceptions of body weight and shape, and denial of the seriousness of low body weight. Also, the problem is that the patient is always in the denial mood. So regarding the severity, anorexia nervosa can be fatal. It has an extremely high mortality rate compared with other mental disorders. And the patients are at risk of dying from medical complications associated with starvation. So there is a kind of I would say the long-term starvation with the kind of ignorance. And suicide is the second leading cause of death for anorexia nervosa patients. So what are the long-term consequences of anorexia nervosa? This can lead to, if it's not treated for long time and it persists for long time, there can be severe malnutrition or the nutritional deficiency disorders. This may be thinness of bones in terms of osteopenia or osteoporosis. There may be anemia, muscle weakness and wasting, brittle hair and nails, dry and yellowish skin, dizziness or fainting from dehydration, and growth of fine hair all over the body, severe constipation, bloating and fullness after meals, low blood pressure, slowed breathing and pulse, damage to the structure and function of the heart, drop in internal body temperature, and which may lead to the cold intolerance, lethargy, sluggishness, or feeling tired all the time, depression, irritability, anxiety, poor concentration and fatigue, infertility, brain damage, and multiple organ failure if not treated. So we can say that it's not a very simple problem if it's not tackled at the earlier, or it's not diagnosed at the early stage. This may go far away. So the another is bulimia nervosa. Individuals with bulimia nervosa typically alternate dieting or eating only low calorie safe foods with binge eating on forbidden high calorie foods. And so this binge eating means it's a eating of large amount of food in a short period of time, and it is associated with a sense of loss of control over what or how much one is eating. So binge behavior is usually secretive and associated with feelings of shame or embarrassment. So it's very difficult to diagnose the problem. And binges may be very large, and food is often consumed rapidly beyond fullness to the point of nausea and even discomfort. Binges occur at least weekly and are typically followed by what are called compensatory behaviors to prevent weight gain: fasting, vomiting, laxative misuse, or compulsive exercise. So the on one part we are eating more, and another part we have consumed more, or in high amount we are in the guilt, and now we want to compensate the things. So persons with bulimia nervosa are excessively preoccupied with thoughts of food, weight, or shape, which negatively affect and disproportionately impact their self-worth. And slightly underweight, normal weight, overweight, or even obese may be the seen in these patients. And if underweight, they are having anorexia nervosa, binge eating, purging type, not the bulimia nervosa. So this is the typical thing, that they are eating more, and underweight is not there, but there may be some kind of overweight, or the obesity may be there, and no underweight, and because behaviors are hidden, they may go unnoticed most of the times. So in these frequent trips, so how we can diagnose, or we can observe that the person or the child or the person is suffering from this. We can just observe him that frequent trips to the bathroom right after meals, and the large amounts of food disappearing, or unexplained empty wrappers and food containers, and chronic sore throat, swelling of the salivary glands in the cheeks, dental decay resulting from erosion of tooth enamel by stomach acid, heartburn and gastroesophageal reflux, laxative or diet pills misuse, recurrent unexplained diarrhea, misuse of diuretics, that is water pills, and feeling dizzy or fainting from excessive purging behaviors resulting in dehydration. So this can be very severe, and it can lead to rare but potentially fatal complications, including esophageal tears, gastric rupture, and dangerous cardiac arrhythmias. Medical monitoring is important, hence, and cognitive behavior therapy may normalize eating behavior and manage thoughts and feelings that may cause the disorder. Then another eating disorder, these are the main two eating disorders on the extreme side. One is on the less intake, and another is on the higher intake. Beside this, we are having the binge eating disorder. And as in bulimia nervosa, people with BED have episodes of binge eating in which they consume large quantities of food in a brief period and experience a sense of loss of control over their eating and are distressed by the binge behavior. But unlike, they do not regularly use compensatory behaviors to get rid of the food, like they are not going for the vomiting, fasting, exercising, or laxative misuse. They will be just going on eating and eating. So the binge eating is chronic and can lead to serious health complications, including obesity, diabetes, hypertension, and cardiovascular diseases. So most of the communicable diseases or the lifestyle diseases may be there if the person is suffering from this disorder. And for the diagnosis, there may be frequent binges at least once a week or for 3 months. Then only we say that the person is suffering from or is having BED. Associated with this sense of lack of control and with 3 or more of the following features may be there. That is the eating more rapidly than normal. So speed of eating will be higher. Eating until uncomfortably full. So they will be going on eating and eating large amounts of food when not feeling hungry. Even the hunger is not there, but also they want to eat something. Eating alone because of feeling embarrassed by how much one is eating. Feeling disgusted with oneself, depressed or very guilty afterwards. And people with binge eating disorders are often overweight or obese because this is leading to the overconsumption. So there may be a kind of overnutrition there. And the most effective treatment is cognitive behavior psychotherapy and interpersonal therapy. Another is to the lesser extent avoidant or restrictive food intake disorder. So this include the group of disorders or the eating disorders such as lack of interest in eating food, avoidance based on sensory characteristics. That means they are not liking the food. It's the appearance, the food is not tasty, or the color is not good, or the appearance is not, or I don't feel the food appealing, or concern about aversive consequences of eating that prevents one from meeting nutritional needs. And this is associated with weight loss, nutritional deficiency, or failure to meet growth trajectories. ARFID, unlike anorexia nervosa and bulimia nervosa, there is no evidence of a disturbance in the way in which one's body weight or shape is experienced. So here we are not having the unhealthy emotional relationship with the body, but there are some other regions we some justify something different by saying by blaming the food, or any other reason are there to restrict the food intake. And this is not because of lack of available food, cultural practices, a concurrent medical conditions, or another mental disorder, anxiety or concern. So fear of choking, nausea, vomiting, constipation, and allergic reaction, etc. So the person has a perception in the mind, or maybe his previous experience, like when he was taking the food, there was some problem in the swallowing, or there was some choking. So he is so much scared of the things that he doesn't want to consume the food. He doesn't want to take the food. So this comes under this category. So the consequences of this include the significant weight loss or failure to achieve expected weight gain in children. Nutritional deficiency, of course, the intake is less. The need for feeding tube or oral nutritional supplements to maintain sufficient nutrition intake. Interference with social functioning, such as inability to eat with others or in the groups, and impact on physical and psychological health and degree of malnutrition can be similar to as in anorexia nervosa. However, people with ARFID do not have excessive concerns about their body weight or shape, and the disorder is distinct from anorexia nervosa or bulimia nervosa. Food avoidance or restriction develop in infancy, early childhood, and may continue in adulthood. So we can say that once the person catches this may go a long way. However, it can start at any age. RFID can impact families, causing increased stress at meal times and in other social eating situations. So this may lead some kind of tensions in the family because of the tantrums of the children not to take particular food and blaming the food, and that's why there is a tensed atmosphere at the meal times. So the treatment may be an individualized plan. Several specialists, including a mental health professional, a registered dietitian, or nutritionist, and others may be helpful in this. Another is PICA. This is another eating disorder, which is the persistent eating of non-nutritive, non-food substances in a way that is not developmentally appropriate or culturally supported. So there may be a kind of eating of various products or various non-food stuffs like paper, soap, hair, chalk, paint, pebbles, charcoal, or coal and clay, and even other things among the most commonly consumed stuffs. There are multiple causes. There may be iron deficiency anemia, or malnutrition, and pregnancy, and pica often occurs in tandem with other mental health disorders associated with impaired functions such as intellectual disability, autism spectrum disorder, and schizophrenia. In order for a diagnosis of pica to be warranted, behaviors must last for at least 1 month, severe enough to warrant clinical attention. So it's not like once the person has taken or the child has eaten the clay and we say that he is having pica. He should go in continuation with the same behavior. He should show the behavior for a long time, then only we can say that he is having some eating disorder. So the risk for potential intestinal blockages or toxic effects of substances consumed, this may be one of the risks. And the treatment may be testing for nutritional deficiency and addressing them if needed. And behavior interventions include redirecting from the non-food items and rewarding them for the healthy food habits. So that means we have to inculcate the healthy food habits in the children by guiding them or by taking care at the early childhood age only. Then we have the rumination. This disorder encompasses the repeated regurgitation of food, which may be rechewed, re-swallowed, or spit out. And for this diagnosis, behaviors must persist for at least 1 month, and regurgitation of food cannot be attributed to another medical condition. Additionally, rumination disorder is distinct from anorexia nervosa, bulimia nervosa, and binge eating disorder, and also ARFID, and thus cannot occur during the course of one of these illnesses. So we have the other specified in this disorder, another specified feeding or eating disorder. This is an eating or feeding disorder that does not meet full criteria for AN, BN, or BED. For example, individuals with atypical anorexia nervosa or atypical bulimia nervosa, they will be having all the characteristics, all the systems related to all these things, but they will not be qualifying into the perfect anorexia nervosa or bulimia nervosa. So they will be on some deviation from the outcome or from the final result. In some cases, this is because the frequency of the behavior does not meet the diagnostic threshold. For example, the frequency of binge in bulimia or binge eating disorder or the weight criteria for the diagnosis of anorexia nervosa are not met. So we don't say them they are having anorexia nervosa or bulimia nervosa. We generally say that they are having some other specified feeding disorders. Since speed of weight loss is related to medical complications, individuals who lose a lot of weight rapidly by engaging in extreme weight control behaviors can be at high risk of medical complications, even if they appear normal or above average weight. So other eating disorders, maybe they are to maybe some of the lesser extent, there may be compulsive overeating, maybe diabulimia, deliberate manipulation of insulin levels by diabetics in an effort to control their weight. Then drunkorexia, this is the purposely restricting food intake in order to reserve food calories for alcoholic calories, exercising excessively to burn calories from drinking, and over drinking alcohol in order to purge previously consumed food. So there may be some night eating syndromes. So nocturnal hyperphagia is also one of the eating disorders. Then we have the nocturnal sleep related eating disorder. It is a parasomnia characterized by eating habitually out of control. Then we have the orthorexia nervosa. This is the obsession with a pure diet, in which a person develops an obsession with avoiding unhealthy foods to the point where it interferes with the person's life. So it's not only that we are aware of the hygienic food or we are aware of the pure food, but in this it comes onto the level of kind of obsession. We are always thinking about the things that whatever we are eating, it should be pure, it should not be unsafe. So every time we'll be thinking, the thoughts like this will be floating in the mind. Then we have the Prader-Willi syndrome. It is a genetic disorder associated with insatiable appetite and morbid obesity. Then we have the pregorexia, extreme dieting and over-exercising to control pregnancy weight gain, prenatal and pregnancy weight gain. So this is some kind of psychological disorder. We can say that even during the pregnancy, they are restricting the diets, and just because they are having unhealthy relationship, the body shape, and they want to be in the figure even during the important period of pregnancy. And because of this, prenatal undernutrition may be there, which may lead to the low birth weight, coronary heart diseases, type 2 diabetes, stroke, hypertension, cardiovascular diseases risk, and also the depression. So the muscle dysmorphia is characterized by appearance preoccupation that one's own body is too small, too skinny, insufficiently muscular, or insufficiently lean. So we are always thinking, and this is mainly, I think, in the males, just to, because they want to show their body and always think of themselves on the weaker side or on the skinny side. So for this, that overcoming, they are going for this thing. Then purging disorder is recurrent purging behavior to influence weight or shape in the absence of binge eating. It is more properly a disorder of elimination rather than eating disorder. So what are the nature and severity of the eating disorders? There may be various ill effects of various eating disorders or the deviated unhealthy eating habits. Of course, we say that food is a basic need of the body. So whenever we are deviating from the normal food habits or the normal intake, I would say here that we are not taking our nutritional requirements as per our body's requirements, as per our physiological state, and so many things, or as per the recommended dietary allowances, there may be some kind of problem, definitely will be there. So in general, eating disorders, they have various complications depending upon their severity, depending about their length of period, and depending upon the level of restriction. There may be various complications. There may be acne, constipation, there may be osteoporosis, pellagra, cirrhosis, diarrhea, cardiac arrest, electrolyte imbalance, scurvy, amenorrhea, water retention, edema, hypokalemia, hyponatremia, kidney. There are so this is a package of, I would say, the malnutritional symptoms. So all the nutritional deficiency disorders or the nutritional deficiency symptoms may appear in the patient with eating disorders if it is if it stays for long time. So there may be, in general, there may be weakness, fatigue, sensitivity to cold, reduced beard growth in men, and the growth failure. There may be hoarseness, frequent vomiting, acid reflux, entry of acidic gastric material into the laryngo-esophageal tract. And there may be studies which say that PCOS have also, which is a very common endocrine disorder in the women. This is also has been associated with the binge eating and bulimic behavior. And there are other things like dry lips, burning tongue, parotid gland swelling, and temporomandibular disorders. So all things, because we are somehow disturbing our nutritional status, so all problems will be there. So regarding the etiology or what are the causes of eating disorders, or we say that even at this stage, the causes of eating disorders are not yet clearly established, we say. But there may be, we can conceptualize that there may be a various kind of factors which may lead to this, or which may, if it is there, which may aggravate the situation. So there is the biopsychosocial conceptualization, which identifies roots in 3 spheres, that is biological, psychological, and social scene. So all these factors which are related to the biology, related to our psychology, and related to our social life may initiate or also may aggravate the situation. And this suggests a unique interaction of variables for each individual. An unexplained physiologic predisposition with possible genetic determinants leads to a variable degree of biologic vulnerability in persons at risk to develop eating disorders. Specific early experiences and family influences may create intrapsychic conflicts that determine the psychological predisposition, and variety of psychodynamic patterns exist in the families of patients with eating disorders. So what is our social atmosphere? What is our family atmosphere? What is my physiological state? What is my physiology is saying? What is my psychology is saying? Of course, these are very intertwined factors. These three are very intertwined. Our social experiences, they define our psychology, and our psychology defines our food habits. It's in turn. So there are studies which also saying that genetics is also one of the major reason playing role in the development of eating disorders. Then we have the psychological factors, and we see that it's the eating disorders doesn't come alone. And APA says that there are various comorbidity are there as far as the psychological scene is concerned. There may be depression, substance abuse like alcoholism, anxiety disorders, and obsessive compulsive disorders, attention deficit hyperactivity disorder, obsessive compulsive personality disorder, and borderline personality disorder, narcissistic personality disorder, histrionic personality disorder, avoidant personality disorder. So there is a comorbidities between eating disorders and all these psychological problems. Then we have the individual personality traits which may lead to the initiation of eating disorders, and also may badly affect the situation. Then we have the environmental influences, or we can say the social influences, or the social experiences, or our environmental factors which can affect this thing. There may be like child maltreatment may cause initiation of eating disturbances, because any kind of maltreatment to the child may affect its emotional imbalance or the psychological imbalance, which in turn may lead to the eating disorders. There may be social isolation, parental influences, peer pressure, cultural pressure, and many times trauma also. So all these factors are very important, which via emotional disturbances or via affecting our psychological health are leading to disturb our food habits. So how we are going to diagnose this? So the medical history is the most powerful tool, of course, and many medical disorders mimic eating disorders and comorbid psychiatric disorders, and early detection and intervention is very important. This is for better recovery, improvement in quality of life. So regarding the complete medical and psychosocial history, and follows a rational and formulaic approach to the diagnosis. Then we have the various scans which can rule out that whether the person is showing eating disorders because of really eating disorders because of the psychological problems, or he is suffering from some kind of physical diseases, maybe the lesion, maybe the tumor, or whatever it is. So we have to rule out the things. Then there are psychological things which are there, which has to be ruled out. After ruling out organic causes and the initial diagnosis of an ED made by a medical professional, a trained mental health professional aids in the assessment and treatment of the underlying psychological components of the eating disorder and any comorbid psychological conditions. So first we have to rule out whether there any presence of physical illness affecting the eating habits. Then we'll have to see if we catch something, then we say that we have to go for the psychological treatment or the diagnosis. Then we have the differential diagnosis. There are multiple medical conditions which may be misdiagnosed as a primary psychiatric disorders, complicating or delaying treatment. These may have a synergistic effect on conditions which mimic an eating disorder or on a properly diagnosed eating disorder. So this may be the Lyme disease, gastrointestinal diseases like celiac diseases, Crohn's disease, peptic ulcer, eosinophilic esophagitis, or non-celiac gluten sensitivity, among others. There may be Addison's disease, which is an adrenal cortex disorder, and gastric cancers. Then we have the hypothyroidism, hyperthyroidism, and hyperparathyroidism, toxoplasma seropositivity, and various kinds of infections and neurosyphilis. So many things. It's not only so many things are there which may affect our food habits, and they can be because they mimic the eating disorder. So there can be a misdiagnosis, and which may lead to a mistreatment or the improper handling of the patient. So psychological disorders, within maybe there are various psychological disorders which also mimic or maybe the comorbid with the eating disorders. There may be emetophobia. This is an anxiety disorder with an intense fear of vomiting. A person so impacted may develop rigorous standards for food hygiene. That means he will not be touching the food, socially withdrawn, anorexia, reduced intake. And we have the phagophobia. It is an anxiety disorder characterized by a fear of eating, usually initiated by an adverse experience while eating, such as choking or vomiting, which we have just discussed. And then we have the body dysmorphic disorders. That means always having up to a level of intense, healthy, unhealthy relationship with the body. Then we have to promote a healthy development, why the prevention is required. So how we can prevent this eating disorder? So it is always better to prevent the eating disorders. Be careful when we are rearing our children, that we have to focus on their food habits. Every foods and nutritionist say that food habits is the major thing. Okay, we are having a good quality food, we can afford it, we have good socioeconomic status, but if we are not having a very good or the healthy emotional relationship with the food, and if we are not able to inculcate the healthy dietary habits in the children, that is of no use. So we have to be aware of the things, and we have to try to prevent that these eating disorders are not developed there, because this is totally a psychological agenda. So to promote a healthy development before the occurrence, and also the early identification before it is too late to treat. So children as young as age of 5 to 7 years are aware of the cultural messages related to body image and dieting. So we can say that how early we have to focus on the things. The child of 5 to 7 years age, in his early childhood, is definitely aware of the things. He develops some kind of perceptions about himself. He develops some kind of perceptions about the family, some kind of perceptions about the atmosphere around him.
Sorry to interrupt you, ma'am.
Okay.
We are running out of time. Could you wind up the session fast, please?
Okay.
Thank you.
So we have to give me 5 minutes, Joshua. So we have to discuss with the children like the emotional bites, that how we have to eat and how we can avoid the emotional eating. Then say no to teasing, that they should be taught, and also we should be aware of that we are not, body shaming should not be allowed, and it's not a good thing. Then fitness comes in all sizes. So that means the acceptance, whatever the body we are having, we should accept that. So all these things has to be inculcated at the early childhood only. So for the treatment, there are kinds of various cognitive behavioral therapies are to be applied. So it's better not to go at the stage of treatment, because treatment is through the cognitive behavior therapy, which says that everything what we are perceiving is our own thoughts, and if we can change our thoughts, we can change everything. So various kinds of cognitive behavioral therapies are being applied in the system. Then we have the individuals, they have the shame, fear of stigma, cultural perceptions, minimizing the seriousness of the problem. And then we have the systematic things, which may include language differences, financial limitations, lack of insurances, coverage, inaccessible healthcare facilities. All these individual factors and all the systematic factors which are on the negative side, they can negatively impact, they can negatively affect the treatment of these disorders. So coming to the Indians is why today we are discussing all these things, why everyone wants to know that we have everything, but it's not going into the body. So what the Indian scene is there, this is the area, the eating disorders area is the under-identified, under-researched, under-treated, and which is definitely silently leading to the malnutrition. And we generally talk of the malnutrition and hunger only, but we never think of the if the availability is there, why we are not consuming. There can be some kind of psychological stages also. So this is one of the thing that we have to be aware of the things. And this is not even considered a problem, because the country like India, we are very hesitating when we are discussing about the mental health problems. And this has been realized during last many years, that even the mental issues are not being open. They are considered to be very secretive matter. So in the scene like this, there are chances that the problem can be mishandled and can go for more aggressive stage. So there are various less research studies on the area. Even for the prevalence also, we are not having much studies, only very few, maybe 2-3 studies are there, and some of the reviews are available. So there is a need to go into the depth of whether how is the prevalence of these eating disorders are there in the society. And of course, I'm very confident, and I have gone through the literature, that we can say that there is silent presence of this culprit is there. And generally the problem is there that when we have some mental illness or when we have some psychological disorders, we generally try to escape. We go for various things which are not the proper. For the things, we go for some worships, we go for the meditation, we are suggested with some yogas and all. Of course, they may be helping, but in the absence of proper treatment, they can harm enough. So there is a time to react and create awareness in the society, in the population, and we, the scientists, and with the people who understand the things. Definitely it is our responsibility to go for the things. And at the last, I would also like to say that the people are aware and the people are suffering. I think you may be remembering that one of the post of some actress like Sonam Kapoor, she said that the girls should not go for the zero figure and for the very beautiful image, because we actresses, we go under so many treatments and then only we get it. So these are the things that the people are realizing, and so we have to be, this is the right time, I think, to talk about the things. That's all from my side. Thank you so much for your patient hearing, and I'm sorry that I have took some longer minutes also. Sorry, Josia.
No issues, ma'am. Participants, is there any questions you could drop in the chat box?
I should stop sharing, Joseph?
Yes, ma'am, please. Thank you, ma'am. Thank you so much. Like, I guess there is no questions from participant side.
Thank you, one and all.
Thank you, ma'am. Next, I would like to welcome our last keynote speaker of our day, Ms. Gillian Fish, founder and CEO, 6am Agency, Australia. Ma'am, please proceed with your presentation. Thank you.
Thank you very much, and thank you for having me today. Sorry, just sharing. Okay, thank you everyone, and thank you for staying the course to the end of a long and full day. It sounds like it's very, very interesting agenda that you've worked through. Today, it's a great pleasure and honor for me to be talking with you about sustainability marketing, the new frontier of brand building within the nutrition industry and in fact across every sector. So we know, we'll get straight into it now, that the UN Sustainable Development Goals have set a course and a path for brands to follow and to lean into in order to support the health of our people and our planets globally. And interestingly enough, the group Mintel in April of this year interviewed 15,000 consumers to find out and understand better what matters to them and what they're most fearful about. First and foremost, the top 3 concerns are: they wish to have eradication of poverty. Number 2, they want to have zero hunger. And number 3, they want to have good health and well-being throughout, with equality across populations around the world. And the one thing that COVID has shown us is the disparity between countries of those who have and those who have not. It's also shown us about racism, about intolerance, about issues relating to climate change and so forth, which have come to the fore. So these 3 things are really critical for us. And in the nutrition industry, for us, good health and well-being is absolutely fundamentally important and critical to moving forward in a positive way. The last speaker has spoken about the influence of nutrition on our mental well-being. And we know through stress and anxiety now, particularly amplified through the pandemic, there's a lot that we can do to modify that. Mintel also found that the top 3 environmental concerns were clean water and sanitation for all, because not everyone has that. Number 2 is affordable energy. So getting energy and securing energy in its renewable form as best as possible. And last but importantly, in number 3 is climate action. And we know we're all deeply concerned about the future of our environment and the climate. So there are a lot of quotes out there. There are a lot of influencers and ambassadors that are fighting to build the movement and leading the movement for change. So on UNICEF, you can see many quotes. We are the last generation that can end climate change. We can, and we will. It's important for us, in order to understand sustainability marketing, to look at how different audiences across the different generations perceive it. So here in Australia, we have a group called the McCrindle Research Group, who often do research around generations, around social impact and so forth. A recent study that they published in 2022 showed that when asked about reducing climate change, 88% of Generation Z felt that it was near the top of their agenda, just below ending racism. Gen Y, of course, at 73%, Gen X at 50%, and baby boomers, interestingly enough, at 35%. But what does that mean? Because if we're talking about fish oil, for example, or a nutrition, a supplement, a nutraceutical that can support arthritis or cognitive health, we need to be able to talk to our audiences in one way, versus if we're talking to somebody who's Gen Z and they have a nutraceutical like fish oil, for example, for eye health, because they have too much screen time. So this information is absolutely critical to us from a sustainable marketing perspective when we are going out to market. Interestingly, one of a similar and from the same group research found that those are willing to spend at least 10% more on sustainable products. However, here's the interesting thing. If you look at baby boomers in 2019 versus 2021, we see the largest increase here of the need and the desire to spend more. So the question, spend more on sustainable products, in fact, it means more to them than it did essentially for Gen Z. Here is an interesting proof point, which I'd like to bring to your attention. 80% of parents who were interviewed and were surveyed in this research showed that they had their actions or consumption decisions of nutraceuticals, of nutrition, of fashion, of anything, were influenced to be more environmentally aware by the Generation Alpha. So I'm often asked when I'm talking at conferences or by our clients, do we think that sustainability marketing is a moment in time and it's going to disappear? I'll tell you now that it's not. If you look at the audience figures and the movement, which is unstoppable from Gen Z and to younger, to Alpha, as well as millennials, and you now see that baby boomers are under pressure because of their audiences, their family, putting pressure on them to be more responsible, to be more conscious in the consumption. We know that a sustainable way is the way of the future, and there's no turning back. So what I want to do now is take you through 2 sets of trends. One is around audience trends that we need to take into account when we are looking and talking to our audiences. And the second is a shift in sustainable marketing trends. To kick off, I'll read you this quote from Peter Wright, who's a famous chief marketing officer who was at IKEA for many years. And he said, if you're a brand, then communicating around sustainability is the least you have to do. In the next 5 years, if you don't get this base covered, then you're no longer a brand, but you're a commodity. We have a deep responsibility to be able to embrace the need and the impact that sustainability marketing and that messages makes on our consumers. So if you go into an IKEA here in Australia now, there's actually a space on the floor where you can go and buy secondhand furniture. Isn't that the proof in the pudding of what he was saying? He showed up with the strategies that he's recommended. So let's quickly go through the macro contextual shifts in audience behavior and why we need to know more about them in order to be effective in our sustainability storytelling. Number one is we need to understand that the definition of a consumer needs to evolve from B2C, so business to consumer, to B2H, which is business to human. And why is that? When we were thrown into lockdown, our homes became schools, restaurants, places of work, and places of recreation. Before, we just lived there. Few people worked from home. There were some, but not a lot. With that came the need to look under the hood of the lives of people in their entirety. You take, for example, some people who are working at home. I, as a business owner, need to understand, where is my team member sitting? Are they comfortable? Are they safe? Are there issues around domestic violence? What is their food consumption like? And so forth. And therefore, we are able to become more intimate with our audience. But by the same token, what we've got to do is we've got to become more intimate and emotionally connected when we communicate with them. Secondly, empowered well-being. We know that we've all spent hours searching online over the last 3 years how to build our immunity. Our level of knowledge of well-being is at a much higher level. We need to be able to communicate with them at a high level, a much higher level, where we are adding value in order for them to make empowered decisions, in order for them to know what an adaptogen is, for example, in order for them to know what nutraceuticals they need to choose, what impacts their well-being and what not. Essentialism is actually key. Essentialism came about at the beginning of COVID when we were thrown into lockdown, and we needed to understand how we could pare back all of the information and the time and the money that we were spending on a multitude of different things and say, right, how are we going to spend our time? Who are we going to spend it with? And how are we going to spend our money? So what is the impact for you as marketers in the nutrition space? When you're looking at a whole lot of SKUs of a product, do you need 10 or 15 flavors, or do you have 5? How do you cut back? How do you bring value so that the consumer, the audience, is absolutely understands that there is a cost and a benefit to why they're purchasing your product? Then we look at anxiety, and we all know the last speaker has just spoken about the huge rise in mental health and well-being issues. There is what we're calling a well-being or mental health tsunami. We see it certainly in Australia. Suicides are on the increase, depression, anxiety, loneliness, and it all comes out of as being accelerated by this COVID, by the pandemic. But what we're also seeing is something called eco-anxiety. And we see that because of the climate chaos and the life that we are now in. And we see that the fear in our younger audiences particularly. Of course, we're here to talk about sustainability. So sustainable living is absolutely non-negotiable. And different people on different scales of spectrum in terms of how far they are in evolving the way they live. There is a major trust deficit, certainly in countries, in first world countries, where people don't trust governments, and therein lies an opportunity for brands to understand what the fears are and to step in and be the partner on that journey. We then look at the post-growth society, which looks at the third bottom line, essentially. And what that is about is understanding what the impact is that brands make on their business. I'm not sure if you can hear me, if everyone can hear me. So the impact that brands have on society in terms of value, in terms of giving back to people and planet, and of course, uncertainty reigns supreme. So if we look at the key stakeholders within essential ingredients for ESG success, we have three key stakeholders. We've got our employees, and I always say we've got to look in our own backyard. Start with the people who work with us, understand what matters to them, understand what they feel about what's happening in the environment, what they feel about discrimination, what they feel about people and planet. Secondly, is consumers. We've got to understand better what their fears are, what their hopes are. And if we can lean into that and really try and solve problems rather than only shout about our product, we'll be far better space. And then governments, of course, who are setting the path, the course with incentives, sometimes fines, if brand holders step out of what is required. But essentially, for ESG success, one needs to look at the bullseye in the middle of the circle, and that delivers impactful and real results, not only rhetoric. And then, of course, that leads to investorship. So these are a couple of points I want to just point out to you. There are 7 of them, and these are absolutely critical in understanding where we are from a sustainability marketing perspective. First and foremost, we've got what's called generational handover. And if I say one thing to you, it's this slide in this presentation that is a game changer. And I'm going to use myself as an example. So put yourself in your shoes. Think back to when you were younger, in your early 20s. So that for me, I'm a baby boomer. That was in the 80s. You can hear maybe I come from South Africa. I was brought up in the era of apartheid and saw and helped with the fall of apartheid and the release of Nelson Mandela. So within that, I always have had in my DNA a sense of justice and equality and doing the things that are right for people, no matter diversity, inclusion, race, etc. That's just in my DNA. But I can tell you that at that time in the 80s, I was drinking a lot of Coca-Cola. I was buying a lot of fashion. I was smoking a box of cigarettes a day. So that was my upbringing, and I had no thought about the impact that that would have on the planet. If you take our 20-year-olds now, the people who work for us, I have a very young team with me, I understand them better now, and I understand why there's such a rapid movement and fear and eco-anxiety, because they've been brought up with absolute climate chaos, a fear for the future of what's going to happen to our planet, racism, inequality, differentials in health for health services for people across the globe, the Me Too movement, etc. And that's what they've grown up with. And therefore, it's natural to them, right? In addition to which, in a digital world. And that is why we are seeing the acceleration of this movement. And as I said to you in the slide before, children are now influencing their baby boomer parents and grandparents. And that is why in this generational handover, this movement and the imperative for brands to embrace a sustainable way for people and planet is absolutely unstoppable. So that is why we need to embrace this wholeheartedly. Secondly, is Kaleido identity. And what does that mean? In marketing, we generally define our audiences by sex, age, and gender. But now people are being pulled together and becoming a collective and a movement by their values and their attitudes and their purpose that pull them together, like-minded human beings. It doesn't matter what the sex is, or the age, or the gender, or even the country that they live in. That is what we need to keep in view when we are looking at our sustainability marketing. There's a new source of belonging in these collectives that people feel strongly about and are going to move forward with and are going to do everything in their power to evolve. So, for example, we look at climatarians, right, who started at fighting for climate change, but now they're looking for products that have got the smallest carbon footprint, that have got the least amount of pollution, that they're with sustainable packaging and so forth. So that is the second biggest shift. Number 3 is a great energy transition. We all know that we need to aim for renewables, and it's a journey that we're on. We have to tread this path to undo all of those things which we created, I have to say, in the 80s, all of us, the 80s, the 70s, and in fact, since the Industrial Revolution. And that is what we've got to wind back. But we've got AI, we've got digital, we've got all of those things. So how do we use the energy that we have in order to become more effective? Plant-based nutrition, of course, you all know, is front and center. It's an absolute imperative. And that is why we see this as one of the key trends in nutrition, in sustainability. And we've just got to keep on harping back on that. And we see the rise of, as I said earlier, adaptogens to support mental well-being, Tsunami. We see many different stories and ways that people are reverting to or converting to plant-based nutrition. Brand empathy is absolutely critical too. With the frequency of all of these extreme events, I don't know if you look at the news, only 2 days ago, there was a horrendous flash flood that came out of nowhere in Australia, that has sent houses down, sweeping down roads that are now rivers. I myself could not drive back to Sydney on Sunday night because of a massive storm. Luckily, we can work via Zoom, so it was okay, but I didn't want to risk it. And that is just how it is in Australia now. But what does that mean? The eco-anxiety level amongst consumers, we see it in the eyes, we feel it in our people, is huge. And we need to weave that and take that into account when we are talking to our human beings, to our fellow human beings in the marketing that we do, be it from a nutrition perspective or any other sector. Technology eco-imperatives, again, important there to be able to wind back the things of the past to make sure that we are doing everything that we can to advance the reduction of this climate chaos that really is facing us. Then, of course, is sustainable investing and purpose. All of us in business, of course, would like investment, would like to take our businesses, it doesn't matter how small they are, to the next level. And with that comes an important need to make sure that we keep up with sustainable best practice. And I do want to remind ourselves, sustainability marketing and sustainable goals are not only around environment, it's around people as well. The way we treat people, the way we look at diversity and inclusion. I've recently joined a founding board of Women in Nutraceuticals, which I will tell you about in a minute or two as I head towards the end of this presentation. But we have to each be accountable for what we're doing, and that needs to be infused in our marketing. But importantly, we need to create results, not promises. We need to get the basics right first. We've got to have quality ingredients that are evidence-based. We have to look at sustainable packaging before we go and push eco or ethical angles. And we absolutely have to evolve and deliver with transparency and integrity, because that breeds trust. And as I said in the beginning, there is very little trust out there, particularly for governments. And that is where in sustainability marketing, brands can really step in and accompany the audiences on this very bumpy ride. So these are the shifts: generational handover, Kaleido identity, the energy transition, plant-based nutrition, brand empathy planning, looking at technology eco-imperatives, and then, of course, sustainable investing and purpose. I would like to draw your attention to a white paper that is on our website. It is for free, that you can download, and it's the 10 Ps of sustainability marketing, and there are other things in that as well. I've just taken a couple of points that I'd like to really highlight. Number one is looking at our people. I always tell people, they say, where do we start? This is so huge. The first thing from a marketing perspective is start with your own people in your own business. You can't take them on the journey to market your brand and sell it as a sustainable brand if your own backyard is not in order. Make sure that the environment's right, the way we connect is right, the way we are inclusive, and how we support them on this difficult time. Secondly, of course, is look at your product, sustainable product development, make sure the packaging is in order, make sure that's environmentally friendly, transparency, and so forth. Number three is promotion. How do we do that? We don't want to only sell at our consumer about your product. What we want to do is empower them further. I spoke to you about empowered well-being. So take the opportunity to explain to them the benefits of certain compounds, nutrition, how to fix sleep, and so forth. And that way, you will have them more on the journey as a trusted partner in their well-being than you will have them only as a purchaser. Preservation is absolutely key. So remember, nutrition facts. Why don't we change the nutrition facts to become about the environment, about the carbon footprint, and so forth, but build a cultural identity based on values and purpose. So very quickly, just a little bit about me for those who don't know. I've written 2 books, one of them Resilience, Body, Mind and Soul, and in each of them are 25 world experts in integrative medicine, and I guarantee you that on every single one of these pages is something about nutrition that people can learn about from cardiologists, nephrologists, nutritionists, and so forth. Secondly is, where does our interest lie? We have just launched Women in Nutraceuticals. I'm a founding member of that. There are 12 women, 10 in the United States, 1 in Europe, and 1 myself now in Australasia. And we are starting to roll this out and grow. And it's about driving, calling for gender parity and unlocking potential in women around the globe, in science, in nutrition, anything to do with our great industry to provide mentorship and so forth. So please do look at that website. Also, we work with Naturally Good. I'm a speaker at Vita Foods, Nutri-Ingredients, and about to publish something within a book from Mr. Dilip Ghosh, a co-author on a chapter around nutritional marketing. Just remember this, that brands live and die in search. So whichever brands you work on and work with, or whoever you consult to, we've got to become best friends with the algorithms. If we can beat the algorithms and focus on them as much as we do our audience, who are desperate for information and partnership as they work through this time, we will definitely win. Second last slide is the precision methodology for effective quality of voice. We always are audience first. We set ourselves what matters to the audience. How do we engage them? How do we bring them on this journey? And what is it going to take to get our brand infused and embedded in their life? So that is our 6 a.m. precision methodology. Last slide here for you. Number 1 is, people always ask me, where do I start? And as I said earlier, in your sustainability marketing, start in your own backyard, your team, your family, and your friends. Secondly, evolve from business to consumer to business to human. Understand the hopes, the fears, the wants, the desires, the challenges of your audience. Don't only see them as a customer to buy your one ingredient or whatever product you're selling, be that raw material or be it finished goods. And last but not least, embrace algorithms as if they're your second audience. Here is a copy of our sustainability white paper. Please feel free to download it. There's a QR code here, and value the opportunity of talking with any of you, answering any of your questions. I'm not sure if there are any in the chat. Thank you very much for having me here today, and I'm honored to be your last speaker. Thank you.
Thank you, ma'am. Thank you so much for your informative session. Participants, if you have any questions, kindly drop your questions in the chat box.
I see that there is something here. I'm very happy, Dr. Ragun, is that right? Very happy to know the younger generation feels much more strongly on climate action. Let us hope that this changes and evolves with political, global, and individual action. My view is it's going to. It's just a matter of time. It's about having that age group. Now I'm talking age. I'm not talking values, but age group and those aligned values in leadership positions across brand holders, across all sorts of the sectors and in government, because it's just not sustainable now. And that's why we all need to work together on this movement to help people and planet. Are there any other questions?
I guess there are no more questions from the participant side, ma'am, because you have explained very nicely. Thank you.
Good. Thank you.
Before we continue to our next session, I request all the participants kindly turn on their videos to have a gallery image.
Thank you.
I repeat myself. I request all the participants kindly turn on their videos for the gallery image.
Maybe they don't want to. That's okay.
Thank you all. Thank you so much for all your patience. Okay, we will start our technical sessions at 11:40 sharp. Breakout rooms are open. I request all the participants kindly go to your respective halls, which are assigned to you as per the agenda, as Hall A, Hall B, Hall C, Hall D, and Main Hall. All the Main Hall participants kindly stay here. Rest other participants kindly go to your assigned halls. If you have any other further queries, kindly drop the message in the chat box. We are ready to help you. Every participant could see the breakout rooms at the down bottom of your screen mentioned as breakout rooms, or else you could find more option. In that you could find breakout rooms. Join your respective hall as Hall A, Hall B, Hall C, Hall D as per the agenda. The main hall participants kindly stay in the same room. Thank you. Mariam Zamir, as you mentioned, you're a Hall C candidate. At the down bottom of your screen, you could see a breakout rooms option. Tap on.
मम्मी टीवी का लीजिए का मुंडा बंद कर तू मम्मी ने खेलना नहीं चिनो मम्मी ने खेलना तू
At down bottom of your screen, you could see breakout options. Kindly tap on Hall C so that you could join Hall C. All the respective moderators, kindly go to your respective halls. All the respective session chairs, kindly go to your respective halls. I repeat myself, for joining the breakout rooms at the down bottom of your screen, you could see breakout rooms. Kindly tap on the respective halls which you have to enter as per the agenda, like Hall A, Hall B, Hall C, and Hall D. Kindly join the respective halls. The main hall candidates kindly stay here. I repeat myself or I repeat myself, all the respective participants kindly go to the respected allocated slots as per the agenda. Hall A, Hall B, Hall C, and Hall D from the breakout rooms. The breakout room option is available at the down bottom of your screens. Kindly tap on the respective hall. All the main hall participants kindly stay in the same room. Thank you. We will start our technical sessions at 11:40 sharp. Thank you.
मेन हॉल ए में उर्वशी है।
લેપટોપમાં હમણાં કનેક્ટ કરું છું જો એકદમ સરસ ઇઝીલી થઈ જાય તો હું એમાં ત્યાં બેસી
I welcome you all, the participants, for the technical session. I would like to welcome the session chairs, Professor Mrs. Vijay Kadar, former Dean, Acharya Nagarjuna Ranga Agriculture University, India, Dr. Raghunathan MR, Visiting Professor, Padma Shri Institute of Management and Sciences, former Principal Scientist, Indian Council of Agriculture Research, ICAR, India. Ma'am, sir, over to you, please.
Roshni, the small correction. I am from Acharya ND Ranga Agricultural University, not Nagarjuna.
Okay, so sorry, ma'am.
ND Ranga Agricultural University. Okay. Thank you, ma'am. So, should we start?
Yes, madam, if you could have some opening remarks from you.
Is it? Okay. Good morning to everyone. It's really nice to meet all of you once again in the second day to hear a lot of information on the different aspects. I thank my co-chair, Dr. Raghunath, and really I appreciate the young ladies, Roshni and Ramya, for conducting in a very, very systematic manner without any sort of the gadbada, because especially everything is going on very smoothly. I think the compliment should go to the organizers mainly. And today's program, we have got nearly 21 papers. Out of that, 13 are e-posters and 8 are e-posters, 13 are oral presentation. And I think I request all the presenters to maintain the time, because I think you must be knowing it is being evaluated by the chair as well as co-chair. So be careful in maintaining of your time and really just pointing out our results in a crisp manner. That is more important. Otherwise, because everything is count here, starting from your presentation, the time management, and the results, how you are presenting, or the summary or the conclusion. So I request all the presenters, please take care about this one and proceed that one. I think Dr. Raghunath, if you want to say something, you please continue.
I think you very ably summed it up, madam. Just have one word of advice to all our presenters. Please, you know the order of your presentations. So please keep your presentations ready, and the PPT should be ready and in already the slide presentation mode, so that when the time comes for you to present, you are on without any lag of time. Otherwise, you lose quite a lot of precious time in making you come on and then taking over to the thing. So I think without much further ado, perhaps I think Joshua could invite our first speaker.
Yes, sir. Thank you. Before we start, as session chairs has mentioned, kindly all the participants stick to your time. For oral presentation, 10 minutes of time is allocated, in which 8 minutes for presentation and 2 minutes for questionnaire. And for e-poster presentation, total 5 minutes of time is allocated, in which 4 minutes for presentation and 1 minute for questionnaire. I request all the participants be ready with your presentations. Now, I would like to welcome our first presentation, which is oral presentation by Neetu from IC College of Home Science, Chaudhary Charan, Haryana, Agriculture University, India, on a topic of efficacy of chia seeds in hypertension. Ms. Neetu.
First of all, a very good morning to all present here. Am I audible to all?
Yes, you are audible.
Okay, ma'am. The screen is visible to all?
No.
No?
No.
Please use the share screen at the bottom of your screen. Usually it's a green icon arrow.
Okay.
Press that and then choose your window. Okay.
Is it visible now?
It will be shortly. Yes, now.
Yeah.
Please switch to the presentation mode and start.
Okay. So I am Neetu Yadav from Chaudhry Charan Singh Haryana Agricultural University, Hisar. Today I will be presenting on the efficacy of chia seeds in hypertension. Here is the content which we will be covering today in this presentation. Introduction, history, nutritional composition, health benefits, omega-3 fatty acid play role to decrease.
Sorry to interrupt you. Sorry to interrupt you. Your slides are not changing. You have to go to the slide presentation mode, not in the this particular type. Should be a small, screen icon on the bottom of your screen. Just press that. You should be able to get into the presentation.
सर मेरे देखो आप मत बोलो ये बिल्डर यहाँ
I request all the other participants kindly stay
Is it
on
visible
mute.
now?
It's not okay
Yeah,
right now. Yes.
Now it is okay. Yeah.
Okay, okay. So let's start with the introduction. Chia seeds. I'm sorry, this is interrupting. Yes. Chia seeds, Salvia hispanica L, a biennially cultivated plant, is categorized under the mint family Labiatae, superdivision of Spermatophyta and kingdom of Plantae. It consists of approximately 900 species widely distributed throughout several regions of the world: Southern Africa, America, North America, South America, and Southeast Asia. The seeds are hydrophilic, absorbing up to 12 times their weight in liquid when soaked, and developing a spotting chia beans and beverage a distinctive texture.
Your slides are not changing.
Is it visible now, sir?
It is visible, but you have to make it a full screen.
Ma'am, are the slides changing or not?
No, no. It's a blank.
Now?
It is visible.
And the slides are also changing?
Yeah, now they're changing, yes.
The declaration chia, a functional food by the European Parliament, had a great deal of effect on its popularity. Chia seed is now extensively used as a part of foods in Mexico, Argentina, Chile, New Zealand, Japan, USA, Canada, and Australia for different purposes. Chia is considered as a safe food with no potentially harmful effects and widely used in baked goods, nutritional supplements, cereal bars, cookies, bread, snacks, etc. The seeds yield between 25% and 35% extractable oil, which contain high concentrations of PUFAs, that are polyunsaturated fatty acids. Because of the highly unsaturated nature of the oil, the seeds probably contain potent lipid antioxidants. Now the history. So the slides are visible?
No.
I don't know, ma'am, why it is resuming again and again.
Technology.
Whenever I change the slide, it just resumes. Can you see it now?
No.
Kindly stop sharing and try to reshare so that the problem will be resolved. And I guess there is a connectivity issue from your end, so that's the reason.
Okay, ma'am, I'll reshare it.
And this is the reason why I requested all the presenters to have the slides ready, and maybe you can go through it in a dry run mode and make sure that everything is working. Okay.
Now,
Okay.
okay.
See, you are losing your time, Mama.
History. Salvia hispanica was originated from Mexico and Guatemala. It has been the part of human food for about 5,500 years. Traditionally, the seeds were used by Aztecs and Mayas people in the preparation of folk medicines, food and canvases. In prehistoric times, in Colombian societies, it was the second main crop after beans. Whole and ground versions of chia, along with its oil, was the part of food, ancient cosmetics, and the part of religious rituals in prehistoric times in Aztec communities. The chia seed is widely used in many countries since thousands of years due to its massive nutritional and therapeutic potential. Now, the nutritional composition. Chia seeds are becoming popular for their nutritional composition. They are a rich source of heart-healthy fatty acids, antioxidants, and minerals.
Slides, no slides, no slides.
The slides are not moving.
No, it's blank actually.
Can you see it now, ma'am?
No.
Now?
Yeah, now it has come.
Okay, but go to the full screen more.
Yeah,
Slide
sir.
presentation.
Nutritional composition. Chia seeds are becoming popular for their nutritional composition. They are a rich source of heart-healthy fats, antioxidants, and minerals. Chia seeds contain high nutritional content in the form of protein, that is 15 to 25%, fiber 18 to 35%, fat 15 to 35%, ash 4 to 6%, and vitamins, minerals, and antioxidants on the wet basis. Dry chia seeds contain 8.8% of phenolic compounds. The seed contains from 25% to 40% oil, with 60% of it comprising omega-3 alpha-linolenic acid and 20% of omega-6 linoleic acid. Both essential fatty acids are required by the human body for good health, and they cannot be synthesized artificially. Phytochemical compounds that have been detected in chia seeds include carotenoids, sterols, tocopherols, phenolic compounds including quercetin, myricetin, caffeic acid, camptoferol, and chlorogenic. Now, the health benefits of chia seeds. Chia seed is rich in alpha-linolenic acid, the biological
Slide has not moved.
My God.
Still you are in the nutritional composition only. Yeah, now it has come.
Is
Okay.
it visible?
Yeah, health benefits.
Yeah. Chia seed is rich in alpha-linolenic acid, the biological precursor to eicosapentaenoic acid, a polyunsaturated fatty acid, and docosahexaenoic acid. Because the body cannot synthesize alpha-linolenic acid, chia has a newfound and instrumental role in the diet. Chia is currently consumed not only as seeds but also as oil, which brings about similar effects. Chia seed and chia seed oil are used mainly as a food commodity, and the oil is also used popularly as a dietary ingredient used in various dietary supplements available in the US market. It has been demonstrated that a high concentration of omega-3 is associated with a lower risk of coronary artery disease, hypertension, diabetes. Ma'am, slides are moving.
No, health benefits only are there and your voice is breaking.
I think there is some connectivity issue.
The
effects of cardiovascular have some increases. The slide.
Ms. Neetu, if there is no issue, we will be taking your presentation at the last. Kindly share the PPT in the chat box so that I will be sharing the screen for you. Ma'am, could we move to the next presentation, ma'am?
Sure, please carry on.
Please
Okay.
do.
Okay, so ma'am, I should share the presentation in the chat
At
box.
the end,
Yes,
yeah,
yes,
you
please.
share it.
Okay, okay.
Our next oral presentation is by Dr. Sangeeta from Rambai Government Women PG College, India, on a topic of perils of chemicals in food and its impact on human health and environment. I guess we didn't have Dr. Sangeeta here. We will be moving to our next presentation, oral presentation by Radhika from Osmania University, India, on a topic of effect of supplementation of low glycemic index sorghum rava upma on hyperlipidemic and hyperglycemic subjects. Ms. Radhika, could you share the screen and start your presentation, please?
Virtual objects. Today I'll be presenting.
Ms. Radhika, kindly make it full screen and start with your presentation, please.
Yeah.
Hello.
Kindly tap on from beginning, ma'am, so that it would be started.
Yeah.
Excuse me,
Okay,
ma'am.
so
Is it visible, ma'am? Is it clear?
slide is visible, but you're not on the full screen mode. So perhaps you can once again tap on the from beginning. Maybe a double click. I would also request the other participants to go through the PPTs so that this problem does not become recurrent. Ms. Radhika,
Yes, sir.
take off that slideshow, press on the close that thing, and then there is a small screen icon at the bottom of your screen. Perhaps usually that works on the bottom of your screen. Now on the left, to the left, there should be a small screen icon there.
Yeah, that is a thing.
Yeah, that's the one. It's not working.
No. Roshni. Hello.
Yes, ma'am.
I think you can take all the PPTs and from your side only try to share it. Otherwise, taking a lot of time and it is a tension for the presenters also.
Okay, ma'am.
No, what do you say?
Yes, ma'am. From next project, we will be doing the same.
Not now. Okay.
I think
Yeah, now
this could be a connectivity issue. So maybe the other presenters like Pani Kumari, Ramesha, Ayman, Dr. Nagalakshmi, etc., they could share their presentations in the chat box and have Joshna represent them. That will be much more trustworthy.
Yes, sir. I request the participants from Nagalakshmi kindly share your presentations in the chat box. I repeat myself. All the participants from Nagalakshmi kindly share your presentations in the chat box.
Meanwhile, Ms. Radhika,
Yes, sir.
probably you can share, start your presentation using this mode itself, although it's less visible. At least
Okay,
you can start with your presentation, but we don't lose time.
Okay, sir. Yes. Yeah, good afternoon all. Thank you for giving me this opportunity. My topic is effect of supplementation of low glycemic index sorghum rava upma. It is made in the form of upma on, I have supplemented it on hyperlipidemic and hyperglycemic subjects. So as we all know, like sorghum vulgare, like jawar, has been found to have several health benefits for diabetic, obese, and even dyslipidemic patients also. So due to its high fiber content, it helps in maintaining satiety and helps in managing hunger and even weight loss also. So glycemic index helps in understanding how fast a food can cause increase in blood sugar levels. So the foods which are high in glycemic index are absorbed and digested quickly and raise the blood sugars also quickly. So according to the IDF in 2019, the top 3 countries with the highest number of individuals with diabetes are China, followed by India and United States of America. So this trend is expected to continue in 2030 and 2045, with China accounting for about 140.5 million and 147.2 million for the diabetic subjects. And it is going to continue, the trend is going to continue with the highest burden of diabetes. So India being the second highest in number of individuals with diabetes after China is expected to continue in 2030 and 2045 also, and will have the highest burden of diabetics. So as the topic being grains, grains have been shown to have a role in preventing and reducing the risk of type 2 diabetes, coronary heart disease, cancer, and obesity. So data from the population statistics in South Asia, CAR study reports that 6 out of 10
are not moving, Radhika. You are in the first slide itself.
Okay, ma'am. I'll just check
Because
it.
you are dealing with the 4th slide, but you are in the first slide itself.
Okay, ma'am. I think. What about now, ma'am?
Yeah, now it is moving. The major cereals is there.
Yeah, ma'am.
Okay.
Is it okay now, ma'am?
Okay.
Fibers?
Okay. Dietary fibers are important.
Yeah.
Yeah.
Dietary fibers are important because of their hypoglycemic and hypolipidemic properties, which help to prevent atherosclerosis by lowering serum cholesterol levels. So they also act as antitoxin and anti-cancer in nature. Unrefined whole grains and millets and bran products are highly complex substances that contain both soluble and insoluble dietary fiber, as well as biologically active substances like polyphenols, antioxidants, vitamins, trace minerals, etc. So the major cereals and millets consumed in India are rice, wheat, jawar, bajra, ragi, which among the millets. And these grains are the major source of energy in Indian diets, contributing to around 60 to 70% of the daily intake. And whole grains also contain antioxidants that may protect against oxidative damage, which play a major role in cancer development. And sorghum is known to be a cheapest source of energy, protein, iron, and zinc, next only to pearl millets among all the cereals and pulses. And it's also grown as feed fodder and more recently biofuel purposes also in the world. So as the present topic being hypoglycemic effect, I would be discussing about the glycemic index, which is a valuable indicator for the biological effect, and it is transformed as a useful tool. The glycemic load is also a very, very important tool, which is a very profound thing in the dietary counseling. And the glycemic index, it is helpful in having differentiating foods with high glycemic index and low glycemic index, which will help a dietitian prescribe a diet for a diabetic patient in a proper manner. So major variations in the glycemic index and dietary fiber content of meals are linked to a slightest extent, but significant changes are observed in the glucose profile of subjects. And many people believe that diabetics can control their blood sugar levels by following a low GI diet, and a low GI diet may help in preventing the diabetes also, as we all know that high GI foods can cause hyperglycemia and hyperinsulinemia, which leads to beta cell malfunction over the time. Low GI diets have been linked to insulin resistance syndrome, high blood pressure, lowering HDL cholesterol, and pro-inflammatory activity, and abnormal blood lipids, whereas high GI diets have been useful for insulin resistance syndrome, high blood pressure, lowering HDL cholesterol, and pro-inflammatory activity, and abnormal lipid levels. So the present study was conducted to study the effect of supplementation of sorghum in hyperlipidemic and hyperglycemic subjects for a period of 3 months. And the subjects were assessed for biochemical parameters, dietary intake, pre, during the supplementation, and even post supplementation also. So the 140 subjects were divided into 2 groups, 70 consisting of hyperlipidemic and the other 70 consisting of hyperglycemic. And these were subdivided into 35 control and 35 with sorghum supplementation. So the 3 varieties of sorghum were taken: the red sorghum, yellow sorghum, and white sorghum. And the results have indicated that the consumer acceptability were almost okay with the 3 varieties, but the color, the white color sorghum was highly acceptable due to its taste, whereas the yellow was slightly bitter in taste. Yellow sorghum upma was slightly bitter in taste, and to mask that effect, we added some ginger and curry leaves, onions, and lemon, which was an optional thing, so that the masking of that particular bitterness was controlled. And the red sorghum rava was good in flavor, and these were the results of the sensory evaluation. And those 150 subjects, after we came to a conclusion that 3 were divided, the acceptability studies and all, the subjects were divided, 150 subjects were divided into 5 groups, comprising of 30 normal subjects, and we have given the supplementation, the sampling to 30 obese and 30 pre-diabetic and 30 diabetic, and 30 subjects on insulin. So they were asked to consume 50 grams of carbohydrate containing 3 varieties of red, white, and yellow varieties of sorghum upma, and white bread was served as a reference food. And the blood samples were collected at 0 minutes, 30, 45, 60, 90, and 120 for normal, obese, and pre-diabetic, and for diabetic 0, 30, 45, 60, 90, 120 minutes, 150, and 180 minutes for diabetic subjects, because after postprandial 2 hours, even 3 hours of postprandial thing also, we were considering the diabetic subjects. And the incremental area under the curve was calculated using the trapezoid rule. So the incremental area under curve values of 3 varieties of sorghum rava upma revealed that the yellow sorghum rava has the least incremental area under curve, followed by red sorghum upma and white sorghum upma. So the statistical analysis was done, which revealed that normal subjects has the least IAUs, incremental area under the value of the curve, for yellow sorghum upma, and obese has the least incremental area under curve for yellow sorghum upma, and followed by pre-diabetic and all also. So we found that the incremental area for, we have tested in normal subjects, obese, pre-diabetic, and people on oral hypoglycemic agents, and the subjects on insulin also, where we have found that yellow sorghum upma had the least incremental area under the curve, which made us supplement the same to be the subjects. So these were the results, that the yellow sorghum rava upma had the least incremental area under the curve, and that made us conclude that it is beneficial for the subjects with diabetes and even cardiovascular diseases also. We have supplemented for the subjects, and that is concluded as yellow sorghum rava is the best among the 3 varieties of upma.
So over.
Yes, ma'am.
See, what is the major difference between the yellow and all the 3 varieties of the sorghum, the jawar, because sorghum? Because did you find any of the difference in the chemical composition of these 3 varieties?
Chemical composition, I did not find any difference, ma'am, but it was the antioxidants thing only, which we didn't go into major details of the antioxidant level, but there was no nutritionally, there is no difference, ma'am.
No difference.
No difference.
Why that bitter taste in one variety of the sorghum? That is upma when you prepared, no?
Yes, ma'am.
Okay. Another variety of the sorghum.
Yeah, I think yellow sorghum.
Yellow sorghum itself is bitter by nature, ma'am.
Acha. Now that's what I'm asking. What is the chemical composition? Did you find any of the differences? I was really interested in that.
No, ma'am. We did not get into the details of the chemical analysis, ma'am. We're mostly concentrating on the glycemic index part only.
Any published literature on this because of bitterness?
For yellow sorghum rava, sir?
Yes.
Maybe due to the polyphenols and tannins and they contribute to the astringency and bitterness, sir. Polyphenols are present in that.
Now we are on the line.
Perhaps I think we should try, soaking the grain and then drying before making it a rava, so the bitterness could disappear. So that's the most promising of the thing.
Yes, sir. We did that, sir, because in order to we have when the processing of rava has occurred, sir, we observed that bitterness was reduced to some extent, sir. But totally we were unable to remove any bitterness from that, sir.
Yeah, that will be expected because not all the bitterness would be in the water-soluble fractions.
Yes, sir. Yes, sir.
Okay, it's an interesting study in the sense that we used human subjects rather than mice or anything. So that's a start. And pardon my ignorance, but you said incremental area under the curve. But which curve that you didn't present? What is the parameter being? The blood glucose level? Or?
It's a group, sir. Blood glucose levels versus the time, sir. The subjects versus the time. We have taken a blood prick sample, sir, at as the intervals which I have mentioned at 0 minutes, 15 minutes and all. After consuming the rava, starting from the consuming, they are supposed to consume within 5 to 10 minutes, sir. And they are not supposed to consume any other meal. Like 12 hours fasting was maintained, sir, in order to see the effects of exclusively this food. And when the blood prick samples were taken with the glucometer and all, we have observed the changes, sir. And the group versus the time, sir. This is the estimated marginal means of incremental area under curve, sir.
Okay, thank you.
Thank you, sir.
Shall we move on to the next speaker?
Yes, ma'am.
Okay.
Our next presentation is oral presentation by Y.V. Fanikumari from Osmania University, India, on topic of isolation and identification of probiotic bacteria from NIDA and its probiotic characteristics and inhibition studies on food pathogens.
Yeah, good afternoon, Vijaya Khader ma'am, chairperson, and Raghunathan sir. Good afternoon, everyone. And indeed a great pleasure to be a participant in this international conference, ma'am, and presenting before you people. I'll just share my screen. Yeah.
Yes, good.
Thank you so much, ma'am. Ma'am, I'll start my presentation. It is on, as just now Roshni has read out, isolation and identification of bacteria, which is probiotic bacteria from NERA. And we have also done the characteristics and inhibition studies also on food pathogens. So moving ahead, this is the abstract, which the NERA, which has been extracted from the spadix of the palm tree, ma'am. And NERA extraction is generally performed before sunrise, as we all know, sweet and translucent in color. And only when it is fermented, it is called toddy. And yeah, we have seen that NERA, of course, is rich in carbohydrates and highly alcoholic. The substance which we have done the concentration studies on, that is sucrose, we have measured 12.3, and these are the characteristics, the chemical nature of NERA. And we have also checked on with probiotic bacteria. Earlier studies which were shown have been isolated from different traditional fermented foods. As there are several such foods which are not well explored, we thought of doing it with NERA. Probiotics are, of course, live organisms that confer health benefits on when it is consumed in adequate amounts. So the proficiency in inhibiting the growth of pathogenic organisms have been shown even with NERA, even with the other probiotics. So the present study proves the ability of NERA as a probiotic. So this is the flowchart of the methods and the experimental design which I have done. Isolation of probiotic bacteria from NERA sample. After the isolation, we have checked on with antibacterial activity. The probiotic characters have been examined. Then identification of potent species by the biochemical tests. So these are the NERA samples and the spread plate technique on MRS broth and serial dilution. Selected isolates from NERA have been used up. So isolation of probiotic bacteria from NERA. Samples of NERA samples were obtained from Nalgonda. Then the sample bottles were maintained at 4 to 8 degrees in ice box until it has been brought to the laboratory where we were testing. So the travel time taken, I'm specific with the travel time. Yeah. Because it might have an effect where NERA can become a little more fermented. Can I go ahead?
Sure.
Share screen, I know, but
yeah, please go ahead.
Yeah, yes, sir. So the morphological studies, that is after I have isolated after the spread plate technique and all, then the serial dilution, selected isolates from NERA. We have seen the morphological studies of color, shape, size, elevation, margin, and opacity, whether they are translucent or not. Then these are the isolates, the 10 isolates which we have checked on. Then antibacterial activity were tested with lab cultures against Klebsiella pneumoniae and Bacillus subtilis. So which were spread on the agar plates. Then nutrient agar plates were prepared. Then pathogenic bacterial lab cultures were spread on the agar plates. Activated samples are placed using paper dip method and incubated for 24 hours. So bacterial inhibition was clearly observed under 1 or 2. So these are the inhibitions which we have seen, sir. Second, third, then ma'am. Yeah. Based on the above results, the isolates have been selected for further studies. So we have also tested for tolerance to gastric, that is pH 2 and pepsin for 2 hours and intestinal pH. And this was the test performed. And we have seen isolate 2 with after 2 hours, the tolerance was there, 3.28 was there. Then bile suppression, that is percentage of lactic acid bacteria isolates at 3 and 6 hours. And the growth suppression percentage also was taken on OD, both for control broth and the bile broth. And the results have been shown down, sir. So isolate 2 and 3 have been used for this test also. Cholic and thorocholic acids were tested against. Then this is identification of potent species by biochemical tests. The same thing, gram staining, we have seen it is positive gram stain. Then the other tests of indole, methyl red, and Voges-Prosker tests and all were conducted. And yeah, this is what we have come on to, sir.
Okay.
Thank you. abiding by the time limit, I have moved a little faster.
Yeah.
Thank
It's
you.
okay.
Thank
You
you
are
very
in-
much. That gives us the time for doing some questioning,
Yeah.
which is more productive. One thing, you have maintained pretty much cold chain from the sampling to the laboratory.
Yes,
I was wondering if that prevented some of the natural isolates from, becoming dominant. Because if Nira, as you say, of course, is unfermented, but then the probiotics may come into fore or predominant after fermentation. Have you considered that possibility, or is it going totally towards yeast and that kind of thing?
It is first, it was a Nira sample, sir. Then the next test we are going to do on toddy also, post the fermentation. Immediately after half an hour, I mean, from Nalgonda to our lab at university, it took half an hour fast ride. So we have checked in for half an hour. Then, of course, as you said, the next plan is to do it with toddy.
Oh, okay, that's nice. One more thing is, you have only, I think, tentatively sort of characterized them biochemically. Any idea of characterizing further to the genus and species level?
Yes, sir. Yes. As a guide is Kavita ma'am, the next step, as you said, is to go ahead with 16S RNA sequencing. So of the same probiotic thing, because morphologically, what we have seen is we have to cut down the isolates since only 2 and 3 were showing major phenomenal effect. So using those two, we will go ahead with the RNA sequencing, sir.
Thank you.
Thank you so much, sir. Thanks a lot for giving us the opportunity to share our work.
Anyway, it is a good piece of work. First, let me ask a very basic question. Why you enter into the Nira? What made you to take up the work? Kavita was my student only, I know.
Yes, ma'am. Actually, I mean, if time permits, I would like to show definitely. These are the review of literatures which I've done, ma'am, on more on toddy. Almost around 25 to 50 when I've checked on. So I thought Nira would be a little more better. That is, it is not alcohol and it is just the sweetened toddy initial stages. So if it has a probiotic effect, we can use it for further studies of maybe preservation also. So preservation of food. So that's the reason which has grabbed my attention, because almost all the studies have shown it for toddy.
Okay.
Perhaps it's it'll probably the prebiotic kind of potential of Nira would come into effect since it is not yet fermented. Perhaps later on it should become that kind of thing.
Yes, sir. I've noted the point, sir. Thank you so much.
Without fermentation, Nira is good for health. Actually, many people they take it.
Yes, ma'am. Yes.
But it should be soon after collecting from the tree. That gives some sort of the refreshing also. I believe that is a good for health also. That's what people just say about it.
Yes,
so,
ma'am.
As it is nutritionally, it is a good thing. And I think recently someone is from CFTRI, Dr. Surya Prakash Rao was there. No, he was interested to do some work in the Nira, but I don't know, he was planning to do it and stop it.
Actually, now in many places around Bangalore, see Nira being sold under refrigeration. I'm not too sure how much of fermentation occurs.
It is sold, and people are taking in early morning, but for their what you can say beneficial effect on the health.
Yes.
So not as a fermented one, just with the fresh Nira, as it is coming from the tree itself. They have to go to the tree and then take there itself.
Yes,
and the transport it gets fermented because the time, I mean, it's very fast also. So, but anyway, you made a good attempt. At least continue it. Wish you all good luck.
Yes, ma'am. Thanks a lot for all the inputs, ma'am.
Okay.
Yeah. Should I stop sharing the screen?
Yeah, please.
Yeah. Thank you, ma'am, and have a good day.
Rohini, shall we move on to the next one?
Yes, ma'am. Thank you, ma'am. Our next, ma'am, could we go to the first participant or else could we continue with?
Okay, if she's ready, let us go.
Okay. Miss Neetu, are you there? Miss Neetu?
Yes, ma'am. Yes, ma'am.
Yeah, she's there.
Okay, I will be sharing the screen, ma'am, then.
Okay.
Please let me know, ma'am, if the screen is visible or not.
It is visible.
Okay.
Yes.
Okay, so my topic is efficacy of chia seeds in hypertension. Ma'am, please move the slides.
Okay.
So here is the list of contents which we will be covering today. So the introduction of chia seeds, history of chia seeds, the nutritional composition, health benefits, and the role of omega-3 fatty acids to decrease cardiovascular diseases, the study finding, and then the conclusion. Introduction. Chia seeds, Salvia hispanica L, a biennially cultivated plant, is categorized under the mint family Labiatae, superdivision of Spermatophyta and kingdom of Plantae. It consists of approximately 900 species widely distributed throughout several regions of the world, including Southern Africa, Central America, North America, South America, and Southeast Asia. Sorry. The seeds are hydrophilic, absorbing up to 12 times their weight in liquid when soaked and developing a mucilaginous coating that gives chia-based creams and beverages a distinctive gel structure. Ma'am, please move the slide. The Declaration Chia, a functional food by the European Parliament, had a great deal of effect on its popularity. Chia seed is now extensively used as a part of foods in Mexico, Argentina, Chile, New Zealand, Japan, USA, Canada, and Australia for different purposes. Chia is considered as a safe food with no potentially harmful effects and widely used in baked goods, nutritional supplements, cereal bars, cookies, bread, snacks, etc. The seeds yield between 25% and 35% extractable oil, which contain high concentration of PFAS. Because of the highly unsaturated nature of the oil, the seeds probably can contain potent lipid antioxidants. So the history of chia seeds. Salvia hispanica L was originated from Mexico and Guatemala. It has been the part of human food for about 5,500 years. Traditionally, the seeds were used by Aztecs and Mayas people in the preparation of folk medicines, food and canvases. In prehistoric times of Columbian societies, it was the second main crop after beans. Whole and ground versions of chia, along with its oil, was the part of food, ancient cosmetics, and the part of religious rituals in prehistoric times in Aztec communities. The chia seed is widely used in many countries since thousands of years due to its massive nutritional and therapeutic potential. Now, the nutritional composition of chia seeds. Chia seeds are becoming popular for their nutritional composition. They are a rich source of heart-healthy fatty acids, antioxidants, and minerals. Chia seeds contain high nutritional content in the form of protein, which is 15 to 25%, fiber 18 to 35%, fat 15 to 35%, ash 4 to 6%, and vitamins, minerals, and antioxidants on the wet basis. Dry chia seeds contain 8.8% of phenolic compounds. The seeds contain from 25% to 40% oil, with 60% of it comprising omega-3 alpha-linolenic acid and 20% of omega-6 linoleic acid. Both essential fatty acids are required by the human body for good health, and they cannot be synthesized artificially. Phytochemical compounds that have been detected in chia seeds include carotenoids, sterols, tocopherols, and phenolic compounds including quercetin, myricetin, capic acid, camphophorol, and chlorogenic. Now, the health benefits of chia seeds. Chia seed is rich in alpha-linolenic acid, the biological precursor to eicosapentaenoic acid, a polyunsaturated fatty acid, and the docosahexaenoic acid. Because the body cannot synthesize alpha-linolenic acid, chia has a newfound and instrumental role in diet. Chia is currently consumed not only as seeds but also as oil, which brings about similar effects. Chia seed and chia seed oil are used mainly as a food commodity, and the oil is also used popularly as a dietary ingredient used in various dietary supplements available in the US market. It has been demonstrated that a high concentration of omega-3 fatty acids is associated with a lower risk of coronary disease, hypertension, 2 diabetes, rheumatoid arthritis, autoimmune disorders, and cancer. And please. The effects of chia on cardiovascular health have seen extensive increases of knowledge through a number of research studies. However, most of this research has been carried out with animals, and there are still limitations that exist in understanding the effect of chia supplementation on human cardiovascular health. Antioxidant compounds reduce the risk of chronic diseases like cancer and heart attack, and they offer protection against some disorders such as diabetes, Alzheimer's, and Parkinson's disease. Omega-3 fatty acids have the capability to block calcium and sodium channel dysfunctions, which can cause hypertension as well as improve heart rate variability and protect ventricular arrhythmia. High fiber and protein content in chia seeds may help weight loss. They are present in high amounts of calcium, magnesium, phosphorus, and protein. All these nutrients are essential for bone health. High dietary fiber increases the weight and size of stool. As a result, normalizes bowel movement. Ma'am, please change. Omega-3 fatty acid play a role to decrease cardiovascular diseases. Now, the role of omega-3 fatty acids in decreasing the cardiovascular disease risk is shown dramatically here. Omega-3 fatty acids, when consumed, have an antioxidative effect and anti-inflammatory effects, which reduces the reactive oxygen species and pro-inflammatory cytokinase, which in turn increases the upper airway muscle force generating capacity and upper airway neuromuscular control, which decreases the obstructive sleep apnea syndrome severity and ultimately the cardiovascular disease risk. And now the study finding. In a study done in 2007, it was observed that chia seeds contain important nutrients including potassium and magnesium that help reduce blood pressure, and the chia seeds could significantly lower blood pressure in patients with type 2 diabetes.
Ms. Neeta, sorry to interrupt you.
Okay, ma'am.
You're running out of time. Kindly try to wind up your session, please.
Okay, ma'am, please change the slide.
Yes.
Now the conclusion. Chia seeds are a good source of nutraceuticals and their benefits on human health due to their chemical composition. They are rich in dietary fiber and polyunsaturated fatty acids, especially a linoleic acid, and also contain high amount of polyphenols including caffeic and chromosomic acids, myricetin, quercetin, and camphorol, which give rise to high antioxidant activity due to its mucilaginous gel. Chia seeds can also be used in cosmetic, pharmaceutical, and food companies as a protective agent against moisture, foam stabilizer, and emulsifier agents for its particular composition rich in carbohydrates. Thank you. That's all about my presentation.
Neetu, it is in a review article only, no? You have not done any work. You have collected a lot of
Ma'am,
history and
now I am doing my master's degree. So
Hello?
I am currently doing my research on beetroot, and
Beetroot.
I have not get the results.
No, but see,
Okay.
now the chia seeds have been, it's in a well-known for its medicinal as well as health benefits of the chia seed. In
Yes,
India,
ma'am.
people are using that one. I think even if you observe many people, they are using in the black tea also. Okay, adding that one. And I mean, people are using in a different, at least you would have taken a small, simple component and you would have tried in the laboratory.
Yes, ma'am.
You have nicely collected the information, you have really put it, but at least no, some research component should be there.
I wish I had concentrated more on the hypertension part,
Yeah.
which occupied just one slide in the entire presentation.
Yes, yes.
So, what
Oh,
have I
sir, this was my first conference, so
Anyway.
I
Please-
didn't have
Please take note.
any
Yeah, please
idea.
take note.
Good
and,
luck,
you know,
good luck.
and
Thank
improve.
you,
the
ma'am.
next. Thank you.
See, these are all the points for you to take care about in future, that's all. Okay?
Yes, ma'am. Thank you
When
so
you are
much.
sharing your knowledge to other people, your contribution also should be there. You have well presented the literature available and historical benefits about these things. But then what is your effect? That is more important. Okay. So try to
Yes,
improve
ma'am.
upon it. Thank you.
Thank you, ma'am.
Thank you, Ms. Neetu. Our next presentation is oral presentation by Ms. Ramsha Ayman from Telangana Mahila Viswavidyalaya, India, on a topic of impact of underweight on cataract development in adults.
Am I audible?
Yeah.
Yes, ma'am. A very good afternoon to everyone.
Good afternoon. Kindly share your PPT and start with your presentation, please.
Yes, ma'am. Is it visible?
Yes.
Okay. I've conducted an interstate study to assess the impact of underweight on cataract and subtypes in adult population. Cataract is mainly the opacification of the lens that is a major public health burden. It contributes to about 50% of the blindness in the world. And in India, about 80% of the blindness is primarily due to cataract. Merely a 10-year delay in cataract occurrence can lead to 50% reduction in the surgeries. And in India, very few mixed population-based studies have been undertaken to explore the risk factors for cataract, which is why I've conducted the study mainly focusing on the underweight group as well. To bridge this gap, I've conducted taking into consideration various areas and states to examine the severity and the association of the risk factors. These are some of the symptoms that are associated with cataract. There is mainly cloudiness and blurred vision. There is also sensitivity to light or glare from the lights, example from headlights when driving at the night. A decrease in the distance vision, but an improvement in near vision can be seen. Colors could be faded or yellowish in color when you're trying to view. A poor vision at night is observed, and it requires a need in brighter light for reading and other close-up tasks. These are the different types of cataract that are observed. Mainly it is a nuclear cataract. A nuclear cataract is most often associated with aging, and it forms in the center of the lens. Next is we have cortical cataract, and this type of cataract occurs in the lens cortex portion of the lens, and it surrounds the nucleus. So cortical cataracts can be a result of aging, trauma, or illness. Whereas posterior subcapsular cataract, it occurs in the back of the lens, and it is often directly in the path that light needs to pass through the site. So this one can cause sensitivity to light, halos and glares around the light, impaired reading abilities, and reduced vision in bright lights. These are the major risk factors for cataract, which is mainly dietary habits, UV exposure, diabetes, hypertension, BMI, smoking, socioeconomic factors, and age-related. My study mainly focuses, as I've discussed, that it focuses on the underweight and the other associated risk factors. So the objectives that we have undertaken here are demographic characteristics, metabolic status, lifestyle-associated risk factors, which include smoking and alcohol, And then we have cataract due to sun exposure and indoor kitchen smoke exposure, and diet-related progression and incidence of cataract subtypes. Here is some of the literature review that I've undertaken. I would like to bring you focus to the fact that I've taken for open angle glaucoma instead of cataract, because almost no studies have yet been conducted. It is the first of its kind to bring cataract into the light. Previously, the studies have been in progress for open angle glaucoma and primary open angle glaucoma and its associated risk with the underweight. As you can see, one of the studies reports that a strong association has been found with low BMI and open angle glaucoma. Another study proves that primary open angle glaucoma is increased by about 12.9% for the underweight patients. Other risk factors have been supported by numerous studies. Here was the methodology of my study, where I've taken an online questionnaire to collect the responses. Sample size was 200, and we have included states of Hyderabad, Bangalore, and Bihar, inclusive of urban, rural, and tribal population. Sorry? Yeah, so exclusion criteria was anybody who was aged less than 21 years, and it was a population-based cohort study. Here are the results of my study, which has focused upon urban, rural, and tribal population. We had 60 people from urban area, 56 from rural, and 37 from tribal population. Hyderabad, we have had 60 respondents, Bangalore 60, and Bihar 30. And this is the demographic characteristics. These are the demographic characteristics. Mainly, we are focused upon the gender, that is male and female. Males were at a greater risk for development of cataract, that is especially nuclear cataract, whereas cortical cataract was found to be more prevalent amongst the women. This is also supported by a previous study which was conducted, where 66% males were affected with cataract when compared to females. Next, we have age. Increased risk for cataract was found in the age of greater than 70 years, which was also previously supported by studies like 15% increase in the risk for cataract is seen above 40 years of age. And occupation, we have had different kinds of people from varied occupations, and mainly we have had farmers and industrial workers and housewives. Which is where we have seen most prominent cases of nuclear cataract when compared to cortical or posterior subcapsular. State or area of residence seem to have absolutely no effect on the rates of cataract incidence, which was also previously supported from the studies. Socioeconomic status, most of our respondents were from the low socioeconomic status, poor backgrounds, and which is where we have seen more number of nuclear cataract cases. About 75% increased risk has been associated with the low socioeconomic status and nuclear cataract. Body mass index, obesity and overweight is a well-known risk factor for cataracts, and it has been previously corroborated by many more studies. But in our study, the main focus is underweight criteria, where we have seen 26.5% affected individuals with cataract. And mainly, as you can see, out of 153 cases, 44 cases were alone belonging to the underweight category. And that is the maximum if we overlook the overweight criteria. And about 8 cortical cataract cases were observed out of 35, and only 1 posterior subcapsular case was observed. So we can see the nuclear cataract rate has been increasing with the underweight population. After adjusting for the confounders, we have seen that most of the underweight people were belonging to almost having no metabolic symptoms, and obesity and thyroid and hypertension were associated with the people who weren't underweight but in a normal weight criteria. Lifestyle associated risk factors, if we see a lot of people were into alcohol and smoking, which was possibly one of the main factors why we see the increased rate of nuclear cataract in this population. Along with that, we have sun exposure, an interesting criteria that says that if you're exposed to sun for more than 5 hours in a day, 5 to 7 hours in a day, which was most of our population, given that they were farmers or industrial workers, the rate of nuclear cataract is multiplied, and it is increased at an exponential rate. Next, we have taken into consideration impact of indoor kitchen smoke on cataract. Ventilation of the kitchen had no impact, but smoke emitted from the stove had significant impact on cataract. And here I would like to bring in point that a lot of people were from the rural background or the tribal background, and they were still using the wooden stove. So which is why we have seen increased cases of nuclear and cortical cataract in this population because of the stove type. Next, impact of indoor kitchen smoke, as I've just told you, it increases the nuclear cataract rate amongst these people. And most of them were involved in cooking almost twice a day, which is why we have seen a 53% increase in nuclear cataract cases. And about 60% population was using wooden stove amongst these people. Next, we have considered type of diet. Vegetarian diets seem to have a protective impact on cataract, whereas more number of cases had a strong significant association with non-vegetarian diet. A non-vegetarian diet seemed to increase the number of cases in cataract. As you can see, about 96 people were affected. Next, carbohydrate intake was taken into consideration. Maximum people were rice consumers, and very few people were into wheat, bajra, or jawar, roti, or those kind of carbohydrates. But maximum people were into polished rice consumption. So it cannot be established just yet that rice might be the culprit here, but it could be considered one of the risk factors if we progress with the study in future endeavors. Carbohydrate intake in previous studies has been corroborated to increase the cataract risk significantly, and our results are in line with this finding. And maybe we have even been able to zero down to which carbohydrate is mainly responsible. Maybe it is polished rice. And here we have different food groups which have been taken into consideration. Overall risk of cataract was in a reverse relationship with milk, fish, and liver consumption. Very few people were consuming milk, fish, and liver, and in these people, the cataract rate was significantly high. As you can see, the consumers of fish were very, very low. So there was a strong association that could be seen. And this could be corroborated with the fact that they belong to a low socioeconomic status. So their diet wasn't very well in terms of nutrients. And we can see increasing dietary intake of animal protein has been shown to have an inverse association with the development of reverse in the risk of nuclear cataract. As I previously pointed out, people who were non-vegetarian, they showed an increased risk for nuclear cataract, and a diet rich in fruits and vegetables was found to have a protective impact upon the eye health. I would like to conclude that this study reports a significant influence of underweight on cataract development, despite adjusting for the several modifiable risk factors such as sun and indoor kitchen smoke exposure, metabolic symptoms, lifestyle and behavioral risk factors such as smoking and alcohol intake. The information on increased risk associated with low BMI is pertinent, and further exploration in this regard can prove to be beneficial in alleviating the cataract risk. These are some of the recommendations that I make, that although we found a statistically significant relationship between underweight and cataract development, further evidence is required to confirm this interventional study to establish a conclusive causative relationship between underweight and cataract. A study on a larger sample size could be helpful in this regard, and we could consider this for counseling the individuals with underweight during medical nutrition therapy. A randomized controlled trial is encouraged to assess actual effect of healthy weight gain and its potential benefit in reducing the cataract risk. Strategies to improve the prevalent malnourished and underweight status amongst the Indians belonging to lower socioeconomic strata can significantly improve the cataract incidence rates, and a better standard of living as well as access to cleaner fuels may play a major role in delaying the onset of age-related cataract. Thank you.
Ramsha, thank you for a very quick and clean presentation.
Thank you so much, sir. Yes.
The presentation is now open for discussion. Do you have any questions in the chat?
Yeah. Ramsha, you have
Yes,
given
ma'am.
some of the recommendations, okay? About
Yes.
5 recommendations you have suggested. Are you
Yes.
planning to take up these aspects in the future research by you or your departmental people?
Indeed, ma'am. I'm going to do my PhD in this very regard.
In this zone itself. So you are going to continue
Yes.
these aspects. Anyway, okay.
I intend to,
Yep.
yes.
Okay, keep it up. Good.
Thank you so much.
I think we should get some questions from the audience. Only the chair and the co-chair is speaking.
I'm open to answer indeed. If you have any suggestions to make in this regard, also I'm open to it.
Audience, please be active.
They shouldn't accuse us of hogging the entire show.
Yeah, that's what. Only the chair and the co-chair, we both are only taking the main show. That's all. Please, audience. No.
I guess everyone are so stressed because of the presentations.
I know. I think let us move on to the next one.
Okay.
Sure, ma'am. Thank you for the opportunity.
Okay.
Thank you, Ms. Ramsa. Our next presentation is oral presentation by Dr. M. Nagalakshmi from Gandhi Naturopathic Medical College, India, on the topic of concepts of food in traditional yoga texts. Just give me a moment, ma'am. I'll be sharing the screen.
Am I visible?
Yes, ma'am.
Yeah. Good morning, all. Thanks for giving this opportunity. Namaste, Vijaya ma'am and Raghunath sir. When you listen the name yoga, people only think about exercises and pranayama and other stuff. Though it is a spiritual medicine and it has got its own concepts of food, and I have taken 3-4 texts as for my study. Next slide, please. Next slide, please. Yeah. See, food, Annamaya Kosha. See, food actually, it is a physical body or Sthula Sharira born out of Anna, means whatever we eat, it goes to Annamaya Kosha. So, the food we eat actually strengthens the Annamaya Kosha, like, sheep, and it prevents the experience of its true nature. And in Vibhuti Pada of Patanjali Yoga Sutra, it is given importance to how to protect the body, or how a body should be seen. So the glorification of body consists in beauty, complexion, strength, and adamantine hardness. Means to practice yoga, you have to maintain the beauty, complexion, strength, and adamantine hardness to have a confidence in whatever we are doing. Next slide, please. Yeah. As per the Valmiki Ramayana, Ahara or Anna, so there are 5 types of eating practices or food practices. Bhaksha, to be eaten, means to be eaten completely without even mastication. We just gulp it, like how we do ragi balls and other stuff. Bhojya means eaten without mastication is bhojya. And other things to be chewed. Lehya are the foods which to be licked, like the pickles and other stuff. Losya is to be sucked. The buttermilk, or the honey and other thick liquids, or any coconut water, those things. Peya, to be drunk, the buttermilk, the water or fruit juices. So these are the 5 types of foods and eating habits also. Why I had to mention this here is, we are not practicing as per the consistency or the type of food to be. Next, please.
Background in the background.
Next slide, please. Yeah, I have taken these 5 traditional, now because I teach yoga, so I have taken whatever the text I'm teaching. One is Hatha Yoga Pradipika, Hatha Tattva Kaumudi, and Sandilya Upanishad, chapter 1, where it is mentioned the 10 yamas and niyamas, and Bhagavad Gita, and last is Hatha Yoga Pradipika. Next slide, please. In Hatha Pradipika, it is given the wholesome food items of yogi should comprise wheat, rice, barley, and shashtika, the special variety of rice, which takes only 60 days to harvest. And there is an very much importance given to milk and ghee. And sugar. Sugar is not the one which we are eating. It is a candy sugar. And butter, honey, sonti or dyed ginger, and patola. Means we get something like poraval. And set of 5 recommended leafy vegetables. And green gram and little water. It is the tuvar dal is not given importance for in yogic texts. The 5 leafy vegetables recommended are Ksheeraparni, means Calotropis gigantea is the botanical name for Ksheeraparni, and Jaivanti. This is Leptadenia reticulata, and Matsyakshi, this Alternatra serratis, or we call it as Ponnaganti in Telangana, and Punarnava. Everybody knows about Punarnava. And last is Meghanadi. I did not get the botanical name for this. And in place of Ksheeraparni or Matsyakshi, Brahmanda gives a variant of Vastu Mulyakshi. There is another in alternative to Ksheeraparni and Matsyakshi. Moreover, yogi should consume food which is sweet, unctuous, light, containing milk products. Milk is given very much important for yogic practices. Nutritious food items of one's choice and suitable for the practice of yoga. Next slide, please. Yeah. And Kupatya, the foods which should not be taken. So the bitter, sour, pungent, high salty, very hot, and green leafy vegetables, which are sour, cruel, and oil. The extracted oil, he meant extracted oil, not the vegetable sources. Mustard, sesame, fish, alcohol, meat like mutton, etc., curd, buttermilk, kulatta, and berries, oil cakes. We use oil cakes in our food items, and hing or asafoetida, garlic are unsuitable for consumption because they're all stimulants. So stimulation causes a diversion of mind. So food that has been heated over again means reheated food, and food which is dry means which doesn't have the rasa and snigdha, and excessively salty paste of sesame. We normally use sesame for calcium and other nutritional resources, but in yogic texts, for yogic practices, the paste of sesame is not advised. And stale food and excess of vegetables are also unwholesome and must be removed. And consuming means atha mitahara, means the eating little. Consuming sweet and unctuous food, keeping 1/4 of stomach empty and consumed after offering to God with a view of pleasing him, means Ishwara Pranidhana. So whatever we do, we receive from nature, it needs to be given to the Ishwara as Ishwara Pranidhana. So you have to offer the food to the Guru, then only we have to consume.
Dr. Nagalakshmi, sorry to interrupt you. You're running out of time. Kindly
Okay,
try
ma'am.
to wind up, please.
Yes, please. I think I got 10 minutes. Anyway, next slide, please. Next slide. Yeah, Hatha Tattva Kaumudi, the narration of purification of food, which purifies nadis, means the food you take will only purify the 72,000 nadis. So the purification of food yields to purification of sattva. Sattva means the one of the constitutions of the body, which consequently offer smriti, the memory. That removes the knots, means any blockages in the nadis. The sali. So according to Hatha Pradipika, whatever we have read, I have read earlier. Next, please. Next slide, please. Yeah, recommend as per the Hatha Tattva Kaumudi, the recommended foods are the wholesome food items for yogi should comprise grains like wheat, rice, barley, sashtika, milk, ghee, cream, butter, sugar candy, honey, dry ginger, and patola fruits. In the process of purification of nadis or mulabandha, chiefly the ghee and milk are helpful. So cold cow milk with ghee and pure cream, ghee, buttermilk, and unextracted buttermilk, and among sweet sugar candy, but avoiding jaggery and molasses are wholesome. So panchakshu, the 5 leafy vegetables. Anyway, I read it earlier. Next, please. So the hot, the unwholesome food, even according to Hatha Tattva Kaumudi. So the hot, bitter, sour, pungent, salty, these foods need to be kulakatta, the type of lentil, berries. This need to be avoided. Then food that has been heated over and over again, excessively salty, stale food, it needs to be again avoided. Next, please. So during practices, in the initial phase of practice, one should avoid food containing excess of milk, heavy articles like horse gram, black gram, and pigeon pea, arhar dal. So we call it as tuvar dal, which cause burning. However, soup prepared of arhar dal or pigeon pea mixed with ghee is desirable. One should entirely eschew unwholesome food or podrava, a variety of rice, Bengal gram, mustard seed, or like varieties of bulbous roots. Moreover, yogi should avoid curd and tamarind, which are sour and which generate phlegm, means the kaphatva, the astringent, the food like unripe berries, bitter like neem, etc. should be avoided. Rather, he should consume ghee mixed with rice and milk and preparations made of wheat. Always, the yogi should consume food with little ghee and milk and only milk. He should always stick to moderate diet. Next slide, please. And Sandilya Upanishad says, Mitahara is taking oily and sweet food, leaving 1/4 of stomach empty. Next, please. In Bhagavad Gita, there is a clear description of the foods which we have to consume, and we express, or the constitution represents what the kind of food we take. So the person of the sattvic food is the person in mode of goodness prefers food that promote lifespan, increase the virtues, strengthen health and happiness. Such foods are juicy, succulent, nourishing, and naturally tasteful. So it means the whatever the food we are consuming, it should retain its rasa, means the juice and also oil. The next is the person who eats sattvic diet will behave like a sattvic person. Next is rajasic diet, food that are bitter, too sour, salty, very hot, pungent, dry, and full of chilies are dear to the person in the mode of passion. Such foods produce pain, grief, and disease. And next is food that are overcooked, stale, putrid, polluted, and impure or dear to the persons in the mode of ignorance, means tamasic diet. Next, please.
Ma'am, kindly wind up. It already exceeded your time limit.
No, I was given 10 minutes, right? Anyway, next slide. I am finishing. Next is only one slide, I think. Yeah, Hatha Yoga Pradipika. So these are the foods injurious to yogi. Next, please. Thank you for giving this opportunity. Thank you.
open for questions.
If there are no questions to the presenter, Roshni, I suggest we move to the next speaker.
Thank you.
Okay, sir. Thank you, ma'am. Our next presentation is oral presentation by A. Malati Shamala from Osmania University, India, on a topic of effect of naturopathic diet on obese PCOS, a case study.
Hello, good afternoon all, ma'am. Yes, ma'am. Yeah, am I audible, ma'am?
Yeah.
Yeah, ma'am. I am Dr. A. Malati Shamala, ma'am. I am from the Osmania University. I am doing my PhD on the PCOS, ma'am. And also I am the naturopathy doctor. Here I would like to share the effect of naturopathic diet on obese PCOS. The patients who are obese and having the PCOS, I have done a case study, ma'am. Please, next slide. Next slide, ma'am. Hello. Yeah. We all know that polycystic ovarian syndrome is a common endocrine disorder that is observed in the reproductive age of the woman. It appears with amenorrhea, oligomenorrhea, and in some cases, gradual increasing of the weight. And also we'll find the acanthus and hirsutism is the main characteristic features of the polycystic ovarian syndrome, ma'am. Next slide. Next, ma'am. Yeah, it is I have taken the Rotterdam criteria for the classification of this. That is irregular periods and high androgen effects and multiple cysts in the, when we do the scanning of abdominal scanning, when we do that, it is having a more than cyst, ma'am, in the immature follicles are observed in that. So I have taken the Rotterdam criteria, ma'am, for this case. Next, ma'am. And the case details are, the patient is a 29-year-old female, ma'am, was consulted at the Nature Cure Hospital with the chief complaints of the patient has complained about the gradual increasing of the weight and irregular menstrual cycle, and she got her married life is 2 years. She's very anxious to conceive, ma'am. She didn't get her any this thing. Even she has not conceived at a time, one time in her married life. So she has taken that. Next slide, ma'am. Next slide, ma'am. Hello, ma'am. Next slide, please. Yeah, with this complaint, I have advised with the use this scanning, ma'am. And bilaterally, she is having the volume of the ovary is 12 cc, ma'am. When we consider according to the I have taken the gynecologist also the consideration in this. The above 10 cc is the considered as a name polycystic ovarian syndrome, ma'am. Ovary that ovary is a polycystic ovary. So it is a bilaterally, it is having the 12 cc bilaterally, and she was on the hormonal therapy for 1 year for this complaints, ma'am, but she is not satisfied with the therapy, ma'am, because she's gradually increased her weight, and she's developing the continuously the unwanted hair growth, and abdominal waist and hip ratios are increased, ma'am, in that. Next slide, ma'am. Yeah, initially I have given the counseling, ma'am, because she has chosen the naturopathy as an alternative medicine, and then I have given the counseling about the naturopathic diet, how it is and how it could be, how the following the patterns and all the scheme of the naturopathic diet and the presentations have explained to her. And then her vitals are also I have noted, ma'am. The weight was it was 74.2 kgs and the height is only 5 feet, ma'am. And the BMI is 31 kilograms per meter square, and the weight ratio is 0.98, ma'am. Next slide, ma'am. Yeah, according to naturopathy, here I would like to give an introduction about the naturopathy diet, ma'am. It is according to Bhagavad Gita, the diet has classified into Sattvic, Rajasic, and Tamasic, ma'am. So the naturopathic diet is entirely a Sattvic diet, which is easily consumable, and the Sattvic diet means not only the raw material or fruit juices and the fruit pulps, ma'am. The cooked diet also, if it is freshly prepared, after preparation, if it is consumed within the 1 hour of the preparation, that is also called as a Sattvic diet, ma'am. So here in the Sattvic diet, again there is a classification, ma'am, according to naturopathy, that is the eliminative diet, raw diet, soothing diet, and constructive diet. So the eliminative diet is mostly it is a conditions of the detoxification, because in naturopathy, sarva roga malavesho, that means for all the diseases only the cause is the toxins are presented in the body, ma'am. So for the detoxification, we have to go for the eliminative diet, ma'am. That is, the eliminative diet consists of the liquid diet, that is citrus fruits and juices, tender coconut water and buttermilk. Raw diet is anyway the fruit, fresh fruits and the raw salads, sprouts and etc. Soothing diet is only the diet which is having the soups and boiled vegetables, soups and buttermilk, any porridges that especially the alkaline. The naturopathic diet is consisting of the 20% of the acidic and 80% is the alkaline diet, ma'am. And the constructive diet is a bodybuilding diet, that is increases the immunity. Apart from the other diet, this is also can be given, ma'am. That is a cereals, whole grains, millets, pulses and preparations and all. Next, ma'am. Next, ma'am. Yeah, according to the naturopathy, the main cause of the illness, as I've said, it is the intoxication. So hence the prime treatment is the elimination of the toxins, ma'am. This can be done by the any one of the diet therapy, ma'am. That is diet therapy, hydrotherapy, massage therapy, mud therapy, etc., ma'am. This what I am showing is in a hydrotherapy. It is a steam bath is a one kind, ma'am, because this thing. Next, ma'am. Next slide, ma'am. And then the mode of the diet intervention I have given after the counseling to the patient. I have given initially for the detoxification for the 3 days, ma'am, because I have advised for taking a complete rest from her routine lifestyle, ma'am, because here we are consuming only, I have advised only the liquid diet for the detoxification. Apart this, I have given some mud packs, the cold packs on the abdomen, and drinking of the 3 liters of the, taking the 3 liters of the water. This is only for the 3 days, ma'am. That is a 7 a.m. lemon juice with honey, and 9 a.m. is a barley water, any fruit juices available seasonally, ma'am. And 11 a.m. is a buttermilk, and 2 p.m. is a coconut water, and 6 p.m. herbal tea and with honey. Next slide, ma'am. And the diet from the 4th day to the 10th day, 10 days I have advised the soothing diet. This is barley water, coconut water, porridges like sago, thin dal, boiled vegetables, fruits, etc., ma'am. Next slide, ma'am. The constructive diet is about 13 kilocalories, 1300 kilocalories of the approximately it is. So I have given the ragi malt, sprouts and wheat pulka. One time here I have advised her to take an cuckoo diet, and other time is only the seasonal fruits and salads, ma'am. This I have continued for, advised her for the 6 months period, ma'am. Next slide. I have advised to continue this diet for the 6 months by monitoring the monthly vitals, ma'am. It is observed that the 6 months of the period, naturopathic diet interventions, there is a no complaint of giddiness, weakness, constipation, laziness. Because low calorie diet, some of the people, they get the constipation and weakness, giddiness, and they become the lethargic. But these kind of symptoms, adverse reactions, adverse complaints, I have not received from the patient, ma'am. Next slide. Next slide, ma'am. Yeah, the progress in the weight reduction is when I have given the eliminative diet, that is a fluid diet, 2 kgs to, that means 2 kgs they have reduced, and soothing diet is only the 3 kgs. And when the constructive diet, the weight has reduced from 71 to 66 kgs, ma'am. The patient has come to the 66 kgs. Next slide. And then the BMI has come from the 31 to the 27.5. The patient is obese too. It has come to the overweight condition, ma'am. By following the diet for the 4 months, she got her periods, ma'am. And then as she continued the diet, her periods were regularized. After the 1 month of the regularization of the period, she conceived, ma'am, with the naturopathic diet intervention. Next slide. And these are the reports, ma'am. She was diagnosed both the ovaries are with the enlarged with the PCOS, and also she was diagnosed a grade 1 fatty liver, ma'am. And next slide. And the PCOS has reduced, and then she conceived, ma'am. This is a early pregnancy scan, and this is the scan report, ma'am. Next slide. These are the scan report, the baby ultrasound scan reports, ma'am, the fetus scan report after the 4 months of the conceiving of the intervention of the naturopathic diet. Next, ma'am. And finally resulted she has delivered a baby girl, ma'am. Next slide. And the relevant studies, what I have taken for this case study, and the relevant studies, the effect of the approach and all these are the relevant studies for my study, ma'am, for the case study. Next, ma'am. The case was shown a progressive in the PCOS with a naturopathic diet intervention. There is a reduction in the weight and which has impact on the insulin resistant that connected to the hyperandrogenemia and resulted in the pregnancy, ma'am. Hence, it is stated that following the naturopathic diet schematically can do better in case of the PCOS, ma'am. Next slide. Finally, I would like to say one word, ma'am. If anybody is having the faith and determination, the results may come to this, ma'am. This picture I have taken the consent of the patient and I have presented here, ma'am. Thank you, ma'am. This is Dr. A. Malati Shamla, ma'am. Thank you for giving this kind of opportunity, ma'am.
Good. It's really good. See, one thing you have just said is the hormonal treatment. Maybe
hello, ma'am.
Hormonal treatment you mentioned, no? Before what naturopathic treatment, she was on hormonal.
Yes, ma'am. She was.
Yeah.
Yes, ma'am. She was on the progesterone, ma'am, continuously.
Yeah, that might have contributed for the obesity. I think maybe that may be the other reason also. To
yeah, ma'am. Yeah, to a certain extent, it has contributed, ma'am. But the thing is that she was on the before coming to this, she was on the hormonal therapy, ma'am. And with that, yes, ma'am, because she's not getting her period. When she takes a pill only, she is to get the periods, ma'am. But here, I have advised her to stop the medication and come to the naturopathic diet and then do this. Hello, ma'am.
That may be due to the what you can just say the irregular periods, maybe due to some metabolic disorders or something.
No, ma'am. I have checked for the any thyroid or any other that is not there, ma'am. She is thyroid free, ma'am. She is not having hypothyroidism. I'm sorry, ma'am. I have not mentioned that. I'm sorry. But
okay. It's all right. But anyway, it's a good case study, and then some impact is really there, especially because the obesity is mainly the precursor for many of the diseases. I tell you, it is not a disease, obesity.
Yes, ma'am.
But it is a precursor for
it is a condition, ma'am.
Yeah. So you have to really.
It is a condition, ma'am.
I know.
Dr.
Yes,
Malati,
yes,
Dr.
ma'am.
Malati, I want to just have a clarification.
Yes,
so
ma'am.
naturopathic
Yes, sir.
diets exclude any foods of non-vegetarian origin like milk.
Yes, sir. Yes, sir. Non-vegetarian foods we totally avoid, sir. We won't give any in naturopathy. It is only a sattvic diet, not the Rajasic and Tamasic diet. Tamasic diet is a non-vegetarian diet, sir. So we won't apply and we won't give.
They're able to maintain regular weight gain during the pregnancy.
Yes, sir. They maintain, sir. I have already presented my article as well published on the role of the naturopathic diet in the pregnancy, antenatal care. That is also published in the international journal, sir. It is published. I have done the study also, sir, on that. It is no problem, sir. Weight gain is normal in this because we consume the dal and all other frequently, and the fruits and all the fresh preparedly meals and all. Then they are not putting, it is not having any weight this thing on the child, sir. Even the premature preterm babies are also in the vegetarian diet is not having any issues, sir.
That's good. A nice study, nicely presented. Thank you very much.
Thank you, sir. Thank you so much, sir.
Roshni, are there any questions from the audience?
I guess there are no questions from the audience, sir. Like none of them has texted in the chat box either.
In that case, we can go to the next presentation.
Yes, sir. Our next presentation is oral presentation by Dr. V. Sridevi from Government City College, Hyderabad, affiliated to Osmania University, India, on a topic of the impact of nutritional diet in an athletic performance, a pilot study. Dr. Sridevi, could we have you, please? I guess we didn't have Sridevi ma'am today. We will be moving on to our next presentation, sir.
Hello.
Madam, when we presentation now, Pani suggests the link.
Ma'am.
So I have heard all your.
I'm sorry. Our next presentation is oral presentation by Ms. Jyoti from Institute of Management Studies, India, on a topic of role of dietary fiber on gut microbiota and its association with the diabetes mellitus, a review.
Good afternoon, everyone. This is Jyoti Pachisia here. Can you share the slides, please?
Yeah.
Yes, ma'am. Good afternoon, everyone. This is Jyoti Pachisia here. We'll be presenting a topic on the role of dietary fiber on gut microbiota and its association with diabetes mellitus. Next slide, please, ma'am. The rate of diabetes diagnosis is increasing. Ma'am, can you please change the slide? The rate of diabetes diagnosis is increasing around the world and including in India. And India has the second highest total population in the world at more than 1.3 billion people. Now, as per the studies done by the International Diabetes Federation, around 72.9 million adults in India were living with diabetes, and the prevalence was higher in the urban areas. The reasons for the escalation in diabetes in India were the increased insulin resistance, strong genetic factors, then environmental factors particularly associated with the urbanization. Diabetes mellitus overall is a chronic metabolic lifestyle disorder which is considered as one of the fastest growing international health emergencies in the 21st century. Diabetes, if not treated well, may have significant impact.
Roshni, I think there is a side talk is there, some disturbances are there.
Yes, ma'am. We have
Please
muted
ask
them.
somebody to control that one.
Yes, ma'am. Okay.
Ma'am, can you please come to the next slide? The treatment and the management of the diabetes includes the oral intake of the antibiotic drugs followed by the insulin therapy due to the progressive deterioration of the beta pancreatic cells capacity. Recently, dietary interventions for diabetes remains the foundation, and among the most studied dietary pattern, therapeutic effects of the dietary fiber is an increased interest. Dietary fiber is neither digested nor absorbed in the human small intestine, and it's highly associated in the gut hormone and gut microbiota, especially in regarding the relationship with the diabetes also. Now, next slide, please. Let us know how diabetes affects the gut microflora or the microbiome. As we all know that the human gut is a complex ecosystem consisting of microbiome, host cells, and the nutrients. Gut microbiota composed of hundreds trillion bacteria in the intestinal tract and plays a very important role in the nutritional absorption system and supports the intestinal barrier enhancement. Modification of gut microbiota caused by external interventions such as diet leads to dysregulation and secretory changes of intestinal microbial metabolites, triggering a variety of the potential mechanisms leading to the insulin resistance as well as the diabetes. The gut microbiome interacts with the dietary components and habits to influence host insulin sensitivity, intestinal permeability, glucose, as well as the fat metabolism. A decline in the butyrate producing bacteria like Clostridium lectum, Rosevaria species, and many others is considered as an important cause of the impaired blood glucose metabolism. Not only because of this nutrient deficiency, since butyrate is the important source of the energy, as we all know, for the colonial epithelial cells, there can be the loss of energy also, and further complications might happen. Not just the butyrate, even the action of the saturated chain fatty acids, as you can see in the slide, the branch chained amino acid, succinate and indole, as well as the imidazole, all these microbial metabolites are found to be depleted in patients with the diabetes mellitus. As a result, the hepatic glucose metabolism and other metabolic steps are hampered, which increases the insulin sensitivity, resulting in the further complications in the body like the cardiometabolic risk. However, it is not possible. It is possible that to improve diabetes through the introduction of the high fiber diet. High fiber diet will improve the quantities of the saturated fatty acids producing microbiota, which leads to the reduction in the HbA1c levels. Ma'am, can you please go to next slide? Ma'am, okay, thank you so much. Dietary fibers, we all know, are the compounds of the natural origin present in the plants chemically known as non-digestible carbohydrate. And the human gut microflora encodes several types of carbohydrate active enzymes, including glycoside, hydrolysis, polysaccharide lysis, glycosyl transferases, and many others, which are capable of the degrading dietary fiber and then generating small molecular weight metabolites that displays anti-diabetic effects. Dietary fiber increases the abundance of species like Embacterium species, rose bacteria species, bacteriotes, bifidobacterium, and decreases the gram-negative bacteria, which produces lipopolysaccharides. Dietary fiber enhances the production of the saturated chain fatty acids, which bind the GPR receptors and also enhances the levels of enteroendocrine hormones in the gut epithelial cells, thereby improves the appetite regulation, also energy intake or expenditure, as well as the lipid oxidation. Moreover, individuals consuming predominantly plant-based foods, the gut microbiota produces saturated fatty acids, enzymes involved in the anabolism, and also increases the synthesis of amylase glutamate, as well as the riboflavin, which is vitamin B2, which are further involved in the colonic fermentation and the enhances the energy in harvest also. Ma'am, can you go to the next slide? Last but not the least, the diet rich in the dietary fiber is beneficial for the treatment of the diabetes mellitus, as dietary fiber ameliorates postprandial hyperglycemia by delaying the digestion and the absorption of the carbohydrates and enhances the satiety, which leads to the reduction in the body weight. An increase in the dietary fiber also increases the abundance of the human intestinal microflora and leads to higher microflora richness. Fiber intake is also associated with the higher microflora stability. Dietary fibers belongs to the prebiotics, which are not digested and absorbed by the human gut and remains intact while passing through the gastrointestinal tract. They selectively arouse the growth and the activity of the potential beneficial bacteria in the gut. I would like to end this. That's it from my side. Ma'am, can you please go to the next slide? These are my references that was used for my the review studies. Thank you so much.
Dr. Pachisha, thank you very much for a very clean and neat presentation. I wish more of our presenters take cue from you, because you did not really read out from the slides, which is another thing. One question to you. Have there been any studies made on the differential response of the microbiota of guts with regards to dietary fiber in terms of soluble fibers and insoluble fibers?
I'm sorry, but I couldn't get your question. Could you please be a little louder?
Yes. What I wanted to ask you was, Hello. Has there
Yes,
been has there been a difference in the response of the gut microbiomes or gut bacteria, or for that matter in your diabetes mellitus, with regard to soluble fibers and the insoluble dietary?
So to certain extent, there was seen a difference, but not so much. But still, studies are still been going on to know more about in detail, sir.
It's
Because
coming up.
again, the thing is that there are many sources of the dietary fiber, as we all know, right? Like there can be mainly the millets and the other sources are involved. So the studies are still conducted to know more about it, that which bacteria is more helpful in these things right now, sir.
Thank you.
Okay, sir. Thank you so much, sir. Thank you everyone for allowing me to present this topic. Thank you so much.
Thank you. Our next presentation is oral presentation by Ms. Riya Kushwaha from Banaras Hindu University, India, on a topic of impact of Indo-Mediterranean diet on adiposity of patients suffering from type 2 diabetes.
Good afternoon, respected to all of you. My name is Riya Kushwaha. Good afternoon, respected to all of you. Am I audible?
Riya, you're audible and your presentation is also visible, but I suggest that you reduce the zoom ratio of your presentation. You're not able to see the whole screen.
No, okay, sir.
Still more, please. Reduce the zoom. You're getting there some more.
No, fine, sir.
A little more, please.
Wait.
Some more. Some more. Okay.
No, fine, sir.
Back to the higher zoom ratio. We cannot see the entire slide. You were okay before, but once again, it's back to the same. I think we should go with this. Don't go to the slide presentation more. It's getting to be too big.
Roshni ma'am, can you please share my slide in your sides?
Yes, please.
Okay.
Is this okay, sir?
Yes, this is okay. Please carry on.
Okay, thank you so much, sir. Good afternoon, respected to all of you. My name is Riya Kushwaha, PhD scholar, Department of Kaya Chikitsa, Faculty of Ayurveda, IMS BHU, Varanasi. My supervisor, Professor O.P. Singh, Department of Kaya Chikitsa, Faculty of Ayurveda, IMS BHU, Varanasi. Ma'am, could you please next slide? Okay. Introduction. The accumulation of and the excessive amount of fat can cause type 2 diabetes, and the risk of type 2 diabetes increases linearly with an increase in body mass index. Accordingly, the worldwide increase in the prevalence of the obesity has led to a concomitant increase in the prevalence of type 2 diabetes. The cellular and physiological mechanisms responsible for the link between obesity and type 2 diabetes are complex and involve adiposity induced alterations in beta cells function, adipose tissue biology, and the multi-organ insulin resistance, which are often ameliorated and can even be normalized with adequate weight loss. Being another risk with the overweight is type 2 diabetes, high blood pressure, heart disease, and strokes, certain types of cancer, sleep apnea, and osteoarthritis, fatty liver disease, kidney disease, and pregnancy problem, etc. Ma'am, next slide. Okay. According to the WHO reports, chronic illness contribute to the 60% of death worldwide. Being a major chronic disease, type 2 diabetes seems to be one of the leading cause of mortality and of public health burden. The increasing incidence of the diabetes worldwide has been highly linked to the westernized dietary pattern, physical inactivity, and increasing rates of the obesity and metabolic syndrome. Genetics, environmental, and metabolic risk factors are the interrelated and contribute to the development of the type 2 diabetes mellitus. Can see very clearly in this flow diagram the ethnicity and diabetes. The positive energy balance, both adiposity have a same BMI, but still the more favorable adiposity genetic alleles develop to subcutaneous obesity, means to healthy adiposity tissue, and another one is less favorable adiposity genetic alleles is the visceral and ectopic obesity, dysfunctional adipose tissue. The more favorable adiposity genetic illness is the lower risk of type 2 diabetes, hypertension, and heart diseases. Another one is the less genetic alleles is the higher risk of type 2 diabetes, hypertension, and heart disease. Next slide, ma'am. A strong family history of the diabetes mellitus, age, obesity, and physical inactivity identify those individuals at the highest risk, and the minority population are also at the higher risk, not only because of the family history and genetics, but also because of the adaptation of the American environmental influences of poor dietary and exercise habits. Women with a history of the gestational diabetes as well as their children are at greater risk for progressing to type 2 diabetes mellitus. Next one, ma'am. Okay. Insulin resistance increase a person's risk for developing impaired glucose intolerance and type 2 diabetes. Individuals who have insulin resistance share many of the same risk factors as those with type 2 diabetes. These include hyperinsulinemia, atherogenic dyslipidemia, glucose intolerance, hypertension, prothrombic states, and hyperinsulinemia, and polycystic ovarian syndrome. Current interventions for the prevention of retardation of type 2 diabetes mellitus are those targeted towards modifying environmental risk factors such as reducing obesity and promoting physical activity. Awareness of the risk factor for developing type 2 diabetes will promote screening, early detection, and treatment in high-risk population with the goal of decreasing both microvascular and macrovascular complication. In this histogram bar, we can see this percentage shows to risk of the type 2 diabetes, and this one is the birth weight category. The birth weight with non-obesity is lesser risk of type 2 diabetes, but with the birth weight is obesity is more chances to develop the type 2 diabetes. And next one. Okay. Indo-Mediterranean diet. The traditional Indo-Mediterranean diet is characterized by the highly intake of olive oil, fruits, nuts, and vegetable, cereal. In this pyramid, we can see the which food groups should be consumed in daily life is olive oil, fruits, nuts, vegetable, whole grains, and cereal also. And in a weekly, we should be consume the sweets, egg, poultry, fish, and seafoods, and monthly meat. Wine is also should be included in Indo-Mediterranean diet in moderate amount. Drinking water is also mandatory, and physical activity also very important part of Indo-Mediterranean diet. Next one, ma'am. Okay. How to prevent type 2 diabetes through the Mediterranean diet? How to effect direct effect via indirect effect. Olive oil, fish, vegetarian fruits, legumes, nuts, wine, cereal. richest source of fiber, antioxidant, magnesium, and moderate alcohol. The fiber help to delay the gastric emptying, and antioxidant increase the oxidative capacity, and magnesium is ATP and the phosphate transfer associated enzymes, and moderate alcohol help to adiponectin. And indirect effect on the weight control to prevention of the insulin resistance and preventing of the pancreatic beta cell dysfunction with the help of vegetarian diet brings to offer type 2 diabetes. Next one, ma'am. The indirect effect of weight control, how to impact traditional Mediterranean diet on weight control is the high intake to legumes, fruits, vegetables, cereals, olive oil, and fish. These are richer source of dietary fiber, and these are unsaturated fat, and low intake of meat and dairy products. The unsaturated fat increase the fat oxidation, and these are effect on the satiety. Dietary fiber is effect on satiety and increase the energy density with the help of we can control the weight. Next one, ma'am. Okay, conclusion. The Indo-Mediterranean diet has been found to protect against CVD and diabetes. It is proposed that the whole grain contain a particularly antioxidant in various diet may explain at least one part of the difference in the cardioprotective potential of these diet. The Mediterranean diet has been shown to decrease the biomarker associated with increased risk of the cardiovascular disease. Further, numerous studies have demonstrated that the Mediterranean diet improves the insulin resistance, rises to HDL cholesterol, and decrease the plasma triglyceride as well as inflammatory markers and blood pressure. There are also fair number of the publications that promote to support a low-fat diet as the best alternative of decreasing the biomarkers associated with type 2 CVD and metabolic syndrome. However, there are the fundamental differences between the Mediterranean diet and characterized by the high consumption of oleic acid and fatty acid versus the low-fat diet which focus in decreasing saturated fat intake. Next one. These are some differences. Thank you.
Ms. Kushwaha,
Yes, sir.
I think your title slide is a bit misleading in two aspects. One is that Indo-Mediterranean diet.
Yes,
But what
sir.
you have presented essentially the Mediterranean diet, and I failed to see what kind of Indianness has been brought in. Number two, you said of patient suffering from type 2 diabetes. I was expecting some case study, but it was a general presentation without regard
Yes,
to the
yes,
particular
sir. Sorry.
patient.
Yes, sir. Sorry for that. Actually, right now I'm doing a study on the obesity effect of the Java and Chana and Ragi. It's my topic of PhD, but still I didn't take my data collection. That's why I didn't present on database presentation. That is review
Then you
in
should have
short
titled your
times.
presentation accordingly.
Okay,
Okay,
sir.
no Indo-Mediterranean kind of thing. Okay, so please
It
take care
sounds
in
very
future.
sophisticated.
Okay, sir. Thank you, sir.
Thank you.
Next
We go to the next presentation.
Okay, sir. Our next presentation is oral presentation by Dr. Tasneem on a topic of dietary approach from management of undernutrition. Dr. Tasneem, could I share your screen?
I think you should share her screen if she has sent the file. Dr. Khan, could you please begin your presentation?
I guess there is an issue, connectivity issue from her side, sir. We will be moving on to our next presentation, which is e-poster presentation by Debjani Das on a topic of prebiotic, probiotic, and symbiotic foods for healthy security.
Okay. Ms. Das, before you present, please know that you have only 8 minutes for presentation. So please keep it brief.
No, 4 minutes
and
only.
to the point.
4 minutes only.
Okay, I'm sorry, I stand corrected. 4 minutes only.
Good afternoon to everyone. Ma'am.
I guess someone are using the Zoom nearby because of its echoing. Ask them to mute or stop the audio. I will be sharing the screen for you.
Hello, am I audible, ma'am?
You're audible, please go ahead.
Okay. So very good afternoon to everyone. My name is Debjani Das, PhD research scholar in the Department of Food and Nutrition, College of Community Science, Professor Jayashankar, Telangana State Agriculture University, Hyderabad. So firstly, I would like to start by saying that let the food be the medicine and medicine the food. So it means like proper diet is a very important for gut health as well as healthy life. And why is gut health is very important? Because it relates to basically every aspects of our well-being. Gut is populated about 500 different species of microbes, most of which are non-pathogenic bacteria. Increasing the quality of good bacteria can help keep our body healthy and happy, contributing to digestive health, immune health, and disease preventions. So what is prebiotic? Prebiotic is nothing but it is like are the substance which are the substance or like the fiber rich foods and all, like, and probiotics is like live bacteria or microbes, and the symbiotic is like the combinations of prebiotic and probiotic. Prebiotic and probiotic or the symbiotic are the words of the modern era bookmark for life, and it is used to define the bacterial associations with beneficial effects on human health. So, but most of the people are saying like prebiotic, probiotic, and most research work also it is proven that prebiotic, probiotic rich foods are good for our health, and the benefits of prebiotic and probiotic is countless, like improve immune function in both the gut and the body, enhance bone density, increase the calcium absorption, establish the healthier balance of bacteria in the gut, and also increase the level of lactobacilli and the bifidobacteria and balanced gut microbiota, promote bowel movement, suppress appetite, reduce the risks of intestinal infections and colon cancer, and also preventions of carcinogenesis, as well as the support of lactose intolerance and dental caries treatment, prevent harmful bacteria from multiplying in the intestines. So most of the people have one thought like only expensive foods only help to improve our health. But unfortunately, it is not true, because from low cost food also can get the sufficient amount of prebiotic and probiotic. Like source of probiotic, we can get curd, yogurt, or soy beverage, or fermented milks and pickles. And also prebiotic also we can get from the garlic, onion, legumes, green leafy vegetables, wheat, oats, etc. And one of the doubt also have, like some people have some doubts, like if probiotic and prebiotic is good for health, so supplement also it will be good. But no, if we are like healthy peoples or adult people, if we get the sufficient amount of foods from our daily lives, so will not will not take these supplements. Because if we get the proper from like card, we can get probiotic, like fiber rich food, we can get prebiotic. So if we get from that diet, so we not suggest for the supplements. Supplements for suggest only for those who are 40 to 50 years who are not getting sufficient amount from this food. So or their absorption capacity, only for that only supplement is sufficient. So that's the thing. And lastly, I would like to conclude by saying that a diet high in starch and fiber provide a prebiotic which keeps a healthy populations of probiotic our intestines, and daily consumptions of probiotic rich foods, particularly fermented dairy products like curd, yogurt, and adequately supplies the amount of probiotic. Lastly, like to conclude, like we need to add in our diet all these green leafy vegetables or all these things, and fermented foods which keep our gut healthy, and this healthy gut is a symbol of healthy life. So lastly, I like to thank to everyone to giving this opportunity and giving your valuable time for me. Thank you so much.
Thank you, Ms. Debyani. It's a general
Thank you,
presentation paper, but I wish you had more focused on the health security aspect of the pre and probiotics. Nevertheless, it's a short and nice presentation. We can go to the next presentation by Dr. Prasanna. Roshini, could you invite the next speaker?
Yes, sir. Our next presentation is by e-poster presentation by Dr. S. Prasanna on a topic of vitamin A in oral health. Just give me a moment, sir. I'm sharing the screen. Dr. Prasanna, are you there?
Yes, ma'am. I'm Dinesh. I'm co-author. I'm there.
Yes, sir. Kindly start your presentation, please.
Good afternoon, everyone. I am Dinesh from Raja College, Bangalore. Today I'm going to, and my author is Dr. Prasanna, is a senior lecturer in Sima Dental College, Rishikesh. My topic is on, I'm doing a post presentation on vitamin A in oral health. Is my voice audible?
Yeah.
Yeah, thank you. So to begin with, the role of importance of vitamin A is, the role of vitamins are important for your body normal function, growth, and other developments. So when it goes beyond a limit, or when it is having lacking of the particular vitamin, it will be creating health problems. So vitamin A is one of the earliest vitamin known, and it means for the meaning is vital. Vitamin means vital and amine. So it is one of the earliest vitamin which is discovered and essential for the nutrients, and it is important. So the vitamin plays a role in dental health also. So based on that, this deficiency or can relate to many of your functional diseases or problems. So vitamin A deficiency leads to night blindness, delayed growth, dry skin, dry eyes, infertility, and reducing the capacity in wound healing. Okay, it can cause skin problems and acne and other problems, and also leads to infections in the chest and throat and other things. Now, the main role of functions of vitamin A are, it's a significant role in, it helps in the vision, and it will help, another function is it also plays a role in the growth and development and also the reproduction function also. So it helps in the managing the steady in the cellular level development, growth, and also. So it helps in the repairing and growth, and also maintaining the cellular functional level, like the epithelial cells and other cellular level thing. So it also plays a role in helping in the production or synthesis of your glycoprotein, and vitamin A deficiency can lead to infection also. So it helps in the fighting of one of the function is to maintaining in the level of vitamin A. It helps in the proper functioning of the immunity also. Now, what will be the role of the vitamin A in the dental field also? So it plays an important role in the diseases like measles. It also plays a role in the leukemia, oral subungual fibrosis, and it helps in the growth promotion. It improves the wound healing capacity following any mouth ulcer and other thing. And it improves the immune defense, and it protects the layer of the oral cavity lining, and namely the enamel and other linings. It also helps in the bone growth and normal cell development. It keeps the mucus from forming cells from becoming keratinized. So it avoids the keratinizing of your mucus forming cells, and allows the differentiation of cells. It stimulates the osteoclast functioning, and it also permits the normal tooth spacing. So it normalizes the cellular development and maturing the enamel layer for the developing of the cell in the dental function. So synthesis of the glycoprotein, it also manages the synthesis of glycoprotein, and they are as the functioning help in the done by the function of vitamin A. So it helps in the maintaining the synthesis of the glycoproteins such as the mucin, which plays a major role, which is managed by your vitamin A normal level. So finally conclude that vitamin A is one of the important factors to maintain the normal regular health and also other related functions related body, so which helps in the protecting the dental illness, preventing the dental illness, and also the general health of the body in to maintain. So regular monitoring of any vitamins, and also along with that the level of vitamins in your body can avoid diseases or any other infection. Thank you, ma'am, for giving this opportunity. I conclude my presentation.
See, it is a sort of the general information. What is the research component in your poster?
No, ma'am. We are not done as the recent research presentation. We are just presenting the role. I'm just giving a general. This is a general presentation on the importance in the dental field. And this, that's the thing that we are not done the statistical part or the research part, which we will try to plan to do in the next future.
What are the foods rich in vitamin A? You have forgotten to add that one. What are the foods rich in vitamin A?
Which one, ma'am? I'm sorry, I didn't hear.
The foods rich in vitamin A.
Yes, sources. Okay, ma'am. Okay.
Sources.
Sure, ma'am. I will add it. I'm sorry, I missed it.
What are the? Just mention now.
Ma'am, voice is suddenly gone low.
No. What are the sources of vitamin A?
Mainly you can get for the non-vegetarian diets, and vegetarian diets you can go for your spinach and other things where you can get into the precursor for this thing is your carotene, which is plant derivative. The vitamin A beta carotene, you can get it from the plant derivatives.
Which carotene?
Beta carotene.
Okay. Are there any questions? If not, let us move on to the next poster.
Okay, thank you.
Thank you, Dr. Deepak. And our next presentation is e-poster presentation by Ms. Prerana on a topic of consumption pattern of prebiotics and probiotics development and study material in and around Kanangiri. I guess Dr. Tasneem Nahid Khan is back, ma'am. Could we go for that presentation?
Okay, finish it now.
Ma'am, I'm sorry.
Okay, you can just go ahead.
Okay, ma'am. Dr. Tasneem, kindly start with your presentation, please. Dr. Tasneem, you're not audible. Kindly unmute yourself and start with your presentation, please.
I think we can revert back to Ms. Prerana's presentation, e-poster.
I think so. That's better.
Yes, sir. Ms. Prerana is also not in the hall, sir. We will be continuing with our next presentation. E-poster present. Yes, sir. E-poster presentation by Ms. Grishma on a topic of a cross-sectional study on sleep quality and stress as related to hedonic hunger among college-going students 18 to 25 years.
I'm sharing the screen.
Yes, please.
Is it visible? Is this screen visible?
Now it is visible. Please go ahead.
A very good afternoon to respected dignitaries. I am Grishma Mulakkatte from Padma Shri Institute of Management and Sciences. Under the guidance of Ms. Sahana PR, we conducted a cross-sectional study on hedonic hunger and how it's impacted and how it's related to sleep quality and stress among college-going students. We chose hedonic hunger as our topic because we ourselves, being students, were not being aware of what is hedonic hunger, had little to no knowledge exactly to be said pertaining to this topic. Our objective was to understand how lifestyle modifications can partake in causing hedonic hunger and create an awareness among the population. We collected 308 survey answers via online questionnaire. We observed that 80% of the survey population were unaware of what hedonic hunger is, and 62% were aware, but 62% were aware of what mindful eating is. Still, 44% binge ate, and 88% of the survey population focused on the taste of food. Maximum agreed that stress does affect their food preferences and it does affect their sleep hours as well. We can conclude that hedonic hunger is experienced by everybody, not only college students, but everyone, but they ignore the warning signs and symptoms, which not treated or paid attention on time can cause erratic behavior, which can lead to lifestyle disorders such as obesity, CVD. There were limitations in our survey as well, such as in the questionnaires, there were hypothetical questions or situations that had to be judged by the participants. Sorry? Am I not audible?
No, you're audible. Please continue.
Hence, their opinions could vary. Also, some questions such as those pertaining to their current moods were difficult to explain because they did not adequately capture their respondents' emotions and feelings as well. I like to conclude my presentation.
Thank you, Grishma. It's a very interesting topic,
Thank you, sir.
and it's rare that such a thing is being done on a pretty young population. So thank you for your inputs.
Thank you,
Are there
sir.
any questions by the audience? It's a very interesting study.
I would like to know if before this term was mentioned, would anyone, like, even though we are in nutrition field, we were not aware of, most of us were not aware of hedonic hunger. This term was completely alien to us. So I would like to know if anyone, like, before explaining this topic or this term, anyone knew before this term where they were.
So you should explain it to the audience quickly.
Sorry, sir.
You could take a minute to explain hedonic hunger concept.
Sir, hedonic hunger is basically having food, like, it's like having food with, you're not hungry, but still there is no hunger present, but it is absence of hunger, you're having food, you're intaking of food. It can be because of your mood you're going through. It can be even though you had lunch just right now, still after a few minutes, because of your mood or because of some situation or lifestyle disorders, you will again want to have food. It's an absence of hunger, absence of physical hunger. Hedonic hunger is absence of physical hunger. You're intaking the food. That's
because of the stress which you are undergoing mainly. That is the main reason for that.
Yes, ma'am. Yes, ma'am.
That is the main reason. Okay.
Yes, ma'am. Stress, and also, yes, ma'am, stress and sleep patterns, lifestyle.
Our lifestyle has changed completely nowadays, and especially the teenagers and the students.
Yes.
And the type of the work they are undergoing and the lack of sleep as well as stress. If you talk to anyone, everyone says that I am stressed very well. So that means any job, wherever you go, people talk about the stress. So that is also changing our food habits also and intake of the food. Okay.
Yes.
Good presentation. Okay. Bye.
Thank you, ma'am. Thank you so much, ma'am.
Before we conclude, could I ask a question, please?
Yes.
Thank you. The question is like, as you mentioned hedonic hunger, of course, it's an alien term to me. I would want to know the consequences, like how it gonna affect our lifestyle.
Okay. Hedonic hunger, it's like when you're binge eating. We can see hedonic hunger, binge eating, these all are terms similar, yet they are different because the consequences is same. Like if you're binge eating, you can get obesity. Obesity can lead to various disorders, CVD disorders, atherosclerosis, various other disorders. Same with hedonic hunger. It's also related to psychological effects. Because a person is stressed, not only they'll eat, binge eat, but they'll also be stressed mentally, exhausted mentally as well. And it can lead to other, and hence, since the person is mentally exhausted too, it can cause harm in themselves. It can cause harm for their body as well. Like they may have not getting enough sleep, and they may gain weight because they're not sleeping properly, irregular sleeping schedules, like that. So this,
sorry to interrupt you. There is a saying called like, if we are deficient to certain amount of vitamins or minerals, after taking a meal also we will be hungry. Does it impacts these kind of lifestyle changes and all?
see, deficiency, definitely it occurs. Like if we are not intaking a particular nutrient for a very long time, it does, our body is deficient. But then nowadays, it's not only food. You're getting my point? Like nowadays, food is not the only factor. Like we need to be healthy. If holistic nutrition, if we get into it, it's mentally, socially, as well as nutritionally. Even if a person is taking a good nutrient amount of food, having a balanced diet, but their lifestyle is not supporting, there may or may not be cases that a person may feel still fatigue, may have some vitamins deficiency, that thing. Like nowadays, we need to look for an holistic approach.
Okay. Thank you so much.
I hope I tried to clear it.
I think even the pollution is also contributing, and adulteration is another thing, and environmental situation. As you mentioned, it is sort of the holistic approach, not only the food, considering of all the factors, which is really leading many of the things.
Yes,
So
ma'am.
lifestyle disorders, lifestyle disease is a very sort of simple word to pronounce it, but it's a very, very complicated thing unless you consider all the factors, all
Yes,
the challenges around us. It's very difficult to control that one.
yes,
Okay?
ma'am.
Thank
It's a
you.
wide, yes, ma'am.
Yeah.
It's a wide spectrum,
Yeah,
actually.
yeah. Okay, then thank you very much.
Thank you so much, ma'am.
Thank you. Our next presentation is e-poster presentation by Ms. Yashaswini SV on a topic of an observational study on stress-induced lifestyle and dietary habits among college students, 18 to 25 years.
Good afternoon, ma'am. Good afternoon, sir. Good afternoon, my co-participants. I'm Yashaswini from Padma Shri Institute of Management and Sciences. This was the topic which we in a group chose to do the survey on this. It's an observational study on stress management, induced lifestyle and dietary habits among college students between the age of 18 to 25 years. As just now, one of my friend Grishma and also session chair spoke about stress. My topic is on it, and yes, all of us do feel stressed. A small thing happens also, we feel lots and lots of stress. So what is stress? Basically, it's certainly a huge word with greater effect. So it can be positive, keeping all the cautions and also prepare us to be maintained strategic distance from the threat. And several episodes in a person's life can lead to negative feelings which develop stress in person. It can be kind of two kinds of stress that can be acute or also chronic. Acute is a short-term stress, chronic is a long-term stress. And there are four common stress, that is time stress, anticipatory stress, situational stress, encounter stress. These are the stress among students can lead to fear, uncertainty, attitudes, perception, then unrealistic and expectations in their lives, and also changes in their daily lifestyle, activities or routines. The main objective of my study is to study the prevalence of the stress among students and various methods to overcome the stress, and also to study the stress-induced eating habits in the college students. This was 300 sample collections which we did using a questionnaire which we prepared via Google Forms, and it was distributed to them. And we also stood there, explained to them what are the questionnaires and how we have given it and how it affects your life. And we have taken the SAT data collection. And coming to the result and discussion, as you can see here, the first image, the first pie chart shows stress impact on daily life. Most of the students, yes, they had effect in their daily life, like it can be either getting up or eating or meeting the people daily. So slightly it did affect their life, and very few had no changes in their daily life at all. And moving to this changes in food habits, almost 65 of them had no changes in their food habits. It remained the same as before. And the sleep quality, yes, for 74 of the samples, they had a good sleep pattern, and for very few, they had disturbances in their sleep. Approach during stress. This means when a student felt stress, whom they approached. Most of the samples almost approached to their friends and they shared it. And next, most of the students approached to their mothers. And consumption of the junk food. As we know, as you can see the picture here, consumption of junk food, here we are given options like ice cream, bakery foods, fast foods, fried foods, and carbonated drinks. Our students consumed all of this alternatively whenever they were stressed, and mainly carbonated drinks and fast foods were the most consumed food during stress. It can be any of the time they have consumed. And also the causes of the academic stress was because they were having low concentration, they were worried about their exams, and also they had lack of their self-confidence. And when this students mainly when they were under stress, they had different kinds of moods, different kinds of feeling. In that, the most of the students were having low mood with too much of worrying in them, and also they felt very irritable when someone used to talk to them, when someone tried to approach them, they used to feel irritable and they used to just not communicate with them. So I would like to conclude by saying, after our data analysis, we came to our conclusion that majority of the students in our survey were stressed. To overcome the stress, students used different methods, different techniques to overcome. Still, they would not overcome the stress. Here, we being nutritionist and dietitian, we suggested them vitamin C rich foods, which were used as antidepressants, and which also which helps in increasing the production of serotonin in the brain. So after referring to many of our studies and journals, we found out there were many stress busting food items, like it can be orange, then dark chocolates, green leafy vegetable, nuts, seeds. Using all these, we prepared and we planned the recipes, and we also mailed those recipes to the mail IDs we had received from our students. Thank you. Hello.
Thank you very much.
Thank you, sir.
Time to do a full oral presentation rather than this, because the topic seems to be quite interesting and quite related to the previous one by Grishma. I think
Yes,
both
sir.
of you were the same class.
Yes,
I'm
sir.
right. Yeah. So thank you very much. And you have been good enough to also present the students with some healthier options.
Thank
One
you,
thing
sir.
that shows up is that now the students are stressed, they tend to go towards unhealthy rather than healthy foods. I think
Yes, sir. Mainly
that
they
should
used to
be
go.
highlighted and made aware that you need not necessarily eat junk foods in order to get over your stress.
Yes,
That
sir.
should
That
be a
is why we
take-home
planned
message.
recipes according to the journals and all, using it like using healthier foods.
Brightness
Thank you once again. Can we go to the next presentation, please?
Thank you, sir. Thank you, ma'am.
Yes, sir. Our next presentation is a poster presentation by Ms. Akshita on a topic of the magnitude of malnutrition during hospital stay and post-care among adult cancerous patients.
Hello all, this is Akshita myself, and our topic is the magnitude of malnutrition during hospital stay and post-care among the adult cancerous patients. This is done in a group, and I have a group members of other three. And here, it was a very interesting topic for us to be chosen this. Very personally, we went like the objectives. What we took is we calculated the magnitude of malnutrition. Then we took certain factors to know the malnourishment rate, and we even thought for cancerous patient, physiological impact would be a great thing for malnutrition. Then even we studied on the post care. We even did the review. So by seeing, we have taken 100 cases. We have personally went to 3 cancer specialty hospitals. We prepared a questionnaires, and then we even took 100 of cases, from which we got a very great results. What we usually thought was cancerous patients would be more of malnourished, but while undergoing the project or our thesis, we could find that right now most of the cancerous patients are very well, and they themselves want to have 3 to 4 meals per day. So they themselves are overcoming the nutritional malnourishment. Yeah, even there are many patients who are malnourished, but still once the counseling is done and we took a review after 45 days, we could see that most of the cases, like almost 26% of the cases, there was a good result after coming back. We could see gain in the weight and even the change in their appetite, and even they had a good mood towards the food. All these things were seen. When going to the results, we can say that the overall BMI is body mass index, we can say normal was 45 among 100 cases, and underweight BMI was 28 among the 100 cases, and the overweight was of 18 cases. Obese 7 cases, and obese 2 comes 2 cases. By this we can see the normal BMI is of only in the higher side. And when it comes to appetite, mostly 50% it was like 50% could feel like low appetite, and other 50% had her good anger itself. And change in current weight, this was after the review. After the review, almost 30%, in this we can see almost 30% had a change in their weight. And this is a physiological behavior factor. So we took a mood towards the favorite food. So most of the patients, even if they feel of nauseated feel, if it was their favorite food, the mood towards the favorite food was good and they would wish to have more. So to tell overall, we actually underwent 8 to 9 types of cancerous, in which the breast and the GIT cancer was of more higher side. When seeing in these types of cancer than in other all cancers, GIT cancer was in the higher side of malnourishment. Maybe because it might be because of their not able to have properly, and most of the cancer patients seem to be in stress most of the times. And for this, they were always asked to be physically active and to have one or the other thing in intervals. And we could even see most of the patients were really physically active only. And the factors which to find the malnourishment, what we have taken is type of therapy, stage of cancer, appetite, and some few more we have taken that were like BMI, lifestyle, etc. And okay, we could even see that most of the cancerous patients were in the type of therapy was chemotherapy. Very few cases were in radiotherapy, and very few surgeries, surgical cases was also seen. Even the medical management was also seen, but chemotherapy cases were of the more higher side. And when it comes to stage of the cancer, when it was first and second stage of cancer, after the 45 days review, we could see that there was a very good nutritional improvement in first and second stage of cancer. But we couldn't see a much betterment in third and fourth stage of cancer. In most of the third and fourth stage of cancer, the patients were bedridden. They were not so physically active also. But the results would clearly indicate that the appetite and the weight was increased by 10%. And I would like to conclude that among the 100 cases, 60 plus cases are maintaining a good nutritional status. 60% of the GI tract patients comes under malnutrition. Most cases are physically active, and we would ask the patient or the patient attender to we would educate them about the diet and what kind of diet to be taken. And we would even suggest in counseling the patient to be very physically active and to have the meals in, even if it was a small meal, to have in each and every interval. And I would like to thank everyone for this opportunity to present our project here.
Thank you, Akshata.
Thank you, sir.
Are there any questions?
when you talk about the cancer cell, it is it spreads very fast also. Okay. So
Yes.
now when you are just talking about the counseling of the cancer patient, and once they recognized, once they identified that they are suffering with the cancer, any type of the cancer, the treatment is always there. Okay. With that treatment and your counseling, how far it will be really helpful? Maybe in the early stages, it may be a sort of useful, but not, I don't think, at the later stages. I mean, cancer itself is a very complicated issue, I'm just telling you.
Yes,
Which
ma'am.
when I see people know, they try to link everything for the diet or the nutrients and that and this and everything. So for the sake of talking, we can talk it, but really to understand the true sense of it, it's not that easy, I tell you. I'm just maybe for talking something on lobby or something, you can just say, if you really understand the physiology and the process of this. See, everybody is having the cancer cell, but its growth is very wild, actually. I'm telling you, very fast also. If the early recognition is there, okay, to a certain extent, we can save the patient. But after what you can just say, later stage is very difficult. But anyway, good presentation is there. But anyway, we should understand the pathology behind the growth of the cancer cell. Okay, good
Thank
luck.
you. It's a very vast topic to
Yeah,
explore, ma'am. Yes, ma'am. Thank you, ma'am.
Okay, where we start, where we end, also we don't know sometimes. There's so many factors will be coming into the picture. Okay.
Yes.
Bye.
Thank you, ma'am.
Okay.
Thank you.
Thank you all.
Our next presentation is e-poster presentation by Ms. Monia Pushkar Kulkarni on a topic of a review on detection of microbes in solid food matrices using dye reduction test methods. Ms. Monia.
Hello.
Yes, Ms. Monia Kulkarni, kindly share your screen and start with your presentation, please.
Yes, yes.
Ms. Monia, are you facing any issue?
Yes, actually, but I'm trying.
Okay. Kindly drop your presentation in the chat box. No, I will be sharing if you have no issues.
Actually, I'm joining from my phone because my laptop is creating some issues. So unable to send anything on chat box through phone. I had shared it on WhatsApp, but I think they are not able to do it. I'll just try it. Just give me a moment.
If you don't mind, just could you, we will be moving on to the next presentation. You could do next.
Okay, sure. Okay.
Okay, thank you.
It strong body, it also memory. Prostate, chest, throat, liver is organ function coming.
Our next presentation is by Ms. Monica Sood on a topic of phytoconsistent mineral and sensory attributes of brown rice based instant porridge mix. I guess we didn't have Monica Sood, ma'am. We would continue with our next presentation, oral presentation by Ms. Afifa Kazmi on a topic of indigenous foods to cope with malnutrition.
What is the number?
20th presentation, ma'am, Ms. Afifa Kazmi.
20th. Okay.
Yes.
Am I visible?
Yeah.
Yes, you are. Please go ahead.
My slides are visible?
Yes.
Good afternoon, everyone. My name is Dr. Afifa Kazmi. I am a PG scholar in the Department of Unani Medicine in Government Tibbi College and Hospital, Patna, Bihar, India. Topic of my presentation is indigenous foods to cope with malnutrition. My topic will be delivered under the following agendas: introduction of nutrition, malnutrition, Unani concept of food, traditional foods prepared by indigenous food items, and the conclusion. To start it with introduction, according to Park's Book of Preventive and Social Medicine, nutrition is a science of food and its relationship to health. Nutrient or food factors are organic and inorganic complexes contained in food such as carbohydrates, fats, proteins, vitamins, and minerals, which can be metabolized to create energy and chemical structures. Failure to obtain sufficient nutrients causes malnutrition. According to Unani system of medicine, food is the basic necessity of life and existence, and also fundamental part of culture. We inhabit different parts of the world, and nature has adjusted our physiology according to the native food items of that area and environment. Ghiza, that is food, is defined as that which has the potential to become part of the body and also helps in badal matahallul, that is repair or replacement of damaged and dead cells, tissues with the healthier ones. Actually, Indian traditional foods are the foods within a particular culture available from local natural resources and are culturally accepted. The way we eat and how we prepare food reflects our values, beliefs, and the history of our region. Earlier, we used to prefer natural and local foods over refined foods. Our traditional meals were mostly plant-based with spices and were a combination of cereals, millets, pulses, and spices, satisfying our energy and protein requirements. The foods were balanced, diversified, and freshly prepared, but not stored. But with global colonization, traditional food habits have suffered, resulting in skyrocketing of malnourishment-related diseases. To improve nutritional well-being, dietary diversification, along with homestead production and indigenous food consumption is a better option that also enhances social, economic, and environmental benefits. To take this initiative further, the Government of India introduced a Vocal for Local campaign in 2020. Indian traditional foods are the immense variety and the diversified preparations not only offer the whole range of nutrients, but also activates digestion and several physiological functions. In the context of India, the myth that at every 2 kilometers, the language and the food habits changes is truly acceptable. Bihar, located in the eastern part of India and is the third most populous and 13th largest state in the country. It is one of the strongest agricultural states. It has a rich legacy of its own traditional indigenous foods. Following are the traditional food items of Bihar, which are very popular and culturally accepted as well. Litti chokha, prepared with multigrain flour, sattu, and some vegetables. Khichdi, having rice and millets. Kadi badi, ingredients are Bengal gram flour and curd. Chana ghugni, that is cooked Bengal grams. Tilkut, main ingredients are jaggery, til, that is sesame seeds. Dal sagga, containing pulses and spinach. Dal pitha, main ingredients are pulses and rice flour. Chuda, that is flattened rice. Kheer makhana, having foxnut or makhana and milk as main ingredient. Lai, prepared with puffed rice and jaggery. All these traditional foods are consumed in their original forms as they were created, not modernized, not processed, or not packaged, and has a long history of supporting good health. Now I'll be showing some of the popular indigenous food crops which has the potential to cope with malnutrition. This is makhana or foxnut. It is highly rich in energy, carbohydrates,
proteins, and minerals like phosphorus, potassium, calcium, and sodium. Some of the popular preparations of makhana are kheer, barfi, pakoda, chapati, kalakan, laddu, etc. Similarly, sattu is also a rich in energy, carbohydrate, protein, fibers, minerals like phosphorus, potassium, magnesium, iron, etc. It is majorly prepared from roasted Bengal grams, but some other grains can also be added like wheat, soybean, maize, and millets. It increases its taste and nutritional value. It can be consumed as sharbat, paratha, litti chokha, chila, bharta, etc. The next is jaggery. This is obtained from sugarcane, rich in energy, carbohydrates, protein, minerals like potassium, phosphorus, iron, magnesium, etc. Jaggery is better replacement of sugar as jaggery is digested slowly and helps in absorption of calcium. It is used to prepare tea, lai, tilkut, kheer, etc. The next is the grains which are popularly known or grown in Bihar, that is millet, pearl millet, finger millet, foxtail millet, maize, wheat, rice, barley. These grains are highly rich in energy, protein, fibers, and minerals, and are used to prepare foods like khichdi, chapati, chilla, etc. I would like to conclude my presentation. Implementing the nutrition policy of going back to our traditional diets will not only accelerate progress towards targeting global non-communicable disease threats, but is essential to build healthier and more resilient populations that are better prepared to deal with future health emergencies. This is my team. I will end my presentation with the quotation. There is a lot of food culture that goes on in the home and in the community in non-traditional ways. Food is a lot more than restaurants. Thank you.
Thank you, Ms. Kazmi, for an interesting presentation from Bihar. Could I know if there are any, you did present a few of the dal preparations like dal saga, but are there any lesser known legumes and pulses in Bihar with which the rest of the India is not familiar?
Sorry, sir?
Do you know any of the pulses in Bihar which are not so popular in the rest of India? For example, all of us are familiar with tuar dal, with urad dal and moong dal, right? But then are there any specifically which is quite unique to Bihar?
Sorry.
Fava beans, sir.
She has mainly covered only the traditional foods, but not the indigenous. She has given the title as indigenous foods are less consumption and less, what you can say, less utilized food materials she has to cover. Because if you go to the tribal area, you get a lot of unconventional food materials that we call as indigenous. But here you have just given all the traditional food preparations, traditional foods consumed in Bihar. I mean, that's what I understood. The title is not actually suitable for our topic. What do you say, Afifa?
Hello. Yes, ma'am.
See, you have given the title as the indigenous foods, but you have given all a sort of the traditional foods.
Ma'am, actually, I have mentioned the traditional foods which are made up of indigenous foods.
See,
like litti chokha.
Screen open just now. Okay. But till, good, and all these things are used in a traditional things only. Anyway, it's all right. Because now people are talking about the indigenous and the less utilized foods mainly. The emphasis is there on that.
Okay, ma'am. Thank you.
Okay. There are no questions. Should we move on to the next one?
Yes, ma'am. Our next presentation is oral presentation by Dr. D. Jhansi Rani on a topic of physicochemical analysis and anti-diabetic activity of bay leaf powder. Ms. Jhansi, could we have you, please?
Yes, ma'am.
Okay, kindly share your screen.
Is my screen is visible, ma'am?
Okay, yeah.
Yes, it is. Please go ahead.
This is Jhansi Rani from Dr. NGP Arts and Science College, Coimbatore, Tamil Nadu. My presentation title is about physicochemical analysis and anti-diabetic activity of bay leaf powder. And small introduction about my title. Bale has enormous traditional uses against various diseases, and it contains many bioactive compounds, and it has considerable amount of nutritional and medicinal benefits. It has been used as a herbal medicine for the management of diabetes mellitus in Ayurvedic, Unani and Siddha systems of medicine. And my objective of this study is to drive with this suitable drive method to evaluate the proximate and phytochemical composition of the dried bay leaf, to evaluate the anti-diabetic activity and functional characteristics of the dried bay leaf powder. And materials and methods for my studies. The collected bay leaves were washed and wiped with cotton cloth to remove the moisture from its surface and were cut into small pieces. The small cut pieces of leaves were subjected to drying in cabinet dryer. The pre-prepared bay leaves were spread in a tray uniformly and kept inside the cabinet dryer at temperature of 60 degrees Celsius separately. And the duration taken for drying of bay leaves was about 5 to 6 hours. This slide which shows the processing of bay leaf powder and determination of nutrient.
Dr. Jhansi, sorry to interrupt you, like your slides are not moving.
Yeah, now it is okay.
Now?
Now it is okay.
Yes, ma'am. Determination of nutrient composition of bay leaf. The nutrients like moisture, ash, carbohydrate, protein, fat, wood fiber, calcium, iron, phosphorus, and vitamin C was done. The following methods. Moisture and ash was done with AOAC method and protein Lowry's method. Estimation of crude fiber is done by acid and alkaline digestion method. Carbohydrate is done with Anthron method. Fat AOAC method. Calcium and iron. Calcium and vitamin C was done with titration method, iron and phosphorus calorimetry method. Then qualitative analysis of phytochemicals on bay leaf powder. The phytochemicals like alkaloids, turbinoids, tannin, phenol, flavonoids, steroids, coumarin, glycosides, saponins, and quinones was tested in the powdered bay leaf. Next one is evaluation of functional properties of bay leaf powder. Some analysis on bay leaf is to determine the shape, size, and distribution of the dried powder. And redox analysis is also done to identify the mineral composition present in dried bay leaf powder. FTIR analysis also done to identify the bioactive compounds present in bay leaf powder. And the anti-diabetic activity, alpha amylase test was done on bay leaf powder is to identify the anti-diabetic activity. The results, nutrient composition of bay leaf powder indicates the moisture content was 1.8 gram, ash 1.5 gram, carbohydrate 21.9 gram, protein 0.98 gram, fat 0.04 gram, crude fiber 0.8 gram, and vitamin C 3.2 microgram, iron 1.4 microgram, calcium 75.6 microgram, and phosphorus 39.2 microgram. And the phytochemical results,
The phytochemicals such as alkaloids, turbinoids, tannin, phenol, flavonoids, steroids, coumarin, saponin and quinine was present, and glycoside is absent in phytochemical analysis, and the anti-diabetic activity. The sample concentration of 150 microgram, 90.2% of anti-diabetic activity was present in bay leaf powder. Next one is some images of bay leaf powder with different nanoscale and EDAX analysis. This result shows the presence of silver, chlorine, carbon, and oxygen. Next one is functional groups present in powdered bay leaf powder. It shows the presence of amide group, alcohol, alganes, silica, nitrile, cyclic alganes, methyl group, phenol group, ether, carboxylic acid, aromatic cyclic ether, primary amines, aliphatic chloroform, and halogen compounds. So it may be concluded from the present study. It indicates that bay leaf powder is rich in nutrients and phytochemicals, and same analysis reported that dried bay leaf powder particles are ununiform. The mineral composition of bay leaf and EDAX shows the high amount of silver in leaf powder. Then FDAR result signifies the presence of various functional components, and bay leaf powder shows the positive result in alpha amylase inhibition assay, and it has anti-diabetic activity. So it can be incorporated in many value-added products.
Thank you, Ms. Nancy Rani.
Open for the questions.
I wish you had shown us a photograph of a bay leaf so that the audience could understand what it was. Okay.
Sir?
There are no questions. Shall we move on to the other participant?
Madam, I am there.
Yeah. Who?
Dr. Tasneem.
Acha.
Good afternoon, madam.
Good afternoon. I hope we will succeed this time.
Could I share the screen, ma'am?
Please,
We are trying, madam. Roshni, madam, we are trying.
Okay.
Is it visible, madam?
Yeah.
Good afternoon, everybody. After a long wait, now I am going to present 5th International Conference on Food and Nutrition. And next, please. Welcome. Next. I am going to present the title of the project is Dietary Approach for Management of Undernutrition. Myself, Dr. Khan T. Nahid, and my associate is Josna Nerlekar, Department of Foods and Nutrition, Parvani. The objectives of the study were to develop ready-to-use nutrient mix for undernutrition, to evaluate the acceptability of products prepared from the developed mix, to evaluate the nutritional content of RTU mix, to determine the anthropometric measurement of the selected underweight women, to assess the nutrient intake of selected underweight women, to assess the impact of developed mix on underweight women. Methodology followed: development of RTU nutrients mix, preparation of the products from the developed mix, organoleptic evaluation of the prepared products, nutrient analysis of the developed nutrients mix, then storage study for 90 days, microbial count of nutrients mix, acceptability of the products prepared from the stored nutrients mix, cost analysis, awareness on undernutrition and health related complications, and intervention study. It is a wholesome study, full study. Then the selected protein and energy rich foodstuffs for the preparation of the nutrients mix are given here. Am I audible, madam?
Yes, yes, you are audible.
wheat flour, soybean flour, groundnut. These are the nutritive values taken from the nutritive value book, Indian Foods of Nutrient. And these were the taken for the preparation of the product. This is the picture, development of the ready to use nutrients mix. Center, this is the nutrients mix is there. Then these are the different ingredients which were used in the preparation of the nutrients mixed. Now this is the formula for the preparation of the nutrients mix: wheat flour, soybean flour, groundnut, sunflower seeds, skimmed milk powder, and sugar. These roasted the sunflower seeds, remove the coating, and then roast the groundnut, make the powder. All these powders were prepared. Sugar also in the form of the powder. Roast wheat flour and soybean flour and mix thoroughly all ingredients. Next, preparation of the products. Different products were prepared and tried. Traditional recipes from the nutrients mix: roti, biscuit, and lapsi. This is again the detailed methodology. Organoleptic evaluation was carried out of the selected 3 traditional recipes: roti, lapsi, and biscuits. And sensory attributes of the products were evaluated by 9-point Hadanik scale for their different organoleptic characteristics. The nutrient analysis of the nutrients mix was carried out, that is proximate composition following AOC method, and mineral content determined as per the standard procedures. Then storage study was carried out. In that one, stored the RTU mix in 6 polypropylene bag for 3 months period at ambient temperature and prepared the products fortnightly and evaluated the acceptability. Then microbial study was carried out for this one: cost analysis, awareness under nutrition and health related complications through talk, lectures, and demonstrations. Then institutional level ethical committee was formulated following the ICR guidelines. In that committee, chairperson, medical practitioner, member from the other institute, legal expert. This is the committee formulation structure. It is given by the ICR. And then after the formulation of this ethical committee, it was briefed the objectives of the clinical work to be carried out. This is the structural diagram for the intervention study, which was carried out for 120 days. Selected underweight women having the BMI less than 18.5, 60, having the age group in the 18 to 15 years. They were divided into 2 groups: experimental group, control group. Experimental 30, control 30. And for these 2, pre and post evaluation was carried out for the anthropometric measurements, height, weight, and BMI, and biochemical parameters, that is RBS, random blood sugar, hemoglobin, and lipid profile. And also their diet survey for 24-hour recall method for 3 consecutive days was collected. These are some glimpses which is indicating here that preparation of RTU nutrients mix is going on in the laboratory. Cleaning of the ingredients at large amount, roasting, then weighing, and preparation of the packets. 35 packets per day distribution were required to the experimental group. Weekly preparation, we have done 245 packets. Total packets prepared were 4,200 to distribute for 120 days. Then this is the intervention study, RTU nutrients mix on selected underweight women. Distribution of the RTU packets, their anthropometric measurements recording, then biochemical examination with the help of the doctor, physician, then diet survey, findings of the study. Nutrient composition of the RTU nutrients mix per 100 gram is given here. It is indicating here that an RTU nutrients mix is high in protein content, fat, and energy content. These are the values which are indicating here that it is more. Next, the mean sensory scores for the product. Products prepared from developed mix were very well acceptable. All the products were very well acceptable. The mean overall acceptability scores of the products prepared from the RTU nutrients mix before and after the storage. Overall acceptability is given here, and it is also indicating that overall acceptability scores above 7 indicated that after the storage it was in acceptable range. Then microbial count was also in safe range after the storage. Then mean anthropometric measurement of the underweight subjects were recorded pre and post for the experimental group. It is very clear cut from the findings that there is an increase in the weight. Statistically, increase was found, and also BMI was also there. It was indicated here that weight is increased with 3.8 for 120 days, means it is indicating on an average 1 kg per month there was a increase. Then this is the mean nutrient intake of the underweight subjects was taken. that is pre and post evaluation was also percent adequacy was calculated. And here the statistical significant differences were recorded in their protein content, in their fat content, and other nutrients also. The mean biochemical parameters of selected underweight subjects are given here. That is hemoglobin, fasting blood sugar, cholesterol, and all. And it is also found that there is the change, especially we can see here that the HDL is increased after the consumption. Statistically significant difference was recorded. Thus, it can be concluded from the study that products prepared from the developed nutrients mix RTU were very well accepted by the panel members. The developed nutrients mix was high in fat content, protein, and energy content, which is helpful in gaining the weight. Cost of the ingredients for nutrients RTU mix is 15 rupees per 100 gram. Daily supplementation of 100 gram RTU nutrients mix for 120 days helped in gaining weight by 3.80 kg of underweight subjects. Hence, it can be concluded that supplementation for 120 days exerted positive effect on underweight subjects for gaining weight. Hence, we can recommend protein and energy rich ready nutrients mix prepared with wheat flour in the proportion of given here, that is 20:20:10:20:10:10 is recommended to include in daily diet of underweight women in the form of the roti, lapsi, and biscuits for gaining the weight. Thank you very much for patient hearing and also for giving me the opportunity to present in the international conference. Thank you.
Thank you, Tasneem. You have done a wonderful work. But your product has been commercialized?
No, sir. No, madam. We are
Why
trying.
You are trying now?
Yeah, we have popularized it through demonstrations and giving the KVK and Mahila SHG groups like that.
That is okay. That's perfect. But what about unless some industry takes your product, it will not go to the market?
Yeah, madam. We are trying at university level for tying with for preparing the patent also for that one.
And are you suggesting to introduce into the ICDS programs or the midday meal programs, whatever it is, the government programs?
Yes, madam. Yes, we have given it to the ICDS also, this formula.
Are they using it?
That follow-up we have to take.
Yeah, that is more important. See, working in the laboratory is one aspect, then bring that product to the commercialization is another aspect, and for using regularly by the needy people is a third aspect. All the three aspects you have to really link it.
Yes, madam, we are trying for linking.
Okay. The floor is open for the questions.
I guess there are no questions, ma'am. Could we move to our next presentation?
1 minute. Okay. Which one? Next one?
We are going back to our presenter, e-poster presentation by Ms. Monia Pushkar Kulkarni on a topic of a review on detection of microbes in solid food matrices using dye reduction test methods.
Okay.
Ms. Kulkarni, are you there?
Yes, ma'am. I'm there. Ma'am, can you please share from your end?
Yes.
Yes. Yeah, thank you so much, ma'am.
Just give me a moment. Kindly start with your presentation, please.
And this was a work started in that, and I have in the coming days. So starting from the introduction, in India, about 100 million cases were estimated of foodborne diseases in 2011, and it is likely to rise to 150 to 117 million in 2030. So food that are contaminated may not look, taste, or smell any different from the foods that are safe to eat. So the quantification of metabolically active microbes is essential to prevent foodborne illnesses. Since several methods are labor-intensive, error-prone, time-consuming, and expensive. So the need of the study here is because most patients have mild symptoms of short duration and do not seek medical care. Some of them who seek medical care, they don't do the laboratory test in order to determine the specific etiology. And out of those who seek the medical care and also get diagnosis confirmed, but they are not reported in the system. So this happens mostly in the rural areas where documentation is very poor. So the need of the study here is, or the purpose of this review is to present the idea of using dye reduction tests for detection of microbes in food products. Additionally, these tests can be performed locally by the less experienced staff, which is especially identified in the rural areas. So the usefulness of borrowing the concept of dye reduction test has resulted in detection of microbes in many food products like meat, fish, maple sap, and other various milk products, and that also the literature is available. So the dye reduction tests, basically, which are commonly used dyes, are methylene blue, rezazorine, and triphenyl tetrazolium. There are other color change indicators also, wherein they are used for to identifying the microbial content, such as indole test, urease test, oxidase test, citrus utilization test, and so on and so forth. So here comes the major difference, that the milk products or any liquid products that are being used for the especially MBRT, that is methylene blue reduction test, are liquid in nature, and that's why it is easy for following the procedures for the reduction test. But when it comes to the solid food products, the most important part here comes of the size reduction. That because if we broadly classify the microorganisms or the contamination in the solid food products, that could be surface contamination and inner matrix contamination. So the microorganisms that are present inside the food matrix are also needed to be dislodged and brought into the sample or the solution. So the first step comes here is the size reduction, and then followed by homogenization or proper mixing, and then later on the stages of identifying the microbial load with the proper dye reduction test analysis. So the flow could be here as the introduction of the sample with a suitable buffer in a sterilized container, homogenizing the sample, then enriching or concentrating the homogenized sample in some of the whenever needed, and then following up with the analysis of the homogenized sample with the dye reduction test methods. So in lab, we tried out few dye reduction, few food samples with this dye reduction test, like chapati, tomato, carrot, boiled egg, paneer, and with different concentration of methylene blue dye, and and also the temperature. So the certain factors, so concluding overall the idea, the certain factors that affect the reduction test could be the temperature of incubation, then the color, then dye
control the cross
light. Tests require modification in order to identify the microbial content of the food product. And also it can supplement with a kit for a platform test in order to determine the microbial content of the food products. So this review is nothing but basically can be connected to a very famous quote saying that if you want new ideas, you have to read old books. So taking up help from the conventional or having a long history of dye reduction tests, especially MBRT for milk product microbial analysis, we can think also of the solid food matrices, and also for the especially the fast food also, and other indigenous and traditionally prepared food products as well. So thank you so much, and I'm open for questions.
How much of a problem did you face with the color of the food itself interfering with the decolorization of the dye?
Sir, it could be because there are other factors also like pH and the water activity, and also the oxidation potential, and the temperature. There's so many factors that different foods will be having differently. So there would not be any specific or standard procedure for all the solid food matrices for this diet reduction. It could vary, and it could we'll have to check with each.
That means that you have to individually standardize for each type of food, wouldn't it?
Usually set, right, sir? You're correct, but difficult looking at the variety of food products that we have. So we can have a range in between, like from pH this to pH this, or from water activity this to water activity this. Whatever food products lie in that particular range, maybe we can have a process for the diet reduction tests.
In the case of solid foods, since the microbial contamination interior is probably lesser than what will be at the surface, rather than homogenization, I would say stomacher kind of some extraction of microbes would be much better off.
Yes, sir. To some extent it is correct, but when it comes to like a stomacher kind of an instrument, it is very expensive. It comes to around 2.5 or 3 lakhs. So when we are focusing into the or we are targeting basically rural areas and their shops, or maybe rural colleges, so to get that instrument, it would be very difficult. And also it comes with the cost of the bag, the paper, the plastic bag that the stomacher we need to put in. So it is a very expensive kind of a machine altogether. So we can also have an alternative machine wherein we can sterilize that container, or maybe we also thought of having some design modification for certain equipments or instruments wherein we can sterilize, and also with very less price we can use it for a size reduction or homogenization kind of activity.
Okay, let me share a trick or secret with you. You can do the stomacher same kind of extraction by putting the sample with water or any other buffer, and sealing it, and then plus kneading it by hand for a required amount of time. I agree with you that the stomacher is really an expensive piece of machinery, but you could do a via media with this kind of extraction. And the one more thing is the disadvantage with the homogenization is that you require a different a new homogenizer container every time. That will be even more tough. Every time you can't sterilize what you call a blender jar for this purpose.
Correct, sir. That is correct. So we can think of something like a straw based or something wherein the jar can be we can or maybe some material wherein just blades can be removed separately, and the other part of the container can be sterilized just using the autoclave also.
So,
hello.
Yes, ma'am.
See, did you use this type of the test to any of the state food safety laboratories? Are they doing it there? Because you mentioned it is in the rural area, but now people are very much conscious about the quality of the food material. That is where SSI and all those things have come. Okay.
Yes.
Now, the state food laboratories also, they are trying to identify these microbes or whatever the alterations and all those things. Do you have any discussion with those people, and are they implementing this test?
No, ma'am, they are not implementing this test. As of now, whatever they are doing is they are following the standard method of a standard plate count could be, and also as sir said, they are using the good labs they do have stomacher. So they are using the stomacher equipment in order to crush the solid matrices, and then they are following the standard methods like spread plate or maybe strict plate, and identifying the microbial load.
So no, but if you just say it is a sort of useful in the rural area, if you really standardize the technique, I think maybe that is one of the way to at least to implement in almost all the rural areas.
Yes, ma'am.
See, because you have really tried to find out something, but that has to be in a sort of the applicable manner.
Yes,
So
ma'am.
for that, some other agency has to really take care about that one. Okay. I mean, that's what I'm just really asking you, because this type of things is very in the rural India and the rural areas. Any number of work what you are doing, still there is a lot of work we have to do it.
Yes, ma'am. Yes, I'll keep in mind, ma'am, and I'll definitely reach out to all these state laboratories wherein I can get more information on this.
Thank you.
Yes, ma'am. Thank you so much.
Thank you, ma'am.
Thank you, ma'am.
Thank you. And we will be taking our last presentation of our day, e-poster presentation by Ms. Prerana on a topic of consumption patterns of prebiotics and probiotics and development of study material in and around Kengiri.
Good afternoon, everyone. I'm Prerna BK, and I'm from Padma Shri Institute of Management and Sciences. The topic for today, the topic which I'm going to talk about is consumption pattern of prebiotics and probiotics, development of study material in and around Kengiri. So prebiotics and probiotics are known as functional foods. Prebiotics can be defined as digestible food ingredients that positively affect the host by selectively stimulating the growth or activity of bacteria in the gut. While probiotics are the live microorganisms that are shown and known to have health benefits when they are consumed or administered in the body. Both prebiotics and probiotics have multiple benefits for the human body. It improves the gut health. It helps in better digestion. It lowers inflammation, maintains good digestion, have antioxidant properties, and improves the immune system function. The Indian diet includes natural foods that are rich in prebiotics and which can be developed as probiotics. While they have been abundant in the Indian diet, tradition did not set out the scientific understanding and evidence of the advantages of these foods decades ago, much like they do today. So for our study, there are 4 objectives that we wanted to find out through this study: to determine the consumption pattern of prebiotics, to determine the consumption pattern of probiotics, to understand the gap in consumption pattern of both prebiotics and probiotics, and development of study material. There were 600 participants in this study, and the study revealed that most of the participants were aware of prebiotics and its health benefits, but prebiotics was a very unfamiliar concept to the general public. Through this study, we have also observed that cereals, vegetables, and fruit-based prebiotics were mostly consumed by the population, while dairy-based probiotics and cereal-based probiotics were the most consumed food items by the participants. For understanding the gap in consumption pattern of prebiotics, and probiotics, we have come with the conclusion that most participants lack the knowledge or lack the awareness and time to prepare the probiotic products. They also had their preference of smell, taste, and texture when it came to probiotic products. So we developed a study material that emphasized on what probiotics and prebiotics were, including some benefits of probiotics and prebiotics, and also a few recipes that they could develop and incorporate in their diet. So I would like to conclude by saying that India is a diverse land with diverse culture and even more diverse food habits and patterns. But healthy living can be common among the masses, and spreading awareness about potential benefits of both prebiotics and probiotics can help bridge the gap of understanding despite the differences. Thank you, ma'am.
Thank you, Prerana.
Thank
Do
you
you have
so
any
much.
questions for the speaker? In that case, I think I would request Dr. Vijayakadar to give us a summary of presentations made today. We were 5 papers, I think we were unable to, or further 4 papers were unable to be presented due to various issues.
No, but let us check first who have not presented. I think let us, because for our safety. Number 2 is not there. Number 2.
Number 2, I think Sangeeta she was absent.
Then 8, B. Sridevi.
8, yeah, Sridevi.
Oral presentation, no.
No.
Is it okay?
Yeah, Dr. Tasneem Khan, she was able to present. So, but Tasneem Khan, initially she was unable to present, then later on, at the end, she was able to present. So, no problems with that.
Then number 17, no.
17, yeah, I think it was presented.
No.
Akshita?
She has presented, sir.
She has presented, yeah, she has presented.
She has presented, huh?
Yeah, she has presented, madam.
And
then 19, I don't think it was presented. Am I right?
19 is not there.
19th is not presented.
Not presented. So 1,
2, 3. Total
3, only 3. Yeah, that's not bad. Not bad.
It's in fact good.
Yeah.
Let's not use the word bad.
Yeah, initially we thought it was going to be bad, but fortunately, technical issues were resolved. So.
Anyway, it's really very, very interesting. Dr. Raghunath and Roshni and Ramya. Today's topics really a sort of the very, 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 very topics are they starting with the chia seeds and their what we can just say the improvement of the what we can just hypertension, glycemic index, how it is affecting the hypoglycemia and hyperglycemia, and the benefits of the fiber content in the chia seeds. She spoke very well. Then probiotics from the NERA, which is a very, very because upcoming subject that is we have to talk about it, because so far nobody has started with the NERA mainly, and I'm really happy that she has started that one. And underweight and the cataract determination, glucomia, and all those things she has talked about it. Concept of the food in the traditional yoga, because nowadays everyone is talking about the yoga, and because nowadays what happened, our physical activity has been really reduced. So that is why now yoga is helping to certain extent to maintain our health, physical health as well as mental health. And then effect of the naturopathic diet on obesity also, that is also very interesting, that especially she spoke about the Swatic diet and all the things. And another thing is nutrient diet in an athletic person performance, dietary fiber and gut microbiome. And another thing is dietary management in undernutrition. And then another thing is what we can the vitamin A in oral health, and sleep quality and stress, which is the need of the hour, I can easily say, especially among the youngsters, and the stress-induced lifestyle. And I think the determination of microbes in solid food and indigenous foods and the cope with the mobility. Betel leaf powder, which is an unconventional food, which she has already said that. So on the whole, it is sort of the variety of the publication and the presentations were there, and a lot of information has been provided. I'm sure this information will be, they are going to be a sort of put it in the proceedings so that it will be useful for the younger generation mainly for that. And I really congratulate the organizers for giving me the opportunity to spare so much of time and to evaluate all the so many, because it's already 3:20. We started at 11:40. It's a long duration.
Long
for
innings.
the people, the senior citizens is really sort of the taxing. I tell you, one thing I tell you, I thought maybe at least 5 or 6 papers evaluation is much easier, but It is so many 21 papers in a day, a test stats. So that is what I'm just saying. But one more suggestion I would like to give to the organizers. Please separate the oral presentations and the poster presentations. Because that is having it a different type of the valuation. Poster presentation is having a different type of valuation. Maybe anyway we have to, this suggestion you can just consider in the next time and then try to put it down. Because otherwise, the evaluation pattern affects when you are just putting everything together. I don't know how we are going to separate these poster presentations and the oral presentation. This is my suggestion. So you can do it as per your convenience. I also thank Dr. Raghunath very patiently interacting with all the speakers and then supporting them and even supporting me also. Thank you very much. I hope we will meet some other time in some other conference. Okay.
Yeah, definitely. We hope to meet in person rather than virtually.
Yeah, definitely. Maybe in your university, because I cannot invite because I am a retired person. I am not in any of the universities.
Well, I am also retired, madam.
I see. Okay, yeah, correct. But anyway, world is too small. We'll be meeting some other time.
Definitely, madam.
And
I'd like to just take a minute aside to
please.
Highlight some things that often our ancient things like yoga and traditional food, that Unani concept or the yogic concept has been sort of sidelined and they have not been able to come into the mainstream. And I'm glad that some effort is being made to bring them into mainstream with a more scientific approach.
Yes.
And that would, I think, go a long way in making them much more popular and much more acceptable to the general public rather than at present. And I'm also happy that a lot of interest is being generated on the probiotics and prebiotics. In fact, we had a very nice presentation in the keynote today by Dr. Nandish. And I'm also glad to see that there are a lot of experimental work being done on that. Although there is a lot of general papers, but I wish more people would come up to do experimental things on probiotics and prebiotics, because general paper presentation is okay, but it becomes passe after a time. So I would encourage all my younger colleagues to go into more of this. The experimental part is rather easy, so it should be pretty, easy for even with a limited means of at your disposal, you could do this work. Thank you, and I would like to thank my moderators, Roshni and Ramya, for their excellent coordination and the help in downloading and then presenting on behalf of the speakers themselves. So that solved a lot of technical problems. Thank you very much.
Thank you, sir. Thank you, ma'am, for taking out of time in your busy schedules and chairing the sessions. Before we conclude our conference, I would like to suggest all the participants kindly turn on the cameras for the gallery image. I repeat myself, I request all the participants kindly turn on the cameras for gallery image. I repeat, I request all the participants kindly turn on the cameras for the gallery image.
Roshni, Ramya is missing there.
Yes, Mama. Just give me a moment. I will ask her to turn on the camera.
She's busy, maybe. Yeah. Kavita.
Ms. Ramya is here, Mom.
Yeah, I have seen her. One more here, the Kavita, somebody, I think, speaker.
I think the third screen, a lot of people have not turned on their camera.
Yeah.
Yes. Thank you, ma'am.
Okay.
Before we conclude our session, I would like to express my gratitude to each and every person. And there are many other upcoming conferences and events from our USFN side. The upcoming thing is USFN has been collaborated with Symbiosis Skills and Professional University, which is a webinar on food safety and hygiene, farm to fork. I request each and every participant kindly have a glance on this webinar also. It's gonna be a great session. Thank you.
Thanks to everyone. Hope can we leave
How are
now?
you, madam? Vijaya madam? Vijaya madam, how are you?
Fine, fine. Who is this?
That is Dr.
Tasneem.
Yeah. So anyway, it is nice.
You remember?
Pardon? Yeah.
Yes, yes. Yeah.
Sorry to interrupt you,
Come,
ma'am.
Parvani. Now I'm also returning.
Is it?
Come to Parvani, madam.
Yes, definitely.
Come to Parvani, I am saying.
Definitely.
I am also retiring in next year.
Next year. So you are going to join my group.
Yes.
Senior citizens group.
Okay, fine. Thank you.
Okay.
Yeah, thank you. Fine.
Thank you.
For certificates, all the participants kindly have a glance in the chat box. I have sent you the certificate download link and the procedure to download your respective certificates. Even we will be sending you the mails, but kindly take the screenshot of the procedure for your further references. Thank you. Next, I would like to give a vote of thanks for the great conference. To say thank you is such a prayer that cannot be seen or touched. It must be felt by heart. I feel honored and privileged to get the opportunity to propose a vote of thanks on this special occasion. I would like to thank all the honorable dignitaries, committee members, session chairs, and invited speakers who blessed us with their presence. I'm also thankful to all the attendees for both the days of conference. If time is money, then today you have spent millions for us. Thank you all for making this event successful today and yesterday. Thank you.
Thank you.
Okay, thank you very much. Should we leave now?
Yes, ma'am. Thank you. I wish we will be having communication for rest of all events.
Sure.
Thank
But
you.
make it short. But not so many
It was
presentations.
a pleasure chairing the session with you, madam. Thank you very much.
Thank you. Thank you.
Yeah, so Roshni, I just want to ask you something.
Yes, ma'am.
First of all, it was a wonderful experience and thank you to one and all. I just want to ask that, if a participant has also been a co-author in one of the presentation, in the main oral presentation, it is fine that the certificate is there, but if the participant is also the co-author, so in that case also the certificate is issued?
Kindly contact Ms. Ramya, ma'am. She will be.
I'll do. I'll do.
Thank you.
Thank you so much. Yeah.
Thank you. Thank you all. Now you could leave this Zoom. Thank you.
Okay.
Thank you, ma'am.
Hey, Vibha, जल्दी से कैमरा ऑन कर देना।